Welcome to the In Season podcast, rated R for language.
None of us are doctors or neurologists. The things you're about to hear are opinions of people living with epilepsy or seizures. These are firsthand experiences. Epilepsy can cause speech problems, and the medications are hard to pronounce. So please bear with me.
Epilepsy can cause bad memory, so some stories will be repeated. I'm Pookie. Get ready.
This was so funny, guys. I was outside having a cigarette and I had the notifications on. So I got that motion notification and I'm looking and there's Athena and my pillows are flying off the bed and she's nesting, right? And it has a microphone. I can talk through the camera.
Yeah.
I'm surprised she didn't wet the bed because she turned into this statue all of a sudden. And she was looking all over the room and I couldn't stop. I just couldn't stop tormenting this poor dog. I'm like, you can't find me? Am I over here? Am I over there?
I do the same thing with my dog. He's like always looking, and I'm like, get off my bed. And I'm not here, so.
Oh yeah, a little bit of fun, but haven't seen anything frightening yet. I'm just not sleeping, and I know why. We all know why. I mean, we couldn't get my arm back into the joint the other day, and we almost had to go to urgent care. Urgent care won't touch it. And I'm like, so what do I do? Well, you have to see an orthopedic. I already did. Well, you probably need surgery. And she's looking, you need surgery, but they won't do it. So they said, I have to learn to live with this. You can't. Okay, will you tell them that? And that was over the weekend. And I'm like, I'm so tired. So last night I was sitting here on the couch and my daughter heard it before I felt it. And she just went, not again. Yep, there it goes again.
Right. There it goes again.
Yep, it won't stay in the joint. And I'm like, okay, well, oh well.
And they just expect you to stock up on ACE bands? I mean, that's not even going to help.
How do you put an ACE bandage on a shoulder?
That's what I'm saying. What do they expect you to do?
Right, and my insurance won't approve any more injections or physical therapy. They already approved the surgery, and this doctor just won't do it.
What are you thinking, Rick? You're still muted.
How did I do that? Okay, sorry. So first of all, with the Depakote, I had felt so much muscle fatigue, like I couldn't even bring my arm up to sign a birthday card. So yeah, that's definitely, I think, yes, you'll get sleep because you'll be fatigued, but I don't think it's worth it. What led your doctors to think that you had liver disease? If I missed that, I'm sorry.
In 2023, I had to have emergency gallbladder surgery. And the primary care provider that I was seeing was suspended. So I had to get another primary care provider right after surgery, like within a week. And this person that I was referred to, I thought, okay, this will work, for now. Her main focus was Ozempic, my weight. She never even did, there's two missing post-op evaluations, 2 concussions and 2 strokes that she never submitted evaluations for. And I was questioned about that. And I'm like, yeah, no, she never did any of that. But she wants me to lose weight. And it turns out, and I could be wrong. I took it personally then, because of the way they talked to me. She sent me in because she felt that I had what she called tortuous veins of the spleen. If you did anything past Anatomy 101, you know that that's a normal and desirable occurrence. Okay. But she said, oh, well, after gallbladder surgery, this, that. And I'm like, that is anatomically correct. I am not worried about that. Well, your weight, this, that. I go to see this specialist who wanted me to get the MRI, but he said to me, you know, you don't start losing weight, you're going to need a liver transplant.
Oof.
You've got fatty liver disease. And I'm like, I don't know what's making y'all think this, but I'll go do the test. I don't understand all of the hepatic and, you know, that stuff. I'm more anatomical where it comes to the spine, the joints and such. But I didn't understand all the terminology, and I'm looking at it and I'm like, this doesn't really sound that bad. And I just let it go. Still lost 30 pounds, still, you know, moving forward until yesterday when my oncologist tells me, whatever made you think you have liver disease? And he was able to look at that MRI right then. And he's like, oh, I've got words for your primary care provider. Okay, can you send me a copy? You know, so it's like, okay, I do not have scarring or fatty liver. I have a normal liver for someone my age who never used alcohol. That's it.
Yeah,
So,
but I was curious.
yeah,
because
but yeah, the Depakote for your reason, Rick, I'm like, yeah, on the fence because I'm more likely to get injured when I'm that fatigued.
mhm.
So that is like, yeah, that's part of the conversation. That's why I'm doing this. It's like, yeah, I really need to make an informed decision, and this is amazing that you guys are helping me do this. But yeah,
I think Kevin's been on Depakote or is on Depakote right now. But
yeah,
Yes, I am. And it's been a trouble in the past. I've had issues with fatty liver, and it's under control now. I haven't had a blood test in a while, and I'm hoping, I don't think several years I've had a blood test, but hopefully they'll issue that in my next appointment in December. I'm hoping they'll. It's good now, my recent blood test, but
and it doesn't
we'll
make
see.
you, yeah, but you're not like lethargic or incredibly fatigued.
Oh, yes, very, very fatigued. It's difficult to get projects started, and it's difficult to focus. Very difficult with concentration. I'm also on clobazam, which and pyramid. They affect that as well.
Yeah,
So yeah.
yeah, clobazam. I could not.
I
I can't even.
stopped taking that 2 days ago. I've been
Yeah,
weaning myself off for 4 weeks from 20 milligrams twice a day, just cutting it in half every week, and finally stopped it 2 days ago. And I can't tell my family, but I do feel better,
yeah,
more
right,
aware.
right. Yeah,
congrats.
I'd rather have the pregabalin back, but you know, yeah. Oh, who did we lose? We got somebody new in.
Right.
Okay.
All right, welcome to any newcomers. Usually the first questions, if you're up for it, is what medications you're taking, when were you diagnosed, and when was your last seizure? So feel free to jump in anytime. I'm Katie, by the way.
Oh, I love it. I mean, when Kate takes over, it's great.
Just want to practice. I'm telling you, off the clobazam for 2 days. Usually when I stop taking medication after 2 days is when the bad ones come. But today I've only had one focal and I was aware the whole time, and that's a first. That's absolutely a first. I knew what was happening. The trembling was there, the twitching was there, but I could see it. And at this point, I remember it. I couldn't get words out, but I, made it to where I had to go and just got out of the heat. I think it was the heat that brought it on. I got to drink a ridiculous amount of water when we spend time outside. It's annoying.
May I ask, was it easy getting off the benzo? Because I've heard it's extremely difficult coming down off those. Like
Honestly, there's so
withdrawal
many
and
other
stuff.
stressors right now. I would blame anything that went wrong on, the divorce of the toddler. So
Okay.
yeah, I think
Don't
that
blame the
the
toddler.
benzo pales in comparison.
Yeah. All right. All
But
right. Thanks.
yeah, you can definitely do it. And I would say gradually is important. So like when I was taking the 20 twice a day, it's the pills are whatever they call that when it's got the line in the middle, and I just
Yeah.
made sure to mark that date on the calendar of 10 in the morning, 20 at night, then 5 in the morning. And when I noticed I was definitely having more earlier in the day, that's when I just, took it away from the PM dose instead of the AM dose and just went week to week.
All right.
But I'm excited for no bad ones. That's a first.
Yeah,
That's definitely a first.
that's one battle I'm looking for. Well, looking to is getting off my benzo, but right now I gotta go up on the Excopri and get off the Vimpat at the same time, basically. So my head's got a lot of adjusting to do between that before the battle with the benzo.
I got something here.
Oh, two new members.
It says, well, let's get some introductions before we start. Christian, and I think
Hi.
the other guy said his name was Amit. Hi, Christian.
Hi.
We usually start with a camera would help, but it's not necessary if you don't want to. We
Um, yeah,
usually start with. Oh, go ahead.
how do I do the camera? Oh, can you see me now?
Uh,
I see a video icon. If you're on a desktop, I see the video icon on the bottom left of the screen. Oh, there you are.
there you go.
Yes, you made it. Oh, so proud of you. Thank you for coming.
And the other guy, his name Amit or Amat. I couldn't remember what he wrote.
I see AMIT of it in the chat.
Oh,
Oh yeah, yeah.
well,
Curry Lord right there. Yeah, he said so.
Yo,
we'll start with.
can you guys hear me?
Yeah, I
Yeah,
can
yeah,
hear
now we
you.
can hear you.
Oh, hi. Yeah. Well, yeah, my name is Amit. Just a little bit about me. I had my last seizure in May, and I'm on Vimpat, Keppra, and gabapentin. So that's a little bit about me.
When were you diagnosed?
I was diagnosed back in August of last year.
Oh, okay. Yeah, we usually start with what are you taking? When was your last seizure, and when were you diagnosed? Christian, what about you? Or Kristen? I'm sorry.
I'm Kristen, and I'm currently in the EMU right now, if you could tell.
Oh yeah, I talked to someone
Um,
yesterday that was in the EMU as well.
I just had my SEEG on Monday, and my last seizure was on 7 days ago. And then I am on they're decreasing Bravax, and I'm currently on only Vimpat, hoping to provoke a small seizure soon so I can get out of here.
Yeah, I like the head jewelry. Uh, anyway,
You're a warrior.
nice cap you
Absolutely.
got
We're
there.
proud of you for joining. Thank you for both of you for coming today.
Right.
Did you come with any questions or topics that you wanted to jump into?
Are you talking to me?
Yeah, both of you, everybody.
Have you guys has anyone gone through phase 2 testing of the EMU at the EMU?
I
Me,
know I
no.
had to, so let me clarify what that was, and I can remember a little better. I had a couple surgeries for the RNS implant, and prior to that, uh, about 10 EMU stays, just for all the clarification of what they needed to approve for the surgery. So phase 2 testing, can you remind me what that entails?
Phase 2 testing, from my understanding, is the EEG, or I'm sorry, the SEEG, and yeah, I think that's what it is.
Okay, yeah, so I did have to have the invasive EEG, and I was blessed not to have any of the side effects or the potential infections and things that they warn you of, but it was definitely not a pleasant stay. It was the beginning of like no more privacy.
Yes, yes, I have zero privacy here. Zero.
That's what
Yeah,
stood out to me too.
yeah. Privacy and independence is gone. It's out the window. It's not coming back. Yeah, so I got something here. It says, can a vibration plate cause trigger seizures? Has anyone had experience with this? I have a history of seizures, and the only new thing I've introduced into my routine recently is a vibration plate. Since Monday, I've been using it daily for about 30 minutes to an hour. It's one of those whole body vibration platforms used for circulation, lymph drainage, etc. Today I had a seizure episode that felt different than usual, and now I'm wondering if the vibration plate could be a potential trigger. I know sensory stimulation or nervous system activation can sometimes play a role, but I haven't seen much about this specific kind of equipment in relation to seizures. Has anyone here had seizures triggered or worsened by a vibration plate or any other unusual symptoms from using one? I'd really appreciate insight or personal experience. Thanks in advance for the advice. Um, I haven't had a vibration plate and I don't know exactly what it is. Uh, yeah, this is one I have no clue what it is, and I don't think I want to give advice for something like that. Absolutely no clue. Um, Anybody
Well,
else?
Mommy Kate has her hand up.
I would say just like anything else, if it's safe for some, it's not safe for others. Take it one step at a time. I mean, the vibration plate, as far as I know, is an exercise machine. It's recommended for those who are not as capable, I guess, of high intensity exercises or can't kind of get out for a run, but it's the way it stimulates your muscles by just keeping balance, staying tense and staying on the plate. But apparently for some with epilepsy, it is not recommended because of the frequency, I'm assuming. I'm not sure. I'm going to read up on it a little bit, but just like everything else, have somebody there. Don't go at it for more than 5-10 minutes for the first couple sessions and see how you feel for maybe hours or days after. Who knows what keeps this thing going? Because whatever it is, it's getting into you.
It could be a trigger for that person, particularly vibrations.
Yeah, that's the other thing. Everybody does kind of have their own triggers.
So vibration plate would be like, is it something you lay on?
From what I see, you stand on it, so it's about as big as a I can't think of it right now, but it's like 2 feet wide, 1 foot deep, like big enough to stand on. And I'm sure there's some kind of control that turns it on, and it moves, and you're supposed to maintain a good posture and work the muscles that are used basically to maintain balance and stand, and it's stimulation for your muscles. So it is good exercise, especially for those who might not be as mobile. What's coming to mind here is all these like long COVID sufferers who don't have the respiratory capacity to just go out for a walk anymore, and maybe an indoor treadmill is too big. So maybe the vibration plate would be the next best thing, or one of those sit in the chair and pedal machine type things. But if there's any risk for seizures, I probably wouldn't go for this. I mean, then again, too, if you're having uncontrolled seizures, a vibration plate is something where you're standing. So that could be asking for more issues too if you have a surprise one, unexpected.
Yeah.
If for people who don't have auras, because that's something I've never had.
Yeah, I don't have auras either. Just when it happens, it's too late.
Yeah, I think people with I've been looking up, and I think people who tend to have absent seizures and stuff like that tend not to get their auras. So
Okay, I got something else here. It says, just been diagnosed. Hi, I'm mainly looking for advice as my doctor has been slightly unhelpful and dismissive about what I can or cannot do. I'm 21 years old and just been diagnosed with genetic epilepsy, and I'm being prescribed lamotrigine to start with. Now I'm 21 and I'm fairly big party guy. I drink a lot with my mates, and I'm being told that I'm basically never allowed to go clubbing or drinking in excess again by my doctor. But I wanted to maybe hear people's stories or get some sort of advice on how to deal with it in this moment and how to deal with it moving forward. I'm starting university in September and want to get some clarification on what to do and what not to do, not just in the sense of drinking, but in lifestyle, hobbies, and mental struggle of it all. Thanks for whoever responds. The drinking part, I'm going to highly suggest not drinking. I stopped drinking just on Easter, but figured I got to be an example for the people I'm talking to. Um, I don't suggest drinking with these medications at all.
yeah, drinking lowers the thresholds for seizures, so more seizures will come through probably for that. The clubbing, it matters. You can probably still club, but if you're photosensitive, then I suggest not to, definitely. Um, but it's all sensitivity, and you have to be aware. Like, you can still live a life. I have gone parties and stuff and still been able to, do things that doctors advise against. But, my friends were always aware of me. So,
At this point, I think it's going to be, in so many words, grow up, adapt. This is something you have to live with now, and yeah, you need to make changes.
Anyone else? Advice for this kid? He's 21. What do you tell a kid that wants to drink but can't drink?
Sorry, kid, you can use your, yeah, it's like you choose your path to death in this situation. That's as harsh as it sounds. Yeah. When the doctor said no, don't drink, why didn't the doctor explain why? I think that's important because I didn't take it seriously, and I was on my way to a higher a nursing degree, and I had no idea. But I think when we're younger, it's even harder, because that social pressure is, that age is tough. It's like, oh, I want to drink. I'm that age. I should be okay. But you have to take the epilepsy seriously, or it'll take you more seriously. So, and that's just, you can't make them listen, but yeah, just don't do it. You don't want to find out how bad it is.
Rick, you got something?
Yeah, I was just going to say, there's a lot of things you can do without alcohol. There's a lot of things such as going to concerts if you can go to the club and dance a bit or hang out. Go watch movies, go to bonfires, go hiking, go camping. There's a whole bunch of things that you can do that doesn't involve alcohol. And there's things you can do that don't involve other things that could be triggers. Like if, flashing lights is one of the triggers, then okay, certain movies you can't see. There's a lot of things that you can do with your friends and, still have an active lifestyle that don't involve lowering your threshold to have a seizure.
On to the next one. Since epilepsy, return to work. I have reflex epilepsy and multimodal or multi-modal triggers, meaning I have myoclonic tonic focal seizures from light, sound, movement, even thinking. So it's very hard to avoid, especially in a workplace. I can have anywhere between 1 to 100 plus daily, and they can be violent. I had been off work for 2 months and now have to come back on a graded return for a 4 hours per day. I used to be a full shift, full time person. It's been 4 weeks of that already, and I don't foresee the hours increasing for some time as I am still seizing. I am working remote. Work doesn't see the extreme end of it. They don't know I work from a dark room with sunglasses and earplugs in to prevent fits. I just look normal. They seem to be ignoring my return to work plan from the neurologist and trying to fit as much work as possible in the short hours I have, which makes my graded return to work redundant. In fact, worse as there's less time to do my normal work. I want to push back, but it's hard because it's a fine line between feeling like I'm not doing enough, but also not doing well enough to meet their expectations of what I can do. My role also requires in person speeches, education, which isn't something I can do right now. I can't tell them that I'm still fitting as they already made a big WHS deal over it. I don't want to lose my job. Is anybody else going through this or have any advice with this struggle? Personally, I haven't got fired or nothing like that or been through that situation. I think all my seizures just got too worse to my family was like, you got to quit. So I haven't been fired because of it. Just been let go or put on leave. Well, put on leave mostly, not let go.
Yeah, I went through back and forth on medical leave until I ran out of FMLA time. Then they had to let me go. But it's just trying to get your seizures under control is the most important thing. And if you need your sick time and your medical time, I think that's more important right now. Yeah.
Lucy.
Okay, so this one was about somebody being diagnosed and then losing their job.
No, he says that I got to go back through it because you know how that memory goes. Basically, he's not able to do the full workload that he was doing with the half a shift that they put him on now. So he's like, how do I push back, basically, and without getting fired?
Oh, that
Yeah,
definitely sounds like an HR route. I mean, that's the purpose of a union. If you're in that kind of environment where you have like a
Yeah.
representative of sorts or somebody to assist you in, wording this right and sending it to the right person. Talk to somebody else in the company who's there, whose purpose is there to help you. And if not, just, approach it with some common sense. Know what you're going to say when you go there, why you can still do this job, why you still deserve to be paid what you're expecting for doing the job, and I don't know. I always used to think when talking to the employers to have a plan B if they have an answer ready, kind of know what you want to say back.
Yeah,
Yeah,
the
definitely
farmer.
be your own advocate there.
Say that again.
I'm sorry. Yeah, definitely be your own advocate there, and also, have a good document ready that shows this is what I'm able to do. You're setting expectations on both sides. What do they expect of you to be able to still do? What you can bring to the table, and that way you hopefully you come to a good meeting point, and then that should take away a lot of stress about, oh no, they're going to let me go, or oh, they're going to expect so much of me. But if you set the expectations with them, you should be able to work it out. That's what I've done in my last 2 jobs.
Yeah, I think it would work out well, like if you've been there for a while and you talk to them, and that's what it sounds like. Ask them, like, get your doctor to say certain accommodations you need. I don't suggest leaving like I did, because, well, I would say mines are bad, but he did say he's having 100 plus a day, and some of them are violent. Um, so yeah, that sucks. I couldn't imagine 100 a day, even if they're just vocals.
That sounds like some inpatient stuff.
Yeah. Um, the next one says, how epilepsy ruined my life at a young age. During a game of basketball when I was in high school in 2016, out of nowhere, I had my first seizure my senior year in high school. I'm sorry, you guys. I thought I seen something. During a game of basketball when I was in high school during 2016, out of nowhere, I had my first seizure. I had my entire life planned ahead of me. I was taking college credits for aircraft mechanics at 17, only needed to take a year to graduate. I had a full ride scholarship, so everything was paid for. I loved doing the work, but my seizures got unbearable at one point, and I was having 7 seizures a day and couldn't take it anymore. One day, I had a seizure, and with the power saw in my hand, and I sadly had to drop out of school with 6 months left to graduate. I would have graduated school making 75K in the South, which is extremely good money, and then 100K after 3 years with no debt. My seizures were so bad that I spent 3 years in and out of the hospital while living at home, doing nothing, and had over 300 seizures during that time. At one point, my vision was blurry. I was losing my hair, and then at one point, I couldn't even stand up. Finally, around 2022, realizing all the medicine was not working, when I went to another doctor and found out I had a brain tumor. I finally got brain surgery while my vision got worse afterwards, and I went to pursue my bachelor degree. But then I kept having seizures. They eventually stopped, but I just hate how I had my life prepared at such a young age. I stayed out of trouble and was a very religious person, but it all backfired. And now I graduate college in a year expecting to make half of what I would have made if I was able to stay, and will now be in debt for the rest of my life. Sometimes I can't even go to sleep at night thinking of how good I would have had it. And out of all people, why me? I would have had 100K, and now graduating college, I'm only expecting around 50 to 60K in debt, and in debt forever. I am now 24, but I had a life plan at 17, but sadly, epilepsy ruined my entire life. I'm still not able to drive. Some of my hair never came back, and I had to get a stronger eye prescription due to the surgery. I'm still recovering from health issues and depression from those moments, and still not able to live full life. If you're listening to this, it gets better. It takes time, but it gets better with time. I've been dealing with this for 20 years, and I've been through that mad depression to where angry at the world and angry at everybody that it happened to me. Why me? Like you said, it gets better with time. You just gotta. It takes time, and I would just say not just go about your life, but yeah, don't let it get to you, which is hard to say. Don't let Try to live your life. Don't let it hold you back from certain things.
So really try to
Hi,
keep a
yeah.
clear head about it too. Go ahead, Angel.
I was just gonna say, yeah, I was diagnosed young too. I actually wanted to be a pilot, but yeah, there's nobody going to be a pilot with having seizures. But yeah, it does get better with time. You know, you're going to be there. There's like a little process you got to go through, and that first is the denial and everything, and then you come to terms with it and you accept it. But I always feel like that when we're young, we just adapt to the lifestyle that we have to live now. There's still things we can do, you know. It's just not what we wanted to do.
Yeah. The things we didn't want to do. Yeah, that's very spot on. I keep. I think we are talking about something about a shame spiral the other week. We always go back, and it's very very common to you always go back in your head and think what would have been, but that's and you say, well, just don't do that. It's so easy to just say that, but when you think, I well, and but all the compromises like you made through your life and all the compromises you made for your health and what would have been, but it's difficult to throw that away. I know, but here we are now, and uh, I can't reconcile that those two points. It's a rock and a hard place, that shame spiral and telling people to throw it away. I have to I have to acknowledge that that anger and that guilt. It's comes with the territory. Um, but yeah, just do what you can to move on. I don't know. That's even I didn't believe that, but okay.
Yeah, in that first 5 years
No,
was
but
the
I mean,
worst.
even not feeling genuine, it is what you have to do. I mean, having to reprioritize your life at the most inopportune times is something we've all had to do. But that's why, I mean, in their example and anybody else who's just getting diagnosed at like the worst time in their life, that's why a group like this and having others seeing people who have been successful with epilepsy would have been so much more useful back then to see that I have a chance of still not only starting your life, but actually doing something with your life, even with this condition. You just gotta get it under control. That makes it sound way too simple, but sometimes it takes somebody just telling you to take a look at your priorities, see what's important, and you can get over this. You can handle this. It can still be worse. I don't know how else to say it. Like you said, rock in a hard place.
Yeah, don't let your disability hold you back from anything. I mean, some things you have to, obviously, but I don't want to say, don't let it, would the word be hinder you?
Mm.
Don't
Yeah.
let it like hold you back. If there's things you want to do, there's plenty other things you can do. You got to find hobbies with this epilepsy stuff because it can take everything from you if you allow it to. And yeah, mine was the worst in the first 5 years, and then I eventually just got over it. But yeah, the denial and the hate for yourself and angry at the world, that's how my first 5 years was.
But if I may add, it did get better. My health did get better. So I have to add that. I mean, so yeah, I know I said all that negative stuff, but my health did get better. So
Hey,
I
Important
Em,
got
point to make.
the question was someone said epilepsy ruined their life. He said he had a lot going. He wanted to be, I think, a mechanic or something like that. But he was 17 and he was like, I was going to make this amount of money and get out of debt, I guess. And now he's 23 and he's not doing what he wanted to do. What do you say to that person who got it at 17 and now they're 23 and I'd say kind of depressed?
Yeah, that sucks. And I'm sorry to hear they got diagnosed at 17. That's so unfair. Do you know what kind of epilepsy they have?
Um, I think the person did say, I can't remember, but it's a lot to read and go back through. But
All right, I'll just assume they just have epilepsy. And to watch out for myoclonic jerks. They said they couldn't be a mechanic, so I'll just assume that's in there, some kind of thing that physically not able. I mean, check out different trades that maybe are similar, but or even like something adjacent to mechanics. I'm sure they're out there. Even like working front desk there. You know, I'm sure there are jobs related to it. And then doing that will probably open you up to other jobs you don't know about. But to address the depression, yeah, epilepsy ruined my life too. Before I got diagnosed, I had to stop running. I was in light manufacturing and I really loved it. But every time I looked at an LED, I threw up. So I feel you. I feel like sometimes people just need to get their anger out, and that's fair. And if they can ask their parents to send them to a therapist, one they actually like, that would be good too.
wish I had a therapist back then. Anyhow, anybody ever took lamotrigine, Lamictal?
I took Lamictal before. I'm trying to remember the side effects.
Hair
It,
loss.
it, it's a good. It's not as bad as some of the other ones. It's a good mood stabilizer, but it can make you tired and um I remember everything, like all the side effects
A
that
lot
I
of bad
faced.
ones. Yeah, I faced a lot of the worst bad ones. And like you said, it does make you drowsy. I just took it a little while ago, but you guys doing this keeps me awake, keeps me going, including breakfast that I haven't touched, and it's past noon. But anyhow, it says lamotrigine insomnia. I take lamotrigine 100 milligrams in the AM and 100 milligrams in the PM. How the fuck is it that I'm so fucking sleepy and dumb all day, but as soon as I try to sleep, I'm completely wide awake and I just can't fall asleep. I'm so frustrated. I just want to be asleep. I have work in the morning. FML. Oh, fuck my life. I've been taking this for over a year, but in the past 3 or so weeks, I just cannot sleep at all. I feel like crying. What do I do? I take Lamictal and I take 200 milligrams a day, twice a day. It does cause insomnia because I have it now and I can't sleep. It's so hard for me to go to sleep. For some reason, it's so much easier for me to nap in the daytime so much. And at nighttime, it's so hard to
Yeah,
fall asleep. And like, I thought my triggers would be like sleep. Come to find out, my triggers aren't sleep. I can stay up playing video games till 6 and 7 in the morning, and I'm wondering why I'm still not tired. And eventually, I get tired once I take my pills, and I'm like, oh, I've been up 24 hours now to take a nap. Um, so yeah, lamotrigine, it does cause insomnia. You got to look at these pills before you start taking them, and that's what I didn't do. I didn't look at side effects. I thought, okay, this is gonna work for me. It'll slow down my seizures, which it did. But side effects, doctors aren't gonna tell us. Like I said, most of those doctors, they're on a don't ask, don't tell. So you got to ask and do your own research because they're not going to be our advocate.
Yeah, same with some pharmacies too. They won't tell you everything, but if you got a good pharmacist, um, ask them, and they should tell you everything. Consult with them. Um, but most of the time, it's like what you said. You got to be your own advocate and do the research yourself.
That's one thing I wish I would have learned at a young age, about, help with the prescriptions and the pills, the side effects and everything. Because you only see a doctor like once a year and for like 15 minutes. You're in and out. And I think you deserve I know they're busy, but we deserve a little more information about, what this is going to do to us. And,
Yeah, if I could have
that's
told
it.
my younger self something, I would have basically said, "Don't be so ashamed of wanting a second opinion." I don't know why that it felt like there was some stigma around that. Once your doctor tells you something, like you're betraying them if you don't like what you hear, so you want a second opinion. Somebody else look at these scans and tests and try and tell me I really do just need to keep adding on more medications up in the dose and then keeping on this like revolving door kind of cycle. Yeah, I definitely would have told my younger self to talk to other doctors a lot sooner.
Yeah, I think the younger self, depending on the age, like for me, between 14 and 18, I guess I didn't have no say. The parents had the control of what I was taking. And then after that, it's like, I got out of school. I don't want to do no more research. But yeah, I wish I did too. You know, it's like, you really do gotta look at it. You gotta look at everything it interacts with and what you shouldn't take with it either. Because it could even be foods that set it off, such as grapefruit or chamomile.
That's a really good point. I think grapefruit even like diminishes the levels of it in your body.
Hey, Jeff.
Hey, Poke, how are you?
I'm all right.
How is everyone?
I'm good. You
Hi,
didn't have a
Jeff.
problem logging in, did you?
No, I was at the doctor getting an epidural in my
Oh,
back,
no.
and then I'm on the way back home, taking the chance that my wife won't throw me out of the car. An epidural is it's kind of a numbing shot in your back.
Yeah, I
Um,
know. I had a few of those. I mean, I watched a few
yeah,
of those happen. Yeah, it's rough.
yeah. I've had several, uh, and I'll probably go back in a couple of weeks for an AC joint injection.
So does
What's
this
that?
one kick in for you pretty quick? Feeling better yet?
It doesn't really. I feel better from the numbing agent that they put in. It doesn't really kick in for about 2 weeks, and then I hope it gives me some relief as long as I'm here.
There you go.
And I'm on the way home, and then I'll just black out the camera for a while I eat lunch, and then I'll be listening, but I'll be blacking you out.
You
Okay.
enjoy
You don't
it.
want to see me eating a hoagie.
Jeff, next time you get in the car, just get a helmet in case your wife really decides it's time.
She said she wouldn't throw me out.
Yeah. Yeah, we're on to her. Yeah, she knows. I know. We don't want her to have to do that though either. So behave.
And she's not going to mess with you. That's for sure.
Oh, I think we would get along really well. Something she's been putting up with you, bro. I have a feeling I would get along quite well with that woman.
Yay, Annie! Yay, Annie! This is the wife talking here. How are you?
Yeah, I'm good. I can tell. Yep. We would probably be friends because yeah, I love how you do it.
That's Liz.
Hi, Liz.
Hi, Annie.
Hi, Liz.
Hi, everybody.
Hello.
Hey,
I feel
hey.
privileged to be on your chat with you for a few minutes. Jeff was concerned that, I would not want to do this. And I said, no, I would like to do this because I would like to hear and learn the same way you've heard and learned all this time that you've been on the chat. So please don't let me interrupt any longer, and you all proceed with your conversation.
And Liz talks a lot more than I do, in case you couldn't tell.
Oh, I'm
Oh,
sure.
we're very interested in having her anytime.
And ask any questions you have, Liz. We can learn a lot from caregivers as well as fellow people with epilepsy. So yeah, seeing it from your point of view is really helpful for all of us. So
Everybody's perspective counts.
yes.
Thank you.
She's been my caregiver for 24 years now. Even more than 24 years.
39.
Before I got epilepsy.
Well, you only have epilepsy for 3 years.
Right. So she's been taking care of me since I met her.
Lucky you.
That's love.
I am lucky, and it is. It is
There you
love.
go. Beautiful. So is anybody else suspicious of clinical trials? I saw a test, another post, and it says I qualify. Once again, we'll call you on Monday, and that I don't know if I should ever accept, treatment for payment. Is anybody else ever done one of those?
I have a question too about this, Kate. If anyone knows, it seems like after you get accepted, a lot of them turn out to be like for dangerousy medications.
I plan on asking them, then doing my own research and deciding at that point. A lot of times, I think if it is something like that, I'm probably just going to get turned down because of the breastfeeding. I don't know at this point if it is even for a medication or if it's for a procedure, but I see paid clinical trial and, just want to hear them out at least.
Yeah, I'm interested in the non-invasive kind, and even that kind of scares me, but I'll definitely be talking more about that as I find out. But yeah, I have to agree with M. Usually when it's a paid clinical trial, those forms that you sign to get that payment include legal jargon, so you cannot sue them if any harm comes to you. Anytime, and tell me I'm wrong, but if ever you do any clinical trial, especially if it's a drug procedure, anything, read every word, have somebody else read it for you, see if you come up with the same concerns, etc. Because I won't take a drug or do a surgical procedure that hasn't been tested. But even then, we don't know. But yeah, usually those paid trials, there's a potential for harm. Yeah, I remember, and I was thinking about this, and just throwing this out here, tell me to shut up. But going through this consideration for another medication, I couldn't remember who, what, when, and where, and I don't have all of my records. And I've been in contact with a few of my previous doctors. And my favorite here near Buffalo said, I remember talking to you about a clinical trial that you were presented in, I think it was like 2015, 2014, and it turned out that it was for Xcopri. And I turned it down. He said, it's not a bad thing. This can't hurt you. And I'm like, oh, you're kidding. So it's like, okay, maybe this will work because it's more targeted. But yeah, Xcopri was one, obviously, any of them, Vimpat had to be tested. All of our medications have been tested, hopefully. But yeah, I mean, maybe let's say I'm older and I'm knocking on the door. I will be like, okay, I'll try it. I'll try it for the sake of my fellow warriors, but right now I don't want to take a chance like that. But yeah, if they're offering you money, there could be something there you want to know about before you sign.
Okay. I'll definitely keep that in mind.
Oh, I have this one in particular. It says marriage. Anyone just struggling maintaining a marriage. I don't remember last week, so the fact that we argued about whatever 3 weeks ago just literally doesn't exist for me. I'm sorry that this happened. I truly am, but I'm not ever going to be the thing they want me to be. It's like 5'9" and they want me to be 6'5". I don't know what to do. I need help here. Everything is going to fall apart. Help with marriage and seizures. I had never been married, but relationships, none of my relationships have been ruined by epilepsy, but I'm a child. I mean, some people. Not a child. I'm young and still going through my prime. So, marriage, anybody? Anybody have problems at home? Has your medication ruined your marriage or?
I have input, but I kind of want to hear from people who are married currently
Um,
Technically, I'm still in
or
that
going
boat.
through a divorce. Going through a
Yeah.
divorce too.
Technically, I'm still married. 15 years, so pretty much all of my prime with him. Epilepsy, maybe I used as a little bit of a crutch, saying I definitely don't make enough on this SSDI. I was definitely too proud to ask for help until I really needed it to just be able to get out of that situation and actually, keep my children and the quality of life they deserve. But that's the only thing I could really associate epilepsy with the downfall of that relationship is I used it as too much of a crutch. I saw it as too big of a reason to need him, and that's just not true.
Yeah, that's so not true. And like not just epilepsy, but like I got divorced. And you just don't plan for that when you're dealing with so much other stuff. Like if you're in an abusive relationship, like there's no bandwidth to plan for it.
Now talk about waking up one day and thinking 10 years ago I didn't think I would be here.
oh man, I've said that a few times.
Yeah, yeah. This person posted a rant a couple days ago after I guess they saw a neurosurgeon. So it says, I subscribe to the belief that these people are smarter than me and know what they're doing, but nonetheless, I feel anxious. I had a seizure caused by a stroke due to blood in my brain. It's called a cavernous hemangioma, I believe. This seizure has caused me to, yeah, they probably just spelled that wrong. Anyway, seizure caused me to be on a breathing tube for 30 hours in the neuro ICU. I feel lucky to be alive. The neurosurgeon at the hospital said I do not need surgery. When I saw my neurologist, she suggested I get a second opinion. I went to Northwestern, they're in Illinois, and that surgeon also said I don't need surgery, but there's a 9% chance I'll have another seizure in the first year and 3% chance for the rest of my life. I'll be on Keppra for the rest of my life as well. I understand brain surgery is a big deal. Obviously, I don't want them cutting my skull open if unnecessary, but I feel so anxious about having another seizure. Is it possible for me to have another seizure, but it not be as severe? Should I work on reframing this and just be more grateful that the two neurosurgeons said this? And is it better to err on the side of caution and assume I will have a seizure again? I just feel so worried about the 9%. Frankly, I don't care about taking meds forever, but I'm scared of having another seizure. So this person just wants to know basically what to do. This is that first fork in the road, essentially.
Oh, I wanted to kind of suggest too that if no one has specific knowledge of this, we pin this and ask it again once like Tom and who was it? Someone recently had brain surgery. She was on last time.
I know
Rachel
who you're talking about.
was Rachel. Yeah, I think that's Rachel.
Yeah.
Rachel and Reese.
Yeah, Rachel. We have a lot of Rachel, Reese, and now we've got
Yeah, Kate, can you mark that to come back to? I think that's a really good question.
I got one here. How to rest. How to rest without guilt. I hate taking off work because I love my job and my coworkers, but sometimes I am absolutely useless and I need to rest, but I always feel so bad. My coworkers appear to be very understanding and they're also not American and are always telling me to make sure I rest, but I feel like I'm being annoyed by needing to rest so much. I'm also the type of person who works multiple jobs on top of 18 college credits per semester. But since having seizures, I've been unable to do that as well. I think post seizure, my brain is like slime mold, if that makes sense. It's not thinking, and I'm sleepy, but I get antsy and need to get at least puts around, but then I'm exhausted. Still, I don't know. So how do I get over this? Will I ever get over this feeling? And then there's the long Um, the guilt part. Someone help me with that.
Okay, I will. Oh no, Angel will. Just kidding.
It's really hard, but you really can't blame yourself because you didn't choose this. Um, you didn't choose to have a seizure. You didn't choose epilepsy. Um, you know, it was chosen for us by some unknown reason, or sometimes the reasons are known, but uh and you can't blame yourself for that. And you need to rest because I'm not saying to over rest, but you need to not push yourself too hard because stress is a factor which can lower your threshold for seizures. And that's why, if you take on too much, you're going to go through a big one.
Yeah, and look at it this way, like, because God, Angel, that's so true. Like, you're having guilt now, but what you need to look at is the long term. Take care of yourself first. Get as much sleep as you need to right now. Get yourself figured out because you'll have more guilt later if you have to, if you're just in this state of constantly trying to catch up with yourself. Yeah, and you mentioned get therapy. Yes, and get a therapist that you like too. Like if you don't like them, just drop them. One I forgot the rest of it.
Me too. I got something here. It says need advice. 3 days ago, I ended up drinking only 2 drinks, vodka and Sprite, but a small amount of vodka, nothing major. Only reason why I drank was because it was our country's major celebration, and I guess I just wanted to feel normal without a whole "you have me, you have epilepsy, can't ever drink" vibe. The day after, my head had the day after, my head had a lot of pressure only on the left side, on the left front side. A really bad thumping sensation every time I moved, but it kept coming and going. I thought it was normal hangover, but one, I never get a hangover, especially after only 2 drinks. Two, it's now continued onto another day. It's continued onto day 3. I'm in pain with my head, I really dizzy, and just not myself. I'm on Vimpat, 200 milligrams. I have focal epilepsy and also have an arachnoid cyst on the left posterior fossa, 16 times 34 millimeters. I'm worried that maybe I fuck something up. I have drank before maybe on my meds and more than 2 drinks, and this has never happened before. Is this a cause of concern? Should I get it checked out? It's nothing to get checked out. This is something you can handle yourself. If you got a cyst and you got other problems going on with epilepsy, I don't suggest drinking, not even 1 drink, not a splash or anything. I stopped drinking on Easter, so I'm not one to talk much, but I stopped cold turkey. So I'm not saying it's easy for everyone, but yeah, just not drinking. And the medication is not a good thing to drink with. So,
Hey, Pookie.
yes.
Yeah, that arachnoid cyst thing. Yeah, with or without epilepsy, absolutely 0 Z, no tolerance for alcohol. Yeah, and I wasn't holding on to where it is or what types of seizures this individual is having, but even without an epilepsy diagnosis, an arachnoid cyst can really change things, and you don't want to give it something to do that with. Don't fuel the fire.
Yes, I totally agree with this. Oh my God. And I wonder how old this person is because I strongly suspect I had a stroke in my 20s. Um, and my MRI, it's possible. I mean, I just tried to put an earring in and poked it into my cheek, and I can't tell how deep because I can't really feel that side of my body. And I'm looking so young, but I am not. And man, you don't want to go into your 30s, 40s, 50s, whatever, with not being able to feel certain parts of your body. If you like having sex, I don't recommend that.
Yeah, alcohol just seems like a fuel to the fire thing for all of these conditions mentioned, since it's a blood thinner. I mean, who knows what effect it would even have to just make everything worse. So handle one
Yes.
thing at a time and definitely don't make partying a priority. It can't be. You can't.
Amen. Listen to Kate. For fuck's sake,
Right,
everybody listen to Kate.
right,
I
because
was
Always
drinking when it
listen to
happened, by
mom.
the way. I forgot about that. I was drinking. I had 1 sip of alcohol and my head went down.
oh God, yeah, and this, it's like I appreciate that these people come to Reddit for these questions and the support, but why aren't they taking it seriously? Like if the doctor came right out and said, okay, you have a malformation in your brain and alcohol could make make it exponentially worse and kill you. Now, if we looked at epilepsy the same way as we looked at that malformation, maybe we could take this more seriously. But even people, yeah, with our new diagnosis, I literally ran away from it. I'm like, no, there is absolutely no way. No way, no way. And I went on for, I would say, about 6 months driving like nothing happened and thinking, oh, I'm fine, I'm taking this medication, I'm fine. Yeah, no, I went through that denial, but it's like they really, really need to understand how important it is when the doctor says no alcohol. And some doctors aren't even doing that, but with an arachnoid or like a cavernous malformation, any malformation or tumor in your brain, I thought maybe most people would know immediately I really shouldn't be using alcohol. I don't know. Am I being, yeah, I don't want to be that person, but it's like, come on, really? You need
Yeah.
somebody to do that you got something wrong with your brain, but you can still go and party? I don't know where you're at. Yeah.
Not sure if anyone has sister advice for this.
Yep. Oh man. I agree with Kate. Kate, I agree 100%. There are people in there fishing, which is why I get a short fuse on stuff like this. It's like if you just want us to tell you it's okay because your doctor said that you can't, go away. Because I just might come along and Delta's right alongside. You don't need the alcohol, but yeah, fishing for approval. Like the doctor said, no, you can't have this. Oh, I'm going to go to epilepsy support groups and ask them and do what they say instead, because that's what I want to hear rather than listening to what my doctor said, because all these people living with epilepsy are saying, no, it's all right. Yeah, no, it's not. And I do see a lot of that going on, not in our group, but some of the other Reddit groups. People are just like, yeah, sure, it's okay. I did it. I was fine. Blah 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 blah. Yeah, I don't know your individual seizure syndrome. I don't, no. I never, I don't care. No alcohol.
Jeff, you got something?
I used to drink,
Hard to
not,
stop.
I wasn't an alcoholic, but I used to drink quite a bit. I enjoyed uh, alcohol. I collected and drank wine for quite a few years. And then one day after surgery, my cardiologist said to me, don't ever drink again. And I stopped. And
Okay.
I think if your doctor tells you not to drink, you have to be pretty stupid to drink,
Right.
and especially to go on a, a Reddit site and ask the people there. Because some idiot's going to say, yeah, go ahead, have a drink. It won't
Right. I
hurt
was
you.
thinking that. Somebody's gonna say, go ahead, find a drink.
You're
You
right.
can drink
Right.
this, tell them what they can drink or how much or stuff to keep safe. Yeah, people are people. So
I have
Uh,
NASH, which is fatty liver disease. Alcohol, well, NASH stands for non-alcoholic um steatohepatitis, but alcohol affects the liver. You think I'm gonna go drink? Hell no.
right. I stopped drinking because I don't like it anymore. And I have theories on that. I think it's the benzos make you not like alcohol or something. That I don't know if that's a fact or something, but yeah, I mean, I used to drink a lot. I think I mentioned that, but no, I wasn't like an alcoholic or anything. But yeah, but my doctor said, sure, you can drink, but not a lot. And I don't appreciate that ambiguity. I think they should just say either drink or don't. And maybe you shouldn't put this out there, but yeah, but my doctor really said you can have, like a beer or two every so often. And I didn't know what to take from that.
I put off getting diagnosed for a while. I maybe had a stroke. I maybe can't feel anything below my belt. Maybe. But I also do think to a certain extent, you got to do what you got to do and face the consequences. Like that's kind of life. And yeah, also I don't know where this person is. I responded to somebody in Scotland once and I think the drinking thing might be huge. So you're just like very alienated. I don't know if there's like an AA adjacent or like I don't know how you can find people who are sober. But I think it's good you all said all the bad shit shit your doctor said because I think some people need to hear from older and I'm including me in that people about all the bad shit that happened because your doctor didn't do it. Like they're not going to be like, yeah, I drank and then my brain exploded and I can't have sex. Like they're just not going to say that. Also, I think people know if they're addicts inside of themselves usually. So if you feel that, um don't do it. Like then in that case, don't do it. Just go to AA and meet people.
Hi, Mark.
Hi, Mark.
Hello, everyone.
Hi, Mark.
Can you see
Every
Poofy over here? My cat?
Yay.
Poofy.
Okay, every time someone joins, I'm like, oh, it's my favorite person. Oh, look, it's my favorite person.
Just love to love everybody. What I got here says, when I read it, I was like, I gotta not read this and read this to you guys because I thought it was like a your own opinion when I read it. It says, if I'm on my meds and I'm taking the right dose and not missing doses, can I live a normal life without caring about triggers? I'm 23. I got my first seizure on the 9th of June and the second one on the 22nd. And I'm not saying I want to pull full nighters or drink a lot or any overboard stuff, just a normal life without caring much about triggers. Is this possible, or should I still worry about a lot of triggers even when I'm on meds? I'm on meds and I worry about triggers all day, every day. I think about it. What's going to trigger a seizure? What should I not be doing? It just comes with it. I'm not going to say it's common sense, but yeah. I worry about my health, so not everybody else does. So if you're worried about your health, and the person's fairly new to it, so you should not do those things. You should worry about your triggers early in, unless you want to find out the wrong way. Wake up in an ambulance or something.
Or the ER.
Mm.
I don't know my triggers at all, but I still worry about my seizures every day. And I don't have an aura, or I can't tell my aura, you know.
Get a nanny cam. That's not directed at you, Angel. But to this
I know you
person
got promoted.
because I don't know what you're talking. Guys, Topo. Just do it. Topo. Topo TP like
We all got couple.
And seizures are going to get worse, and eventually you're going to figure out that, nanny cam.
Yeah, got a nanny cam.
Oh, nice.
yeah, and if you want like also I was like Annie already knew what kind of seizures she was having, but like I certainly didn't. And I have childhood absence epilepsy. And I think probably more people than know it do have that type. And they just turn into different types of seizures. And I think like epilepsy, they just turn into different seizures and they just aren't caught in my uneducated opinion. So yeah, get a nanny cam or like have people be honest with you if they notice anything weird when you feel weird. So that way you can take them or the videos to your doctor to get on the right meds. And from what you all have let me know, it's not just like I take this med and my life goes back to normal. Unfortunately, your life is not what it's going to be like. It might take a while to even get to the point where most of your seizures are controlled.
This person is 23. You guys got advice for this kid? Just had his first 2 seizures.
Yeah, literally just diagnosed a few weeks ago. Yeah, just don't get too scared and listen to your doctor. If things don't sound right, ask around. And therapy, you're going to have to learn how to accept it. You know, it's a late onset diagnosis. My therapist equated it to a life-threatening car accident. You could be 11 years old in a car accident and become a paraplegic. It's really not that different. You know, your life suddenly changes with a diagnosis of adult onset epilepsy. And I really appreciated her saying that, because I never, you know, it's like, yeah, you know, well, you would take it seriously if it was a heart condition or this or that. But yeah, you would take it more seriously if I was in a wheelchair. But just like us, we didn't expect it. We didn't ask for it. Things just happen, you know, and the same kind of trauma that they, you know, that she uses on people who have had accidents, or, you know, she's with active military. So that's the kind of trauma she deals with. So it's like, yeah, I trust what she's saying, because I guess it would feel the same way. Like if I lost my legs or my arms in an accident, I think I would feel very similar. You know, it's like my life completely changed. What do I do now? You know, so epilepsy did the same thing to me and to many of us. And at 23 years old, that hurts, because you're just heading out to your independent life. And all of a sudden you realize that might not happen at all. But that's the part that, you know, that you need help working on. So that's why therapy isn't just talk therapy. Therapy includes social workers that get you set up with resources that will help you navigate your new path, because it wasn't one that you planned on, but they might have a map that you don't have. So, you know, it's always good to go for therapy and social work to try to find how to figure it out. You know, that's the best advice that I have. And I don't know, on top of that best advice, don't let anybody ridicule you for therapy. Um, because those that, just on my personal level, every single family member except 2 of them so far who kept saying, you need therapy, are face palming themselves now. So the therapy worked. Yeah, it really does help. So don't let anybody ridicule you out of it. It should be a prescription. Um, but yeah, it's just a different path. That's a very drastic turn, but a different path.
Yes. Oh my God. When you said don't let anybody ridicule you, that's so big. Like, I don't think any of us here have been in the military. I know Melissa has. Um, I just have third-hand experience from some Marines, and one was the captain, and someone literally was calling him almost every week saying a member of their group, I don't know the words, killed themselves. Because I mean, if you've seen combat, assuming you're in the US, who fucking knows? Like, you probably have an idea of like the extent to which that affected you. And I would, if this is available, encourage you to get some sort of advocate to go with you. And get like Annie has a therapist that is ex-military, maybe even someone like that.
Sorry, I had to cough. Um, That's exactly what the next one is now.
Pookie, you're
I
in the
was just
upside
gonna
down.
add to the
Yeah, flip
last
yourself
one.
back over.
Yeah, you're upside down, Pookie. Or am I having vertigo?
But he got, but he got something to eat.
How's
Oh, you're
that?
funny, Angel. No, you flipped, bro. There you go, man. But
It's cool. That's good timing.
I
okay.
just wanted to add to the last person, you're new. Come join the epilepsy universe. Come be around us. We all have epilepsy. We can share our stories with you and, we can guide you through it. Some of us have been going, living with epilepsy for far longer, and some of us are newly diagnosed too. So you have friends here.
I love that, Angel.
There you go. I
Like
meant
I'm
to
saying,
reach out to
everybody needs an angel.
I'm like into trying to get some not famous visitor, but some kind of influencer, somebody who's managed to achieve success with epilepsy. And I reached out to a couple people. One boy that was like 13 2 years ago did a news story saying, now he's an advocate. His parents helped him start an organization, and I mean, pediatric having uncontrollable seizures in elementary school has got to be hard enough. And this boy actually made some light of it, brought something positive out of it, and that's amazing. So he's a miracle altogether. But getting a hold of anybody like that is going to be difficult. So I'm not holding my breath. And then there was some other like social media influencer person, some Brazilian chick, and has like a fashion line and products at Ulta, and also an epilepsy advocate for the Epilepsy Foundation. So we'll see if anybody gets back to us, but I know Brandon's doing the same thing, and we're all just trying to get somebody with some influence on here that can show you can still have success. Like Lisa to say, you can definitely still be successful with epilepsy.
Mark, you and Kate are going through the same thing with the lightning and electricity. I think Kate said something like that earlier.
Oh yeah.
You guys are
Yeah,
going through it as
I
well.
like it personally. I mean, except for the possibility that the power might go out. I like thunderstorms. It's the rain is starting to pick up real nice here. It's nice and cozy outside.
Nice.
I just feel bad for my dog. She's still real nervous, so
Oh yeah,
in
the
this kind of
cats.
weather, she's curled up in a crate. I mean, she's out of the crate now, so that tells me the storm is over. Because she has that intuition, like long before this one got here, somehow she could tell that the thunder and the rain was going to last a little longer this time. But yeah, up north it's crazy up there now. They're not used to the heat, and now followed by storms. And weren't you just in like the 90s or something yesterday? You guys are all over the place with weather. That's
Yeah,
crazy.
was it the whole weekend? It was like, I think Monday and Tuesday hit the triple digits, and then yeah, rain.
Yeah, I'll be right back, guys. I just got an alert for a tornado watch. Um, and we have isolated thunderstorms. I know enough about weather. I'm going to cover my roses. I will be right back.
Expert botanist. Love
Be
it.
safe out there.
See that? And
Be
she's got
safe,
skills for
Annie.
that too. She lives a full, successful life and knows about gardening. That's incredible. Talk about keeping your priorities straight. Amazing. Go ahead, Pookie. Sorry. What's the next subject?
I was just gonna say you got to find things that you like to do. Don't let it consume you. It's hard to say, but if you never find things you don't, you'll probably sit in the house and thinking about epilepsy all day, and it'll run you crazy. Been there. Yeah. It says replacing vaping. I have a slightly daft question. I vape to control my mood, but realize it's a seizure trigger. I think due to nicotine, as nicotine gum has the same effects. I use it because conventionally depression treatments don't really work for me. Has anyone else been in the same situation and found a suitable replacement that doesn't trigger seizures? Um, Never really did the nicotine vaping. Mm. And if you're having seizures, yeah, you just realize that it's making you have a seizure. Personally, I think that's the sign to stop. Um, I'm different. Maybe I'm different with cutting things cold turkey, not like everybody else, but yeah, if it has to do with my health, I'll just kind of get it together.
Okay, I've been a smoker since I was 17 and I briefly switched to vaping. I also worked for a manufacturing company that makes who cares, but it goes to the government to do studies for vaping. They really don't know the effects. And I'll say my seizures ramped up when I was vaping all the time because you can do it all the time. And it's not just your seizures, you got to look out for what they know now. Popcorn lung. Oh my God, it's unregulated. Please stop vaping. Smoke a cigarette. I mean, to get off of them, don't go on Wellbutrin, but get off of nicotine if you can. Just go straight for the Delta for real. Like, I don't remember how old they said they were. Please stop smoking nicotine and please don't vape.
That was well said. I don't think anybody can add anything better to it. I mean, talk about unregulated, everything we know is already bad about it, but that's like another one of those posts. It sounds like they were looking for reinforcement, other people just to, tell them don't worry about it or go for this brand or go for this, you know, kind or something. That's another one who's got it. They've got to know common sense that it's not worth it.
Yeah, and
But
I'll take
yeah.
over being good mom for the second, and then I'll go back to being bad mom. Because I think you're right. People are looking to hear just keep doing it, but I do think this person is legitimately might be looking for a way to gently exit that. Hopefully, I'll give them the benefit of the doubt, but I do think some people are looking for options. Um, yeah, that's all I'll say.
Yeah, for sure, for sure.
Lost partner. My husband has epilepsy. However, it's pretty new to him. Some of my family doesn't know about it, and same with friends. The ones that do, it's like a taboo topic. Nobody talks about it. The vibe and MO. So M-O. Anybody know what that means? Moreover, um, the vibe and whatever that is
Yeah,
of
it's
one.
MO. You got it.
Okay.
It's MO.
It's the vibe and MO of the ones that know is take meds, and he just had days when he doesn't feel well. It's like nobody wants to admit what's going on and treat it as such. Driving license, etc., gone. I have a hard time not dealing with it and sweeping it under the rug. I constantly am worried something will happen to him while driving. We also have a new baby, and I'm scared to leave him alone with the baby sometimes, and especially in the car or in the morning because episodes happen. It's usually in the AM. I'm at a loss. My family, the ones that I know, are confused and want the baby to be safe, as do I. It's an odd thing because everyone treats it like a taboo thing that we don't want to give any attention to or treat it like it's a real issue. I also think it's affecting our day to day life. I feel sometimes like a single mom to our newborn, as he had these episodes and days where he doesn't feel good, and I'm alone taking care of the baby day in and day out. He also seems depressed and doesn't really talk to me. Sorry for the rant. Anything you can say would be helpful.
Can you summarize just in abstract again? What were they asking?
Advice on their partner being depressed and their family treating it like a taboo.
Oh, okay, that's right. That's right.
And she's
So
worried about him being with the child alone or driving with the child. She said, especially in the mornings, because the seizures are mostly in the mornings. Anybody got any input on that?
that's just so touchy because if it's somebody you have to trust with your children, you can't always be as straightforward as you want to be. But maybe just pose it as an educated, I don't know, topic. You know, let them know that you know what's going on, you have control over the situation. Lord knows we don't, but let them know exactly what steps you're taking and why you appreciate this care and talk about swallow your pride. But if it comes to these family members being responsible for your children and and if you feel safe, that if you feel that your children are safe with them, that you're not being judged to that extent, then you just got to keep a good relationship and let them come around in their own time because a lot of people do just have these terrible stereotypes about epilepsy that sometimes take a long time to go away. But best of
Can be
luck.
a
Absolute best of luck.
I
this
just
can be a
want to
very
say,
okay. No, go ahead.
I'm a example of a father who pretty much had to do a lot of taking care of my daughter. She had colic and everything. My wife could not deal with her crying or anything. I have epilepsy, and I've done it. You know, I've been through the ringer and back, I should say, with my daughter. And I loved it. I loved it, and I would do it again. And I taught her ABCs, one, two, threes, her name. I taught her. Um, I was potty training her. Don't like someone with epilepsy. Like there is a lot of uh what's the word, Kate? Stereotypes.
Misconceptions.
Yeah, misconceptions, and we can do some of it. I fed her good and everything, so and I did it for 3.5 years, so I can do it.
Well, props to you for that. Daddy's girl for sure.
They say this person was recently diagnosed.
Yes.
Okay. Well, maybe accepting this is very difficult for the person. And maybe we were talking about therapy earlier. Maybe that might help because it sounds like they're not dealing with it very well. And maybe a third party might help with the depression, help with uh, anything they're not um, any sort of denial this person might have. Um,
Yeah, Kevin, can I chime in? Are you done?
Hmm.
You were probably, I forgot most of the question. I'm sorry. I'm sure this person can understand. You were probably having seizures before and you were probably handling a shit ton. Like, I mean, coming from all the parents who don't even complain about it, because they love their kids, but you were probably dealing with it before. And I hate hearing this. And I don't even have kids, but now you get to go through the process of finding a med, which ultimately might make it easier. and you have more knowledge about what's going on. And I think that in and of itself is like requires therapy because it's so much to handle on top of everything, like Kevin was saying.
Yeah, me with my kids, I didn't start doing this alone time until like 7 years ago, maybe. I didn't really get them alone a lot because, of course, you know why. They've gotten better, but no one knows that. But still, I spend more time with my kids and love it. My daughter, she used a video and made from CapCut, and she said, "I'm the best father ever." I almost cried. Anyhow, next. It says aura, heavy eyes. Today there was thunderstorms and I got auras. The typical feeling of not being able to think clearly came on, and then my eyes felt heavy. My left eye more so than my right. It's like they were physically closing with me, closing without me wanting to close them. It's like falling asleep. It's like falling asleep, although you don't want to sleep. It's like having fake eyelashes on, then a few minutes later, my lip twitched slightly, and then later on, my pinky twitched. My eggs come up normal, so I have been taking supplements to help with my symptoms, and they are way better. I used to lose my speech, but not. I just get to the sudden brain slowness with heavy eyelids along with slight twitching. So yes, I have seen an epileptologist. Can anyone relate?
Yes, I have these kind of seizures on an EEG, and I was extremely lucky. You may never catch them on an EEG. They could be coming from many places. Maybe if Kevin had this, because I think that that's similar. But yeah, the heavy feeling in one eye, especially, and the what I think it's called forced eye closure, and then closing your eyes makes you have a seizure. But the heaviness and the eye closing and all that, that is actually a seizure. It's just it's hard to catch because of the muscle artifacts. Yeah, that's all. I don't know what kind of seizures they're having. I think that those can be many. It also sounds like their seizures are spreading to different parts of the brain.
I think the question was it aura or heavy seizure? Because it says aura, question mark, heavy eyes.
Yeah, that's a seizure.
Okay,
And
yeah.
I think aren't auras many seizures, but that's a full on like maybe eyelid my I forget what they call it, but it's a seizure.
Yeah, an aura is a seizure, come to find out. Anybody get that heavy eyelid? Never. I have insomnia, so I don't even get the heavy eyelids. I'm trying to be tired and fall asleep.
I do. Yeah. I get it on my right eye because my epilepsy started on the left side, and my right eye would just close, and I couldn't even try to open it. It would just close, and I had to pay attention without getting stressed out because that's a seizure. And just like Em was saying, they're hard to catch on an EEG, but we did find out that the trigger for that one for me is the peripheral motion, and we got it to trigger during an EEG. And it's like, what the heck, and they were coming in saying, did you feel that? Did you feel that? And it's like, yeah, it's just this thing with my eye. That thing is a seizure. Okay. Oh, okay. Now I know, but they're hard to catch and they almost have to be triggered, and peripheral motion is when there's things going past the side of your face and you catch it in the corner of your eye, and it can start like an eye movement and it'll trigger a seizure. And it showed up still in the left side of my brain, but it was part of the frontal lobe and not the temporal lobe. So I'm like, oh, so yeah, I evolved. I definitely evolved, but that was what that peripheral. I'm not light sensitive, but I do have the other that sunflower syndrome where if I'm looking at light and I do this shit, I could have a seizure. So that's another, but that's not flashing light. It's the movement in front of my eyes that does that, or
Okay.
my eyes. Yeah.
I'm sorry, I'm feeling interrupted. Someone please get other people to chime in. But you are like blowing my mind because in the EMU, I was like, they didn't catch a seizure. They still told me I had epilepsy, but I I was like, oh, I need to be moving around. Like this is not doing it, and I could tell it wasn't doing it. And during my first EEG, thankfully my partner was there, like, restlessly, boringly shaking around. So that's so nuts. And then it showed up in my frontal lobe, which was super confusing. So thank you so much for that. I hope it helps this person, but I'll send you a chat.
Didn't they say in the part of the question that thunderstorms were coming
Yes.
as part of the question? I want I don't know. I've got it. I don't know. For some reason, it had a weird association with the like the those little handheld um lightning detector things for like electrostatic discharge. Um, like you can literally detect with a device when there is lightning in a storm, coming approaching nearby using the electric fields that it produces. And for some reason, it makes me wonder if that could be a trigger for some people if, like, literally the weather is, thunderstorms coming. If these people themselves, if we are human thunderstorm detectors.
Yeah, he said he gets auras when there's thunderstorms. So yeah. Kate, you got something?
I got my buddy here pushing buttons. But yeah, I agree with thank you for everybody's anecdotes on that one because I didn't realize reflex epilepsy was a thing. Learning more every day.
So the next one says anxiety attack or an aura. Does anyone else experience this feeling as well? Think I was using my DVS to zap during anxiety attacks I thought were auras. Is it best to just zap myself with the DBS just in case? Sending love to my fellow epileptics. Does anybody have advice? And I hope you have a good day. I don't have a DBS. I don't think I know what it is, but I think I heard of it. So it's not the same. I heard of it, but I don't know what it is exactly. Anybody?
Kevin, where are you? I know you don't have a DBS, but
Deep vagal stimulator. Is that the what the DVS stands for?
No, it's deep brain. It's kind of like an RNS, but
Yeah, so it's
yeah,
deep brain
like
stimulation.
yeah.
Sorry, I'm fighting this one here.
Yeah,
What was
And I
that?
don't make it on camera. So the rods that they put in here have I think they said 6 electrodes on each rod, and they use it to get to, I don't remember what lobe, what part of my brain, but that's what they said needed to be done to be able to reach all of the uh, plural for focus, foci, I guess.
Mm.
And that's when DBS comes in handy, when they narrow down exactly where your seizures are coming from, determine it's not all over the place, but that area is deep down where electrodes on the surface wouldn't reach it to interrupt, basically. So it's all about the foci, and if that's the right procedure for some, it's still pretty invasive, but I don't think there's a craniotomy involved. Not positive.
Yes, 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 and yes. Just like your rods are in there, that's pretty much what a DBS looks like. It's basically the rods. And it stimulates the insular area of your brain, which is the deepest portion of your brain, like the okay, what is it called? The hippocampus and the amygdala are the insular brain. And that's what deep brain stimulation does. And a lot of seizures, deep brain seizures fly under the radar on EEGs. And that is important for people to know when you're not getting an accurate diagnosis. It's always a good idea to mention that to your doctor and ask, could this be something that isn't showing up on scalp electrodes? You know, just that simple question, because yes, there are seizures that don't. And it's the deep brain seizures and also an unusual phenomenon called a spinal cord seizure, where a seizure can actually start in your spinal cord at the right at the base of the brain. And we suspected that in my case years ago. And now we're talking about that. It's like, oh yeah, well, your spinal cord is kind of getting pinched again. So that could be happening, you know. But yeah, that deep portion of the brain, um, yeah, it's even more mysterious than the rest of it. You know what I mean? So, but yeah, I I I can't remember. I think his name was Nate, and I can't remember his name on Reddit, but he had both. He's got both the VNS and the DBS, and he said those two things together completely changed his life. You know, and I'm so happy to hear those things because, you know, it's like maybe that's an option for somebody else that didn't even know about deep brain seizures, you know, and this is why we're here. But yeah, I would always recommend getting that looked at when you have seizures that are a mystery because they don't show up on scalp electrodes.
Kevin, did you have something?
I wanted to ask, because of what showed, like the patterns kind of showing up on my labs, I'm curious about people who, I know you can do the invasive EEG, but I think it's called an MEG. I don't know if anybody's done that and caught like something from deeper in the brain. Curious.
No. Would you forgive me if I said I forgot what you said already?
No, but I will forget.
Yeah, I forgot already. Um, so there was a question that I could never find it again off and on. I could find it again, but it's a really good question. It was in the epilepsy sub. It said, "What motivates you to stay alive?" Let's start from the top. Let's get this answer from everybody. What motivates you to stay alive and take care of yourself and stay alive? For me, I got kids to be here for. So uh, if it wasn't them, then my mother. You know, mothers shouldn't have to see their child die. That's what I've always lived by. Next.
Okay, I want to also ask, this is not the same, but people with pets like Mark, does that influence like your decision to keep trying to get treatment? Because if you're gone, who takes care of like your animal?
Well, I
Yeah.
am living with my parents, so they would be saddled with my two lovely little ladies. Um, I don't know. It's pretty simple in my case, I guess. Just like I would have to take care of their uh big black one-eyed wonder.
What motivates you to stay alive?
For me, my daughter, my family, my friends.
Next.
And,
Don't be shy.
okay, on my nanny cam, I didn't know why my dog was so nervous that night. And would sleep like he had to be like really close to me to the point where like I need another bed for him. But anyway, I watched on my nanny cam as like every time I had a seizure, he would get up and shake around. And he does that when he wants my attention. And then the cat will like bite me when it's happening. And like it's not like having kids, but I think about like my dog has been doing that probably for how long, and it does break my heart. And that motivates me to it motivated me to go to my new neuro, and I really didn't want to. So yeah, like friends and all that, just think of what they see you go through. And just think about someone else like seeing that and how lost they would be and confused if you um run out of the get-go to keep going.
Wanted to say hi, Lufa. You just got here, I see. How are you doing?
I'm okay. Hanging in there.
You haven't had any seizures since we last saw each other,
No,
right?
I had a seizure last night.
Sorry to hear that.
Yeah, I had a tonic-clonic seizure last night after moving. Totally overestimated myself, but that's all right. That's all right. Plus, I'm going through all the med changes, so it was just everything. It was just the perfect concoction of seizure, but broke in the new bed. It's one way tonight.
What motivates you to stay alive?
Probably my mom, because she has worked just as hard as I have to get these diagnoses, especially when I was a minor and still as an adult. So definitely my mom, because then I feel like I'm doing her a disservice by just being like, oh, well, we got here, so I'm just gonna go now. So I gotta do it for her. But hello, everybody.
Glad you're here.
Thank you. Thank you.
And Kevin?
My lawnmower is keeping me alive right now. My garden, my plants. Let's face it, the challenge is keeping me alive. Yeah, it just yeah, the challenge that we face literally keeps me alive. And I had forgotten what that was like until recently. Thanks, you guys. But advocating for myself and for others, that's what keeps me alive. And I hope I can get more energy to do more. But yeah, I'll say it's that.
Kevin?
There's something I need to do. And pretty much just one thing. And I don't want to answer. That's pretty much without just. I need to find a woman. That's it.
Gotcha. Mark? Wait, did Mark go already?
Commented about my cats, but I didn't really answer the question. Well, my family, my parents, like I mentioned before, they're supporting me through all of this. my sister, nieces and nephew, but also it's going to sound corny, but Jesus, um, I'm just convinced that God's not done with me yet. And who knows where this is going to go, but it'll be interesting. That's guaranteed.
Jeff.
I'm kept alive by my wife. I don't want to leave her. And that's what motivates me to stay alive. And the only thing, I've thought about ending it many times, before I had epilepsy. And I've thought about ending it since I've had epilepsy, but I'm not going to.
Been there.
Yeah.
Been there a few times, but yeah. Amit?
So I would say for me personally, family, mom, dad, sister, they've been through it with me for everything. My sister actually, she has juvenile myoclonic epilepsy, so we kind of, go through it together. And so, I just got to be there for her and, just be there for my family, my friends, everyone in my life. They've supported me, so I definitely don't want to disappoint them, and as well as my future self. So that's what keeps me going personally. So I would say that.
Okay, like most of us, we're the ones having seizures, and some say traumatizing people. You probably seen one. How was that? Because I've never seen a seizure, except for on TV or replay the camera. Is it traumatizing?
Definitely. Yeah, I would say it's traumatizing for sure.
Okay, good
I,
to hear
I
that from an epileptic.
hmm?
I said, good to hear that from an epileptic.
Yeah.
I'm sorry,
Yeah, so
guys.
it sounds more believable to say the least.
Come on, Ian. You got something?
Yeah, no, I was just gonna say, like, I'm in college right now, and I've had like really bad seizures in college. I remember I was studying in the library one night, and I started having the symptoms like the aura and everything, and it was full on tonic clonic, it was bit my tongue, fell unconscious, and next thing I know I'm in an ambulance, and it was really bad. I spent like 3 hours in the hospital, and then it was pretty traumatizing, honestly, but I guess I got through it. So, and then I had another one in May. It was the same sort of deal, but I was in the dorm by myself, and that was really scary because it was just me. My roommate wasn't there, and I had the aura again, and uh I somehow managed to call my mom and dad. Like I didn't have the strength to like pick up my phone because my right arm was really numb and it was weak. I remember I just didn't have the strength. Somehow I was able to call them, and they called my roommate, and then the officers were in my dorm, and then they called 911, and I was in the hospital. So that was probably the scariest one when I was by myself. So it was, it's rough, but I guess that's just what we have to go through, like as epileptics. And
Yeah.
yeah,
I
so
woke up alone quite a few times, so I understand what you're saying. And those are the scariest, especially when you don't know who you are or where you are.
hmm
Someone asks you, "Who are you? And what's wrong?" and you can't say anything because you're confused. Been there, walking the streets. Um,
hmm
and this one right here. Has anybody ever had a temporal resection? No? If not, we're just going to give this person some advice. It says, those who had a temporal resection, how frequent were your seizures? I had an EMU stay in late January and neuropsych evaluation in April to see what options I have with new epileptologist. I have a follow-up appointment tomorrow and receiving a doctor's note in my health portal that recommends right standard temporal resection. My question is, those who have had similar surgery, how frequent uncontrolled were your seizures? I was good for 3 years until 2021, and then since they have progressed from every few months to once a month and every few weeks. My trigger now is poor sleep, and for the most part, every seizure has been after a bad night. A few haven't, though. After the last seizure last month, I was thinking, fuck my life, I hate this. Let's go get this brain surgery. But now it's real. I'm having doubts about having brain surgery. If it's possible that lifestyle modifications will help, but not that level of surgery. How frequent were the seizures? Any advice since we don't have it? I don't have the advice. Hoping one of you guys do. Did you say something, Kate? No.
We might want to pin this question because I don't know if any. Oh, Kate's trying to test her mic. I don't know if anyone here has had surgery.
Kate and Kevin.
Yeah, but it wasn't a resection. Rachel had a resection though. Well, Kevin, didn't you have a resection? My thing, I'm just throwing this out. They mentioned lifestyle changes. They will not affect epilepsy unless you're doing things you shouldn't be doing, like consuming alcohol and other substances. But yeah, lifestyle changes won't reduce the need for surgery, or you know what I mean? I see that all the time. Just yeah.
Well, I've always been I always I'm a big supporter of routine in uh, I always talk about routine, just you got to have your life in order, your medicine, sleep, everything is very strict lifestyle. It sounds very boring, but I think that really helps with things. It helps reduce, I think it helps with the threshold and uh, helps reduce bad things, and it just helps, you know.
Kate is saying here in the chat, her headset is having problems. But she says, once it gets to surgery, a change in routine won't be enough to negate that need.
Oh, okay. Well,
For that person. And they said, basically, we're asking how were the seizures. Sounds like this person might be bad. But to the next question, it says, hair loss with epilepsy meds. Anyone notice hair thinning or hair loss with epilepsy meds? Does that come with the territory of all epilepsy meds? On Keppra, 1,000 milligrams daily. Feel like my hair may be thinning. I'm 21. Anyone else have any ideas on this? I'm 35 and I still got all mine, so I don't have any advice. I'd say stop Keppra. That's my only advice to everything. Don't take Keppra, but listen to your doctor, not me. I'm not a doctor at all. I've never been to any type of medical anything.
I had hair loss on Lamictal. I'm also on Keppra. It stopped for me, but I was looking up a lot of threads. The bipolar thread has a lot of good information on Lamictal. Yeah, mine stopped, and it seems like it doesn't stop for a lot of people. And you're 21, and hey, stop licking. Stop licking. Sorry. You're 21, and my dog is like going to town on himself. You're 21 and you need your hair. I think so. It's such a big part of your identity. So I would try a different one.
Yeah, talk to your neuro. Come on, you guys gotta have advice for this girl. Anybody hair thinning? No.
Go to a dermatologist,
Mm.
a medical dermatologist. Mine helped me because my hair literally falls out for 3 months after I get an EEG, especially when they use the glue and not the paste. The glue is for 24 hours or more. It literally, my hair just, of course, it gets broken, but it's the rash that I get from the glue. And it got so bad a couple of years ago, I went to see my dermatologist and he gave me a special shampoo for a couple of weeks and a steroid solution that I put on, and it calms it right down. My hair started coming back. Um, so yeah, I that's the best advice I can give from my experience. The problem is I have to have another EEG. So as soon as it all comes back, I got to go and get that airplane glue on my head again. So, it's like, okay, I'm ready to shave it off. But yeah, that's what worked for me was a dermatologist.
There's another one that says, has anyone done a life overhaul to live seizure free? Have you ever changed everything within your power to stop having seizures? I mean, a full life overhaul: sleep, diet, stress, environment, mindset, therapy, anything. Did it work? What did you do? I've been asking myself what this would look like and thought I would ask anyone here. Anyone have any life changes? No. I don't think I changed. I think I changed a few things, but personally, I think I've learned to manage the things I do. So, yeah. And I'm not seizure free. So that's probably why I haven't had the life overhaul seizure free. Go ahead, Jeff.
Well, I changed where I lived and it didn't have any effect on the seizures. I don't understand well, if you have epilepsy, you have epilepsy. I don't see what those kind of changes are going to affect.
It says,
Well,
what did you do to live seizure free? Oh, Kevin, you're seizure free, so this is
yeah,
seizure.
I mean, um, this is going back a long time, when things were really bad, but this is not. I don't know how this can help, but uh, removing stress was really helpful when things were awful. You know, I'm not gonna say what I did specifically, um, but yeah, I just took some time off college, and I was a few months seizure free, and that just did wonders. But now when I'm seizure free for 6 years, um, I did do a lot. I was running a lot, but I wasn't seizure free then. I ended up this was one of the last seizures I had. Um, I fell down the steps, and I had to stop running, and I broke my foot. Um, so that was like the last of the exercise I did. But I did exercise. I got my diet in order. Um, routine, like I always said. Yeah, I did make major life changes, and I think it really helped in addition with the VNS. So yes, I think it's all uh, life changes do help, and I think it's yeah.
Hey, Rick, welcome back.
Hey guys, good to be back.
Oh my, bring us back. So you guys are right on time. Rick, I was going to ask you. There was a question we had about temporal resection. Is that what you had?
So when you mean resection, like I guess cut in there and do something, or
Yeah, it says temporal resection. I know you had something done in your head, so I was wondering if that's what you had.
yeah. So my right temporal lobe, that's where I had the brain abscess. They went in there and cut that out and left some nice scar tissue for me. And I also had cerebral spinal fluid leak because I had holes in the bone. So the first time they put a patch, that didn't work. So then the second brain surgery, they lifted my brain up and they made like a 7-layer lasagna or cake. They put a whole bunch of stuff in there to patch it for good. So that's what I had done in there. I have not had a resection, and it looks like Kate wrote in there, resection is taken out a focal for seizures. Okay, I did not have that, but that same general area.
There was a question you just came on the end of it. It says, has anyone done a life overhaul to live seizure free? It says, have you ever changed everything within your power to stop having seizures? I mean, a full life overhaul, sleep, diet, stress, environment, mindset, therapy, anything. Did it work? What'd you do? I've been asking myself this and would like to basically hear what we thought. I haven't done, my seizures aren't seizure free, so I couldn't answer that one. There's not much I've done besides stop smoking tobacco, so I can't tell so far because the furthest I made it apart was 3 months. So I'm on 2 months so far. So hopefully that was it. And tobacco, I mean, nicotine is what I didn't need. Sailor Mom, Rick?
So with me, so I had previously done an elimination diet to help other health issues, and my new neurologist had suggested the same diet. I said, "Hey, that's great." So I personally have done carnivore as my elimination diet, got rid of arthritis, got rid of a whole bunch of things, inflammation, et cetera, et cetera. I know it's not for everybody, but find out what's causing inflammation and what your triggers are. Um, I've been feeling okay. I had a seizure a few months ago because I wasn't really diagnosed with epilepsy until a few months ago. So I guess a lifestyle changes. I'm medicated and I'm also more aware and I make sure everybody else around me is aware. So that's another lifestyle change. That way I don't freak people out and I don't wake up with, you know, police or anybody trying to give me Narcan because I had a seizure. So that's a big lifestyle change for me is making people aware and being an advocate.
The next one.
I'm not seizure free, so I can't say. I tried keto, it did not work for me. Had some side effects. So I don't know. I mean, I did all those other things. Sleep, stopped working, lowered the stress, all kinds of other things, but so far not yet. Anyway, I'll be quiet now.
This one says, do you live alone? I've been having seizures since I was 10 or 11, and I'm 32 now, and I've never been able to have my own place. I've moved in with a couple of partners, but as soon as we break up, I have to move back with my mom. I get along with my mom more than anyone, and I love living with her, but I have never been able to have my own place because of this damn condition. I've been starting to wonder how many other epileptics actually live alone, and if so, how do you do it? Is your epilepsy more controlled? Do you have a medical alert animal? What's your story? I don't live alone. Um, Personally, I don't suggest living alone. So with epilepsy, I don't suggest, living alone it's out right now. Anybody here live alone? Oh yeah, Jeff lives alone. How's that going?
Well, it's weird. Uh, I've been married for so long, for 38 years, and just recently, uh, I tried living alone. Uh, I liked certain parts of it. I didn't like certain parts of it. Uh, I didn't really have, I don't have tonic-clonics usually, so it wasn't a big deal that way. I have focals while I'm sleeping or while I'm awakening, as the doctor tells me. Uh, so it's never really been a dangerous thing, although I did fall out of bed once and hit my head on the night table. Um, I kind of prefer it because where I am when living alone is where I love. And, I just don't love in Pennsylvania where I am now. But I love the desert and I love California. And that's where I want to be. I think if I had tonic-clonics, like you guys during the day, I probably wouldn't feel safe. And I wouldn't want to live alone. Okay, done.
Okay. Yeah, the next one is something I think we all agree on. Oh no, I thought it said something else. It says Kepra giving Molly like euphoria. I have post-traumatic TLA from car accidents. For years after them, I started noticing I care less and less about music, going to raves, etc. But they happen. I was a hardcore raver and lived and died for music. I even made a living producing music, luckily. But as time went on, I started to not understand music at all. And I only listened to it in car rides, playing, etc. But I've never truly enjoyed it. Anyway, I'm newly diagnosed after telling my doctor all these things, all these exact things. They were like, yeah, that sounds like epilepsy or at least brain damage. So now I'm on a new dose of Keppra. They just increased me to 2,000 milligrams. And while it does make me supremely sleepy, I also noticed I somehow feel like I'm on Molly, like high on it. When I listen to music, now it makes me feel like I'm having an orgasm and it's like spiritual experience to me. I've never felt this way in my life, to be honest, at least not to this degree. I don't know what to make of this. Is anybody going through this? I haven't experienced that. When I was taking Keppra in my teens, I was running the streets, so wasn't paying attention to Molly high. And I've never tried Molly, so I wouldn't know.
I think I might be the only one who gets euphoric seizures, and I won't comment on the not safe for work part, but yeah, that too, almost to an uncontrollable degree. So those are probably seizure related, and if you're on Keppra, maybe it's having a paradoxical effect on you, or you were having it before and it's reducing the seizures, and you're just now noticing because the worst parts are out. But I say enjoy the euphoria while you can, but maybe talk to your doctor about those two situations. Either increased seizures in a different kind, or you're noticing them more. But it wouldn't hurt to try a different one to see if it still happens if you really want to get rid of that, which I don't know if I recommend.
I know I had the opposite effect with Keppra. Like it gave me like the opposite of I've done Molly before, but it is the opposite feeling of that for me. Um, I do have auras where I get this uncomfortable feeling of like overjoy, but it's not like a good overjoyed. It's just uncomfortable substances. Yeah. But I just had a friend named that was all. But anyways, sorry, my brain is really lacking today. The Keppra almost put me into more of like a psychosis. Like it would have me because I already have like some, no, not mania, because I have BPD, but it would put me in like a really like Keppra rage, but like really, really like subtle in a way, but it's there, and I'm having these really intense thoughts that I don't, it's hard to explain it, but it's something like, especially when I'm on my period, and I know we talked about that last time, but it like I showed up somewhere with a knife, and I just don't remember really putting that together, and I was starting Keppra, and I've never really done something to that degree, but that's just not who I am, so it kind of has like this alternative effect on me where it wasn't euphoric, it was more like almost like a distorted euphoria where like I was happy to be insane almost. I don't know. That makes sense or wait.
Yeah, that was really good. I do think that those might be one and the same. Because after the euphoria, I get a very bad feeling. I mean, it almost like what you're describing, not what you're describing doesn't matter. But the like whether or not it's giving you euphoria or what you just described, like almost like a version of that, but I can't think of the fucking word. Whatever the word is. Man, I do think the aftermath of it is bad, like you were describing, even the euphoria. Yeah.
It sounds a little bit like mania. I had a friend that was manic depressive, and that, that's the cycle she would go through a lot. Just yeah, before she got therapy or meds or whatever. I mean, before she was diagnosed. So just throwing that out there. I'm not
No,
sure
I'm
though.
still I agree. I still need the therapy aspect. We're still getting to that part. So that's
We all do,
definitely
right?
you
That's why
can't
we're
treat all of
here.
us. Yeah.
They got says Topamax didn't work. Med number 22 down the drain, and here comes number 23. But last night was the first night for bumping up my dose to 100 milligrams, and holy hell, it turned me into a pacing mess. About an hour and a half after I took it, repetitive movements and closed eye neon visuals, not fun in the slightest. I've got the best luck with these meds. Any advice? And then the person, he said, this is my best guess as what I was experiencing. My phone screen would stay in my vision after I closed my eyes, but would last for 1 minute instead of seconds. And then there's pelipanopsia or panospia. This is a visual symptom where an image persists or reoccurs after it's removed, and it can be triggered by Topamax. This person needs you guys' advice.
I have this, but I do want to just field the question to anybody else because I've answered quite a few questions. So if anybody who hasn't spoken, please raise your hand.
I have medication resistant stuff, and I've gone through like 14 failed meds or more, but I don't have an answer to this, I don't think. I'm sorry.
Are they asking like, can you sum up the question again? I'm sorry.
They were just asking for advice. They explained their situation and then asked for advice.
But their situation is like they're med resistant.
I guess it was the med that
It sounds like
works
the side
makes
effects.
them really nervous. Is that correct?
Yeah. Well,
And
Sorry,
that
it like
visual side effect.
okay. So it's
Something
is the
about being able to see, like, I mean, it sounded like hallucinations, but it's definitely not something that I've experienced before. But either way, when you're taking medication and you're suffering from a severe side effect, then
yeah,
that has to be addressed. Yeah, go
I
ahead, go
would
ahead.
take into like play anything that you have prior to the medication, like any mental health diagnoses or any physical health diagnoses that could possibly alter with like how you're presenting throughout the day. And like for me, if I lack sleep, I start to hallucinate. That's just I just know that as a fact, that it's just how it is for me, regardless if I'm on meds or if I'm not on meds. That's just a fact. So I think really targeting those little specific things in your life, even if they seem small, like even if it's different foods. I know it seems unrelated to the question, but it is kind of at the same time. If you kind of taking a big part, taking a big step in taking over your diagnosis and taking control of it is finding all the little stuff that the doctors aren't going to point out for you. Like they're not going to tell you that this specific juice is why this makes you feel this way. Like they're not going to go through, it's just not realistic. So you have to take that time to kind of be doctor for yourself in those ways and figure those things out, and maybe switching medications if they really feel like it's the medication would be a really good idea, because hallucinations aren't the most fun thing. Even if they are just fun little gnomes, they're not super fun all the time. If no one else can see them, everyone thinks that you're a little nuts.
One of my failed meds, I used to get patterns. Like I could close my eyes and I would have the most intricate patterns just like flowing across it. And I just had to eventually tell my doctor that I'm sorry. Like, obviously it's not working anyway, but the side effect, I can't deal with that. I wish I could remember which one it was, honestly. But did they say which medication they're on, Pookie?
No, they
Turbomax.
just said Tobamax didn't work. Down the
Just,
drain, and here comes number 23.
and
I'll
they
read it
don't,
over again. It
and they
says,
don't tell us what it is,
nope.
right?
I
Nope.
have
Okay.
they should get a DNA test, like a genetic test done to see what medications their body responds to best, because I know I had that done for mental health purposes, and it was a big reason why I wasn't responding to 98% of the medications. So if that's available for them, I would definitely highlight on getting a test done to see what best works for your body and your dynamics.
Yeah, that's a good suggestion. I did want to jump in just because I'm trying to remember what they described, but I do have fucking hallucinations. When I close my eyes, and I think they said some word about eyelid something. Um, I've been in therapy throughout my life, and even before I mentioned seizures, just because of the pattern, therapists were like, "You need sleep." Like Lufa said, I couldn't get a diagnosis. I was begging for like bipolar disorder for a long time. For a little while, I considered going on antipsychotics. That's what I wanted to bring up. I talked to somebody else with similar symptoms who has occipital parietal seizures, which showed up on mine. Hey, no licking. Um, what was I saying? Sorry,
Occipital
guys.
parietal seizures, psycho,
Yes,
antipsychotics.
thank you. So the EMU called the hallucinations seizures. Bless you. And you can also get post-ictal psychosis because of that, because you can't figure it out. It keeps you up at night. And you can sometimes take a low dose of antipsychotics if you're having that or you wonder. And and it can make it go away, but usually don't stay on them. And again, this person might have had those before, not know some. Oh, they also could be migraines. So you might want to get that checked out. Okay.
Yeah, I've had migraines most of my life too. So there you go. Good point.
Yeah, ocular migraines are a thing. Not every form of migraine is the big splitting headache that people think of when they hear the word. So, yeah.
Most of my, like this morning after my, um, I don't know what time I had my tonic-clonic seizure, but I'm assuming I had two last night. But I woke up and it took about 3 to 4 hours for the headache, like just like this, like I feel like just someone's hit me with a truck a million times, and it took a long time, and there's just like nothing you can do to get rid of that until it just goes away, and that's the worst
Well,
part.
that's the
But
crazy part about the, yeah, go ahead, go ahead.
oh, I'm sorry, go ahead, you're fine.
Oh, it was just what you said about like before it goes away. That's what's weird about this palinopsa thing is that it sounds like it's a hallucination that doesn't end even after the trigger, the stimulus has been addressed, taken care of. So that's definitely worse than a hallucination because you don't know when it's going to go away. But I guess if the hallucination is a side effect of the medication, then did you guys hallucinate as long as the meds were in your system? So like a good 12 hours?
I
I don't
didn't
know about that.
hallucinate on medication. I was already doing it. I just noticed it more afterwards because a lot of the other stuff was cleared up. And you
Yeah.
said a long word that starts with P, and that is, I think, an occipital. There's two types you can have. They often start in childhood. And I forgot the question, but I would address your epilepsy first. This is what my therapist told me. Get your seizures under control. And I mean, I don't disagree with what anybody has already done, because your mental health is very important. And if that's working, keep doing it. I was just advised to get my seizures under control first because that can often help a lot of what you think is a mental issue, but is actually like a pattern of like post-ictal or just part of your seizures. Also, the med they're on might be causing new kinds of seizures. So that's all.
Lamotrigine was causing seizures, more myoclonic seizures, and even generalized seizures for me. So it can always be the medication as well.
Yeah, that's why I'm hesitant to try anything else. That's for sure. I almost don't even want to tell the neurologist what's going on a lot of times when you go back to the appointment because you feel like that's that never-ending cycle of, okay, you don't like this one, let's try this one, and best of luck. They never go into possible side effects or
And I always
warning of.
Yeah, and I always save like my old meds just in case, like that old bottle just in case, like which is they say to discard, but sometimes just to keep yourself safe, like I have my meds that I know work, like the Keppra, I know it works to stop my seizures, which is why like I'm a little frustrated that I had a seizure last night, but I am taking into accountability that it was almost 100 degrees out and humid and raining and hot, and we're moving the cats and we're going up 14 flights of stairs up and down heavy objects. So
Do you
I
guys
gotta
feel like you
take.
always have to come up with a reason for the seizure though? That's what frustrates me
I
that
know.
I
That's
can't
very
stand
true
when it
though.
happens. It's
I
never
know.
convenient. I'm on
Yeah.
everything I'm supposed to be, but these seizures are still happening and they're fucking
Yeah.
everything up at the worst
Well, and
time. Like, why?
sometimes it's like I had a great day and then I just seizure. Like sometimes I'm just chilling watching a movie, seizure. Nothing has like it's the same movie I've watched a million times. It's Coraline. I know every inch of the movie, every line, everything. Seizure. Okay, thanks. So there's no safety anything. There's no safety net. It's just seizure.
Katie, I would agree that I constantly feel like I have to come up with a reason, because they pump me for it. They're like, what did you do different? Did you eat? Did you sleep? What did you eat? How often? What, were you late with your meds?
If you don't
It's,
come up with a reason, then you are to blame.
yeah.
That's my
Yeah.
summary of it. Yes.
And even if I do
Obviously.
come up with a reason, I'm still to blame because I'm the
Obviously.
adult.
Because it's your
And missing
body.
some like family milestone, oh, just unacceptable. Yeah. Yeah, that's
You were too stressed out as a kid. It's your fault.
you know?
Yeah,
And,
right.
oh, Annie has her hand up too. I haven't heard from her in a bit. Sorry to
Yeah.
interrupt you guys.
I'm just wondering, I know for me, some of us don't have triggers or auras. Like we haven't recognized our triggers. Um, I can't say we because I have to make an I statement. I have. And I wonder if for those of us who recognize our triggers and have auras, do we feel a little bit more um that we have to justify that say, yeah, this happened because, and then I know personally I have to deal with the shame of, well, then why did you do that? And like you said, I wanted to be here at this birthday party. I wanted to be here at this graduation. So I had the seizure at home and not in the auditorium. I'm grateful for that, but things like that, I know it's going to happen. And I still can't get my family to level up and say, okay, it's not your fault. We know this could happen. I'm so, so grateful that Tom has that and he expresses that. You know what I mean? It's like, yeah, we all know. It's like, okay, I have epilepsy. I'm going to have seizures. That's just a fact. And I feel kind of I don't know, maybe we just feel we need to validate it more because maybe I know I feel a little bit more responsibility when I know my triggers, and I just ran a mower at full throttle around a half acre before this little tornado watch just came here. But yeah, I pushed it a little too hard. Am I expecting a seizure? Yeah, yeah, because yeah, I am.
Well, you should get a bottle of water right now. You will be muted until okay, good, good. Just making sure.
I will
I
go
think the
fill my
seizures are
Yeti.
always in the back of
Cheers.
our minds, though, for even those who don't know their triggers and stuff or their auras. It's always in the back of our mind, like somewhere, like I'm going to have a seizure. I'm going to have a seizure, even though we're not directly thinking about it.
That silent stalker thing that Em said
Yeah.
is coming to mind. It sounds like what Angel's describing.
I also feel like as a 49-year-old, I have like an expectation to be healthier than people who are older than me. And since I'm like we were moving yesterday and my mom's friend, not targeting me or anything, just like a regular thing people say, like, oh, I wish I was younger. But I kind of like that kind of just like sat in my mind for a minute because I was like, well, I am younger, but I kind of just wish I was healthier because like you guys are still getting a lot more done than I am. So I feel like too as like if you're younger and you have a chronic illness, or you're a parent and you have a chronic illness, you have this automatic expectation of like you have to be healthier though. Like that shouldn't have set you off though, or you can't be like it just I don't know, like
And
sometimes
when they say that,
when
it's like insinuating that you did it to
yeah,
yourself.
yeah, or like
Yeah.
I'm making it worse than it is, or I'm just doing it for attention. Like that's the same one over and over again. Always doing it for attention. And it's like, well, I don't know what to tell you. My body's doing it. You're making it seem like I'm doing it for attention. It's a chronic illness and we're all just suffering from it at this point because you guys are failing to help us.
I love how you said that, failing to help us. Perfect way to put it.
Yes. Ooh, you got a
That's like what they
question
said
there?
in the Chronicles today. Go ahead.
Sorry. No, sorry. You wanted to make another point.
It's something Pookie just said reminded me of what they said in the Brainstorm Chronicles today, like all the best lines that she wrote into that story of how it's failing to help us and the medications just don't do it, and something about stuck in it. I know it's in the comments. Go ahead. Did somebody else have something to say?
I just wanted to say, Lufa, that it's not personal. All old people feel that way. It's not that they're blaming you. It's that they don't understand. And things that they don't understand or people my age and older don't understand scare them. That's all it is. Nobody's blaming you. Maybe doctors, but that's, a whole different breed of asshole. But nobody's really blaming you.
No, and it's funny because if they were to take a moment to step back and kind of understand, they would realize that they do understand what I'm going through. Like,
Yeah.
we have a lot of the similar symptoms. I know my grandpa and I we have this similar, like, our head, our minds, our memory are the same. Like, he's in his 80s, I am in my 20s, and he understands me, and we work well together because we both are like two demented old people. So it is what it is. I think it's just more of if the other person is willing to be understanding. And like you said, a lot of people are scared of that, and a lot of people don't want to admit that. And that's okay. There's nothing that I can do in the long run to really change them if they don't want to be changed, if they don't want to understand.
Exactly.
There you go. That's how you look at it. So this
Sailor
article
Mom?
apparently. Go ahead.
Oh, Sailor Mom had her hand up.
Yeah, please.
I was just gonna say, yeah, even if they understand, even if they're people that are in your lives all the time and they take care of you most of the time, sometimes they could just get overwhelmed or irritated or annoyed with just the constantness of it, I must say. And sometimes they'll say something not nice or they'll react badly. So yeah, it's something we all have to deal with, even if we have a good support system, I think. Okay, I'm quiet.
There we go. So this article about a computer. Okay, I guess what they're trying to say is that they've developed what the article says is the headline is lab grown mini brain given epilepsy drug learns in real time. So they do show one picture of what looks like a couple external hard drives on a tray, and apparently the medical device basically on like the hard drive looking thing over to the left is probably where they put in the stimuli just to mess with it. And I guess that's what they're trying to say is the research. How these hard drives, these portions of the brain of what they're comparing to the brain, can self-regulate, they can adjust. So I guess when they give it like bursts of activity, they're saying only carbamazepine, for example, made the network better at goal-directed behavior, and some neural networks became more stable and organized through treatment. So it's something through Cambridge and came out of the UK. But I mean, finally, that's what I get out of this article. Nothing totally conclusive or life-changing, but finally, some kind of therapeutic success is achievable.
I'm trying to follow this. I'm sorry. Are you saying that on a medication like the one that starts with O, it helps the brain, other parts of the brain that aren't in the Bad Girls Club, like mitigate the seizure in
That's
the
what it's. I
Bad
mean,
Girls Club part?
have you guys seen Lucy? I just watched a badass movie, Lucy, yesterday. Okay, now
Yeah,
I
she's
can't
hot,
help
so
but yes,
she
I
like
can't
did
help but
stuff.
compare this to that. So it sounds like what they're saying is with this computer brain, they offered the stimuli, and you know how like seizures happen and these neural pathways are just kind of like tangled and fucked for good. This is suggesting that some of these experimental treatments can allow the hard drives that they're using as like brains to readapt. And the last quote here is saying our work highlights a key obstacle to this goal, that the neural functional endpoints we typically rely on to define treatment efficacy may not be optimal. So even their outcomes aren't quite good enough yet. And then importantly, we show these endpoints can be influenced and even improved with drug intervention, opening the door to more meaningful measures of therapeutic success. So I mean, they have to keep their sponsors somehow. But yeah, I think if the right people actually like keep this going, maybe they will reach some kind of goal. And yeah, if anybody sees Lucy, then shit will start to make more sense.
I seen it. It was good.
Yeah.
Would you guys like choose having your epilepsy fully cured or and having no feelings and kind of being like a robot, or still having to deal with your epilepsy but still continue to have feelings? Because that's like a really big thing for me to think about as someone who went through electroconvulsive therapy. So it just makes me think if anyone else would take an extreme length to where their feelings could potentially be almost cut off and have to be rewired in kind of a robotic way.
I can answer this. As much as I want my epilepsy cured, I do not want my feelings or anything taken away, anything that determines what me is me, you know? It's kind of how, like, what I fear what dementia will do to me, you know?
And that's why I think I saw a lot of the people I saw in electroconvulsive therapy were people of older age, typically with dementia, and things of that nature. I believe, I believe that's it would treat that too if they were having some really strong mental health crisis along with their diagnosis. But there were not, again, there were only about 2 or 3 of us that were in our 20s to 30s. So I think it really does. It's a very interesting look on, because I think that epilepsy and that are, because it is sending you into a seizure. It's a forced seizure. So it's just interesting how if you would choose something but have to lose a huge other thing. Sorry, I'm starting to sound like a 4-year-old here, but I promise in my head it makes sense. When it comes out my mouth, it just sounds like gibberish, but
No,
one day
I
you
see what
guys
you're
will
saying.
be on my
It's like it's give and
horizon.
take. It's give and take. It's what's more important, what's worth it. At the end of the day, it's all this whole balancing act that we all have to work with. So that
Yeah, I think,
neurofeedback thing though, yeah, go ahead.
It sounds
sorry,
like
I think
epilepsy.
it, oh, sorry, should I
Say
go
that
then?
again.
It sounds similar to the sort of, I don't know, maybe I'm misreading the sentiment, but sort of like in um, autism and Asperger's communities on Reddit, where the question arises, would you rather be cured, neurotypical, or would you? And I just like I'll take the impairments. It's who I am. I think I feel the same way about epilepsy. It is me, and I don't know. It's yeah.
Well, I was kind of thinking
Oh,
about it too because of if we would take $1 million or cure for epilepsy? Because it kind of is like almost the same question, but in a more like combative field of emotion because you're losing something instead of gaining something either way. You're losing something either way.
But
So I
this one
guess
I
it's
had a
Yeah,
different answer for.
yeah.
higher
Yeah.
I took the
stakes,
Yeah.
money
maybe.
last time.
Yeah.
This time I would keep the seizures. But that thing you guys were talking about, neuropsychology, I'm seeing as the method of obtaining the diagnosis, and neurofeedback therapy more as the solution for that
Yeah.
diagnosis achieved through neuropsychology. And I like that idea of neurofeed helping you to fix it yourself, even though
Yeah.
they say you're still gonna have to take meds.
Yeah, there's a place up here within like 15 miles of where I am now, and they offer it, and they offer it for epilepsy too. To I don't know, they say you can learn to read, like you can teach your brain to stop a seizure when it feels it coming on, like in your sleep and stuff. I don't know, haven't gone any further than that, but I'm looking into it, and I thought I would bring it up and see if anybody else had heard of it, because it was the first time I had heard of it.
I know that I'm being assigned with like a seizure or an epilepsy caseworker for disability and stuff, and they also want me to be in epilepsy support groups and like do therapy for it, but I'm not sure what they mean by therapy for the epilepsy. Like I don't know what that means necessarily if it's not medication.
It's probably talk therapy, but they say that if
But
you're
like,
going to do
what is
the,
that? Why am I?
don't ask me. They almost always want to do that. Anyway,
It's just like what?
they say even that with the neurofeedback therapy, that they still expect you to do talk therapy with it. And what they do is they put like an EEG scalp cap on you, and you like play video games and you control whatever with your mind, your actual like I don't know, the electrodes in your brain, I guess, or your electric activity in your brain to try to teach it to not do things or to overcome things. I don't know. It just sounds really interesting to me. I thought I would bring it up to see if anybody else had heard of it.
I just inhaled some activity on my brain. But back to what Angel was saying earlier, like that's why I don't want to change pills because I don't want the pills to change me. And I've heard of like pills changing people's personalities in different ways. And I like me. I like who I am now, and I'm comfortable with who I am now. And I don't want to be a personality change that's noticeable to other people. Because yeah, sometimes you might lose people with your new personality. Did anyone else have anything to say?
That always scares me, the whole like somebody telling you're different. Go ahead, whoever's talking, I'm sorry.
Oh, I wanted to make a completely different point that like I think the chat's getting we're getting more people in here. And I think it might be a good idea to use the raise hand feature. Because I think there's some people who don't have ADHD and wouldn't listen to themselves talk all day long. If you could just like Jason right now, yeah. If I was thinking maybe this is gonna be rough, but like try to keep our answers to like I don't know, like under 4 minutes. I'm gonna put a timer up here. I'm doing it right now. So Jason, go ahead.
Yeah, like so like like with to pyramid like nearly destroyed like my speech and my stirring because like I remember like personally when I had seizures and when they put me on pyramid like, like back in my hometown like I couldn't even get like a sentence out. I couldn't get a sentence out, couldn't get a word out. Like not like just I mean like just like not even everything like and like it was just a whole disaster. So like And like I try to talk with my doctor in my hometown in Tallahassee, and he told like you said I got on his pyramid and stuff, and they want me to pay like $180, and at that time I didn't have a job in Tallahassee, and like I felt like in Tallahassee and that hometown nobody was gonna hire me, so like that's why I decided like I went to a treatment center and and just did from there. And like there was this doctor, Dr. Wendy. So like, she helped me, like got me disciplined and got me and got my life straight. So and then after that, I it was from Sebring and then to Pompano, and like Pompano, and that's where I'm currently located, and that's where I'm living right now. So like like that that's why I got off the pyramid and I got off Geodon as well. And the years that with Geodon, like I mean, like I wish I had a college friend that would tell me that everything's gonna be all right. But like I feel like I never had that.
So you never really had like the support and understanding from your doctors, basically?
Yeah, basically in Tallahassee, because like
Yeah.
because like, with Tallahassee, like with Tallahassee, like they were no help. Like all they care about was just about money. That's just that's all they ever care about.
So, um,
Oh, sorry.
well,
I was gonna say, so pyramid's very it does that. It really ruins your focus and word retention. It's I'm trying to get off it right now, and it, I really don't like it. And I'll go back on Capra if I have to. It's yeah, I really don't like it. I have to agree with Jason there.
So while you're getting off the topiramate, the seizures don't feel like a threat. It's more the emotional and like mental.
Yes, it,
Oh, okay.
combined with Depakote and the benzos, it's just a flood of brain dampening mess.
Yeah, with that many, I'm sure you're definitely bound to feel it.
Yeah,
Yeah.
like yeah, like I was on 3,000 milligram when I was on 3,000 milligram of Keppra, and that was the max in Tallahassee. So I got down to like 1,000 milligram of Keppra. So like so like I'm still like working down to like I'm working down to get off Keppra. But I feel like most doctors I feel like most doctors in my hometown like were never helped. Like all they cared about was just like all they cared about was about money. And I never the first year the first day that I got there, like the first year like the my neurologist from there until actually retired. So like so like I was fucked completely.
Did they even leave you with a referral?
No.
Oh, that's horrible. Talk about inexcusable. But that's what happened to didn't Pookie, you said your neuro retired, right? Or is about to or something.
yeah, he's gone.
So
He's long gone.
yeah. So that's definitely something that comes up all too often.
When's your next appointment, Pookie?
Next month, so
Uh,
not too far away. We'll talk to my primary and just tell him to give me a new one. And
Gotta
most
hurry up
likely,
before you come East Coast.
huh?
I said
I
we
didn't hear
gotta
you.
hurry it up before you come East Coast.
Yeah, I need to do that too, and I need to make sure I get a neurologist who's going to prescribe me something before I run out. Um, the next one was: has anyone had their seizures change in their late adulthood coming up on 40. I am so scared of menopause. Anyone have their seizure randomly changed later in life? If so, how did it change? Uh, I'd say mine's personally, they graduated from TCs to wandering off. So, anybody else? How did your seizures change as you got older?
Well, I mean,
Go ahead,
mine
Angel.
just got
Oh,
that medication resistant thing. So they happen more frequently. Had to switch the meds. That was not how it was for the first 5 years, I think, after I actually accepted the diagnosis and started taking that first batch of meds. It took them that long, consistently increasing every 6 months to get to the max dose. And that's the first time drug resistant popped up on the chart when they put me on like Fycompa or something the next try, and it just didn't work. And then moved again, got a new neurologist. They looked at the chart and said, so nobody's ever mentioned drug resistant to you if you've been having seizures this entire time? And I'm like, no, I started my life. I got everything going for me now. I'm good. Then the seizures just weren't that bad yet. I was having more focals than tonic-clonics, and I thought since I was getting a college degree, I had the world ahead of me, and yeah, not true. Go ahead, Angel, you got your hand up.
Yeah, mine changed big time. Um, I was always unaware, and everything with my seizures while having my seizures and everything. And then I started getting the clusters. And the clusters, I am sometimes aware, and they're scary. They're very scary.
Moving on. Anybody? All right. Is family alcohol use. For those of you with epilepsy and avoid alcohol because it can lower your seizure threshold, what do supportive family members do to support your decision? If you're a young adult or teenager, do your parents abstain from alcohol or form of support? Or do they wish they would? Or do you wish they would? I'm a parent of a daughter with epilepsy who hopes she avoids alcohol when she's older, and I'm trying to figure out if and when to cut it out of our household. Parents, this is a parents question. Come on, parents.
As soon as possible, sooner the better. If you know there's something negative in the household that's not helping anyone, gotta face the facts before it's too late.
Yeah, I say follow your first mind.
Annie?
I have grandsons who are approaching their teens. Well, both of them will be teenagers this year. Holy crap, 15 and 13. I don't want to think about that right now. But anyway, my take on it, and the same thing with cannabis. We're a cannabis family. Okay. My kids who are adults, and the big thing was, oh, we don't want it around the kids when the boys were younger. And it's like they're going to be approached by it anyway. So the more they know about it, the better the better they can make those decisions. And that was my opinion. And I feel the same way about alcohol. Maybe just put it in a locked cabinet, but I don't believe adults should have to completely remove that unless it's something that cannot be contained. If it can be contained to keep, that distance from that child getting it, I would say don't remove it completely from the house. They need to learn while they're home that this is something dangerous and they're going to have to deal with it socially somehow later. And I'd rather see those kids be prepared to do that and not just thrown into the wild and have to find a way to figure it out for themselves. It's like, this is what it does. Have a little sip. You know, they see me having a bourbon on my birthday. And that's just part of the reason they call me groovy. You know, I'm not drinking all the time. Their dad is, you know, packing down 40s all day long. And, you know, they know that I have a healthy respect for what those substances do. My grandsons are also aware how I use natural substances. You know, I didn't come right out and say it, but my youngest grandson was like, you know, hey, I heard that this is good for nerve pain, and it happened to be psilocybin. And I'm like, yeah, I know. And yes, it is. It works very well. And it was like, oh, okay. You know, and he just wanted me to know that there was something that could help, not that it was an illicit or illegal substance. But I think that's healthier that kids are educated at home.
Can I raise
Calling
my
out parents. Go ahead.
as a parent? Yeah, I'm gonna say the same thing because my father was always very honest with us. My parents were divorced, but my mom drank, and she thought that cannabis was the devil. But my dad got, you know, visitation, and he would drink beer and hang out with his friends, and we hung out with our friends. And but he told us the truth about, you know, cannabis. It's not going to kill you, and they really have demonized it. But see, we're talking in the 80s and 90s, so it's before we've got some legalization going on. But yeah, he was always honest with us about stuff, and he told us, like, don't do this and don't do that. And if you're gonna drink, never ever drive. I was always a designated driver because my father beat it into my head from the time I could understand what alcohol was. And that's good. All my friends are still alive, right? From the parties. But yeah, uh, yeah, I agree with you, Annie. It's best to just tell them the truth. You don't have to leave it where they can get it, but you should be honest because otherwise they're just going to think you're a liar. And then what are they going to trust you with or about? Right?
Rick, you're a parent.
Yes. um, you know, yeah, you have honest talks with them, and hopefully you've had a long history of good communication. So nothing's off bounds and nothing is embarrassing and nothing is something that you keep from each other. You know, adding to what everybody else said, because everybody else had awesome points too.
Thank you for another awesome contribution. What's up, Mark?
Um, I just wanted to add in, um, I don't know, wait, what was the thought? It was,
Take your time.
forbidden fruit syndrome. Um, I had, a big problem with, alcohol and other substances. Um, and a lot of it, I think, started out like early on, a lot of curiosity, all the way back. Like, my very earliest memory was when I was 3 years old. My mother, we were in the kitchen, and my mother told me, "Don't touch the burner, Mark, it's hot." And I looked up at her and I looked at the burner, and the burner wasn't red and glowing. So I reached up and I touched it, and it burned me. But that's basically like a kind of a good little metaphor for a lot of like a big aspect of my personality. It's like if you tell me something is off limits, I'm gonna be like, Really? Why? What's so, is it really?" And especially with, a lot of these other substances like alcohol and other drugs, it can't be that bad if so many other people are doing it. It's the more off limits it is, but it's still, you know, used, it's still, seen as um an important part of, you know, somebody's social life or just their routine, the more it's um, tempting to a lot of personalities. So I'm not a um, I'm not a parent personally, but I would be frank with, the dangers of a lot of these things, but also that, they're good in some ways. The burner burned my finger, but it also had just heated up some oatmeal. So, these things have their uses, they have their places, but um, like rigid that off limits is, the more it's tempting. So,
And the less reason you give them for why it's off limits, the more chance they're gonna sneak off and try it. Just saying. My
yeah,
my
just say
brother had
no
that
wasn't a good
personality where
reason.
he would do whatever in the heck was forbidden, whatever in the heck was wrong. He was gonna do it, no matter what it was, from I think the day he was born. And he's still there, so it's a personality trait, I think. But yeah, a lot of people have that reaction, so it's best to be honest with your kids, right? Everybody who's a parent agree?
Yeah, I'm still calling out parents. Jeff, what do you think?
Well, I think Andy said it perfectly. What's the sense of hiding it from them when they're going to be exposed to it later? But I'm not the perfect example. Uh, my daughter is dead from a drug overdose. My niece, who spent a month with me after not seeing her for 40 years, uh, died a month later from a drug overdose. Uh, but I'm still here. So I was exposed to the same things they were. Uh, and I tried to show my daughter to use stuff safely. But, some people you can teach them and they don't want to learn. Uh, but I still think hiding it is a mistake. Uh, I feel very strongly that Annie said it perfectly. And anybody that says they're sorry, it's not a big deal. She died, uh, and I had a very strange relationship with my daughter. I loved her, but I didn't like her. Uh, and that's a terrible thing for a parent to say, but that's how I felt. Uh, and if you knew her, you wouldn't like her either. And I think that's all.
Angel?
Yeah, it's what everybody else been saying. You got to tell them the truth about it. I mean, you can, in certain situations, I can even go back and, like, if it was my daughter, show her videos, prime examples, like if it was drinking, you know, of her mom and stuff. It's like, yeah, you know, and you know, I can just like it's you got to educate them right, not the way the schools do it, and you know, but you got to educate them right, educate them why, you know, if they're epileptic, tell them this is why, what it's going to cause, you know, and you know, everything has a consequence. You know, you want to do it, you're going to have to be prepared. You're an epileptic, prepare for a seizure, you know.
Yeah, I'm glad I got all that from you guys because I had no answer at first. But yeah, like you guys said, don't hide it. Tell them about it. Um, yeah, that's it. Just don't hide it and explain it to them. Maybe the more they know about it, like Sailor Mom said, the more they know, the less they would want to do it. And then next question was kicked out of school. So I'm just finding out about ADA Act. I was kicked out of school when I was younger from my epilepsy. It was uncontrolled. I didn't start seizing until I was 16. But is there any way, anything I can do now? I've been trying to get GED, but it's been hard. And I haven't been able to pass. I've been trying to get a job, but without a GED, no decent places will hire me. Advice.
I would just think don't give up. You know, see what services are available for counseling. I mean, if there are some kind of tutoring services available, you know, whoever's administering the test should have some resources or you know some kind of light to shed on that point of just how can you get some help if the GED is not coming to you. I mean, who knows, maybe there's some dyslexia going on or something that is just not being handled, and that's what's actually stopping you from learning. That's one of the subjects that I wanted to bring up today, is that I feel like, you know, as time goes on, I have to learn as much as I can as quick as possible because I just feel like it's gonna get a lot hard, you know, only get harder.
Well, I feel like this is a Nicole point, if she was here, and she would definitely say you have to go to the school and say you need these accommodations in order, you know, to get things done. And if they can't accommodate you, then yeah, it definitely goes on beyond that. So
I'm it.
Yeah, so I'm in college, and with my epilepsy and everything, I was able to get accommodations from the school. So right now I get extended time, like 1.5 times on the regular time on exams, as well as a distraction reduced environment. But yeah, all I had to do essentially was just reach out to I go to San Jose State, and what they call it is the Accessible Education Center. And so all I had to do was reach out to them, and they provided me with the accommodations. I provided the doctor's note. But yeah, I feel like if you just like go out and just like do like inquire about it, then I feel like you should be able to get some type of like accommodation. So yeah, that's basically what I had to say. Yeah.
Great
Yeah,
points.
when you said
Thank you. I'm glad to hear that that's actually out there. One
Yeah.
and a half times. That's for real. That's
I,
substantial.
I was going to say, go and ask for an IEP and then they'll do a whole assessment and they'll figure out exactly what they need to do to help you. And if it's not enough, you can certainly go back in there and ask for more. And of course, you can involve an attorney if you have to, or a civil rights group. So try that first, maybe. I don't know.
Oh yeah, when you said San Jose State, that reminded me. Yeah, you're around here. You're less than 30 minutes away from me. Yeah. I'm in the East Bay, you're in the South Bay. So yeah, that's another person in the Bay Area.
Hell yeah.
We got
And I
four in here
just,
now.
yeah, and I just moved out of the North Bay like 6 months ago. For 20 years, we lived there.
And me and Em are in the East Bay. And
A IRL meetup, maybe?
say that
I
again.
like that idea of the GoFundMe to move us all, the rest of us out there.
Yeah? No, I like.
Shit, I'm gonna be in Jersey next month. What the fuck?
Yeah,
Yeah,
you guys would love it.
I don't know. We'll
For
see.
sure, you'd love it. If it was ever affordable for people, you'd love it.
Oh, we got family out there and everything. I just don't know about tax. It's the money, the money, the cost of living, and too unfamiliar being back to month to month. That month to month budget is too intimidating.
We're in
But
Jersey.
I think we're going back to not Hackensack. I know they left Hackensack. So somewhere north. I know they're North Jersey now. But yeah, I'm definitely not the one keeping track of where everybody lives. I can't even manage names. This woman raised me. We're talking my godmother. We're going to visit her, and I'm gonna have to like try really hard to pick her out of a crowd. I don't I don't know. But that's how it is. I can still introduce my children to her and just kind of try to play along.
As long as you remember their names, you're okay.
I was thinking about just going auntie. We'll go with that one. Mother's got like 5 sisters, so yeah, it's hard to keep track.
This person's asking for advice. So you guys gotta listen because this one is a long one and I'm not gonna remember it. But you guys gotta answer it. It says doctors have changed test results 4 times. To start, this is in reference to one single EEG switching from normal to normal to abnormal again. This is not about having one that is clean and then another that is not. This is a single test that flip flops every time I see a neuro. Well, technically, not a single EEG, as each neuro I've been to has said that all the ones that they have seen from me are either normal or abnormal. None of them believe that I might do some clean and others not. Wait. None of them believe that I might do some clean and others not. How are they able to switch it so many times? I can understand once, maybe a doctor missed something. Maybe it was the right one, maybe it was the right cusp of being normal or abnormal, and one felt it didn't show enough to keep it normal, while another felt it didn't show enough to have it be abnormal. I constantly feel like I've been in game of tug of war between these test results for over a decade. Honestly, I don't even believe a doctor when they give me a result either way because I know the next one will just revert all the test results to support their claim. It makes the test meaningless. I just don't get how and why they can switch it so much. For the why, does it really make a difference? They all medicate me either way. Is there anything I can do? The only thought my brain can say is get a second opinion, but I don't get what another opinion that is going to flip flop what my current doctor says will do. If there's really nothing to do, then that's fine. I just feel lost and confused, and I'm trying to make sense of what to do. Also, there's been a lot of doctors, but I wasn't going hunting for one that agreed with me. 2 retired, and 1 was a pediatric one, which I aged out of. From the parts that I do remember of that, I forgot what I was going to say. So, yeah.
Okay, nobody's going to ask you to read it again. So I think what I got from that one was just it sounded like somebody else who's having trouble adjusting, keeping up, essentially. I mean, the one thing, what stood out to you guys most about that? I mean, I'm thinking the chart. Even if a doctor tries to revert a diagnosis, if that diagnosis has already been made with evidence to support it, then even if the next doctor says they don't believe it, you can't necessarily count that as fact just because it came from a medical professional. So, the evidence is there. You got to keep it because sometimes maybe they will try to erase it to save their reputation, but yeah, take that with a grain of salt.
Next.
Sailor Mom.
You're
Unmute.
still on mute. You're on mute.
Annie had that happen to her, right? Where they changed her results and stuff. So maybe we should ask her. But what I would say is get another opinion, get another doctor. I know that sounds like, okay, well, every doctor's the same. And I get that, right? Like we all kind of deal with well, let's just change the meds or up the meds or add a med or. But there's good ones and bad ones. Am I right, guys? I mean, I don't know.
Yeah.
What do you guys think about this? Annie?
Yeah, I'm
Oh,
thinking, I just got lost there. I have a feeling that I was a little confused. First, this person said it was 1 EEG, and then they mentioned all the EEGs. The doctor said, from all the EEGs from you. So I'm not sure if it's one or several, but I've had that happen to my benefit, where a different neurologist looked at an EEG and found something that the previous neurology doctor was not aware of. And it's one of those spike wave patterns that show deep brain seizures. So not every doctor just like anybody else, there's levels in those specialties. So it could be something like that where a different doctor looked at it. And then I kind of gathered a little bit about how can one test be fine and the others are not, why can't I get all clean tests? And that word clean kind of threw me. But if you've had epilepsy long enough, and it sounds like this person has, you're going to be aware that you're going to have normal and abnormal depending on your medication. They want you to have an abnormal EEG when you're in the EMU, but you're going to have a normal EEG when you're on your medication. And it kind of sounds like this person might be stuck in that kind of what's going on. Do I even need this medication if it's normal? If you're having a normal EEG while you're taking medication, that's the goal. That doesn't mean you can stop taking the medication. Yeah, I'm sorry. It doesn't sound like they were changing a diagnosis either. But how can it revert to normal and abnormal? You have to account for, the medication. Were you taking it at the time or not? And did you have the proper medication or not? So all of those factors have to be considered before you say, oh, I had a normal EEG. I don't need these pills anymore. So yeah.
That's a better way to put it. You definitely had insight into like the bigger picture there. All right, go ahead, Em.
I think I might have misunderstood the question just based on what Annie said. So they didn't get a new diagnosis. They just want to stop taking their meds because of the EEG.
No, I believe he said he got an a normal, then an abnormal, then a normal, then an abnormal, and yeah, he said, how are they able to switch it so many times? There's a lot going on there. That's why I kind of read it out loud. I couldn't even paraphrase what I thought was said. So,
Unless anybody else has input, I don't have anything to say.
okay. We'll read the first comment. Oh no, the first comment's way too long. We'll move on. This one says JME. Has anyone else who has been diagnosed with juvenile myoclonic seizures had a seizure from stress? I recently had one after 14 years of being stable on medication. Now I'm terrified of having another one due to stress. I am on 2 anxiety medications for now. I'm just curious if this is a thing that can happen regularly or would this happen just because of an extreme stress case? I don't have JME, but I know you can still have stress induced seizures. I think that would be the word. So avoid
Did
stressful
Amir was
situations.
Amir saying his brother or he had a sibling with juvenile with
He said he had
JME?
a sister.
Okay, so maybe if they had that, I wonder if the JME is genetic. Let's look into that.
I think he said it was. Is he still here?
No,
No,
I
he
just
left.
noticed he's not. He must have had to dip, but I'm saying yeah, JME is definitely genetic.
Well,
I
I
don't
have
have
it.
that. Just oh, sorry, go on. I can't see whose
Oh,
hand is raised. I'm on my phone.
no matter. No problem. But yeah, definitely stress related. And in combined with other triggers, um, depends on what the stress is. It could be uh I, it could be family stress. It could be you know like it, it, you gotta narrow it down because it depends on what stresses you out personally. Um, I remember having a few seizures in school, like trying to focus on the board and trying to do a lot of calculations in my head um and the heat being turned up and those two combined, I just blew a fuse and I had a seizure. So um yeah, so mental stress, uh, physical stress, anything. Yeah, it definitely is a factor.
That makes sense. Thanks for the input. At least this time it's not just saying it's hereditary, so any of your children are gonna have it. It's not like those weird ones that always skip a generation. It's easy. I think it's fair to say that any of the epilepsies that fall under the genetic category are just not understood.
Got one here. It says, "Do you follow a particular diet? I've come to realize that maybe alcohol and coffee do affect me, and I will be cutting them out of my diet. Did you have or try officially giving up on something, and did it work?" So far, I stopped with nicotine maybe a month or 6 weeks ago or something like that, and I'm just waiting for a seizure.
I gave up all sweets, thinking that that might have a something to do. Uh, over a month ago, and I had a seizure last night. So it hasn't helped me at all.
All right. Well, there you go with that. What's up, Angel?
I was going to say I went on to the Mediterranean diet, and while it has improved with my memory because of all the fatty fish and stuff, I still have seizures too.
Sailor Mom, did you have something?
I was just gonna say, I wonder if they have had, a stay at in hospital stay where they test by giving you caffeine to see if that's one of your thresholds or one of your triggers. They don't. Some places give you alcohol. I don't know who. I didn't have that, but But yeah, I was just wondering if maybe that's something they could look at. But no, I don't drink alcohol, and I never have really. And caffeine is a pain in the butt to give up. But they say that it's not one of my things, so I really shouldn't have to give it up. But, you do what you have to for the people who have to deal with your seizures. Y'all know what I'm talking about, right?
Right.
Yeah, if we could narrow it down, then I'm sure
Yeah.
we'd give it a try.
Yeah, they just want you to try. So, whatever.
You guys are in the comments, Sailor Mom and Ann, but I'm gonna read it still. It says, "Have you had any near-death, literally close calls from a seizure?" I have. I stopped breathing, and I had to have a helicopter come and get me. I believe that's happened twice. I mean, not the helicopter both times, but the stop breathing twice.
Is Jeff here? I know he has nocturnals, so it's a little different. Or if he stops breathing. Jeff, do you have anything? Maybe he's not here.
I I use a CPAP machine, so I don't really stop breathing that I know of.
Yay!
Sometimes I wish I'd stop breathing, but it hasn't happened yet.
Jeff, you need to get some sun and have a non-alcoholic cocktail.
As soon as I get back, what I consider now my home, I will get plenty of sun and will stay away from those alcoholic cocktails.
There you go. Get back to watching the meetings after you get back, make it on to the West Coast.
Yeah, it's killing me here.
Oh, I bet. It sounds like the weather is just ridiculous this week.
It is. Well, the last couple of weeks.
We're waiting
Ugh.
for you, Jeff, on the West Coast.
Yeah,
Right. Waiting for you.
There you go. You're gonna have a surprise party.
I'm sure.
We'll have it online because we can't drive to you.
Kevin, he
Any
plans on
characters you
leaving us.
like? What decorations?
Decorations?
Yeah, any characters you like?
Pre-rolls.
Ah, those the
My
gate
favorite
great person.
decoration.
What you say?
That's my favorite decoration.
All right. Good to go. Gotta decorate for son's birthday in a couple days, so figured we might throw something else in. I didn't
Well,
think you were gonna say PJ Masks was your thing, but
I don't have a favorite.
all right, all right.
Everybody
to go.
likes
So
chocolate.
I guess
Mhm.
Batman. Does he count?
Oh, that's a badass superhero, yeah.
Because he doesn't really have a superpower. He makes them all himself.
He's
That's a
rich.
way of
That's his
looking at it.
superpower.
Yeah, he's his own. I like that.
All right. Fat Man Jeff it is.
Hmm.
Em, you want to put together that one about that what was it? Childhood epilepsy during sleep?
I do. I just saw the chat. Annie mentioned near-death experience during seizures, if she's interested in talking about it.
Oh, okay. Yeah, yeah. Oh,
I'm
okay.
here.
So that's one of the ones that she replied to. Okay, go ahead.
Yeah, I did reply to that. Yeah, I've had a lot of those. Some I remember, some I don't. There were things that I remembered that when I talked to the doctor about it later, he was confused because he said, but you were what they call you were altered. I was comatose. He said, how could you remember that that happened? I'm like, why are you asking me? You're the doctor. I'm just telling you what I remembered, you know? So there's a couple of those. And, you know, I think the scariest ones were the ones where I was comatose for days. And I remember one, it was coming out that was, yeah, coming back is a little fuzzy. You know, it's like that was more dramatic because I don't remember. Athena, stop, baby. Sorry, she is chewing her feet till they bleed. But I do remember a lot of that stuff. Ouch. Okay. I had to take care of the dog, maybe put her in a separate room. But yeah, the near death experiences, the ones I remember are the ones I needed therapy for. I'll just leave it at that.
All right, plan on a puppy play date at the end of July, Ann.
Tell the
I got a
moms you
good
in the
near-death
comments.
experience.
Oh, go ahead.
I was in a fire.
Oh,
I had a seizure at the same time. My house caught on fire.
oh man.
Do you
Yeah,
want to
What was the
elaborate?
cause?
I
Yeah,
probably
please.
I probably should. This is this is like a 1 in a million chance. It was I was still having several seizures a week, and it was coming up around the 7 year anniversary of this. Um, it was July, really, really hot. It's like 100 degrees or something, and it was an electrical fire in the back of my house there, and yeah, burned down half my house, and I was just unconscious for about a few minutes, and I had other relatives home at the time, and I don't really know how I got out of the house, but um, fire people got here really quickly, and um, I woke up outside the house. And house burned down. Half of the house burned down. So um, if my family members weren't home, I would have died. Yeah. So uh, that's that.
That's 1 in a million, like you said.
Right.
Thank you for sharing that. That's
Yeah.
so crazy. Glad that you're here.
Yes.
Yeah, we're all glad you're here.
He was the second person I met. The first day.
So okay, off topic. He was the second person in the Zoom. Is that what you're saying?
Yep. First day. There
OG
was
Kevin.
there was one guy from Austria. Wait, no, he was from Turkey.
Oh
And
yeah.
and then there was a guy, Kevin, then Brandon, then Rick. Yeah, so
You got the best memory out of all of us. You remember names and locations? That's
yeah,
impressive.
it's out of nowhere. It's not something that usually happens. That's a 1 in a million, like Kevin. That doesn't always happen like that.
That
'Cause I
just
already
shows you
think,
got your shit together with this group.
yeah, because
I think we
Yeah,
met
I
we met
usually don't
soon
remember
after
what's
that.
that. There's someone else. I think his name was Jamie. He was here too, and it was like his first time. There's a short I made with him, and he was talking about would you rather be happy and epileptic or taking your pills and be unhappy and raging, but not epileptic? And I was like, that's a good way to put it. But yeah, I'd rather take my pills. He said it's a catch-22, so yeah, I'd rather take my pills and try to get better. But Sailor Mom, you were in the comments also. I didn't.
Yeah, I did. I did comment. And then I talked to Annie in the
Yeah. So
comments.
what's your Or should I have to go read your comment?
Oh,
Let's
no,
see.
you don't have to. Let's see. Well, I don't actually remember exactly what I wrote, but something to the effect of I've stopped breathing a lot, and yeah, and the status epilepticus, where they wanted to put me in a coma and intubate me. I was lucky enough that my husband said, please don't do that unless you absolutely have to. So they didn't. Like, Annie's been put in a coma and been intubated a bunch of times, and I just feel terrible for her about that. But yeah, I don't know. It's, yeah, it's a real thing. I didn't want to admit it, but it is. Anyway.
I don't want to push it, but isn't it the thing about being intubated and coma and all that? Isn't it just way too? Doesn't it feel way too easy for them to like let you slip away? Is that kind of why you don't want to get to that point?
Well, maybe. I don't know. I'm not. He didn't want to do it
That's just my
because,
impression of it. I don't really know what it involves.
yeah, I mean, how are you going to bring somebody up out of the coma? If you can't get the seizure to stop, how does putting them further under and making a breathing tube work? And the only way that I could figure it out is I was literally sudepping and not breathing, just not at all. Because that has happened multiple times. The very first one where my husband, discovered me, I don't even know how many minutes away from dead, because I was just barely breathing, and I was just total foam, and he just happened to wake up and go, oh my God. Yeah, so yeah, I mean, that's scary stuff. I'm not as scary as Annie, but yeah, I don't know. SUDEP is real, and status epilepticus is real, and I don't know why putting people in a coma is better, and that's why my husband said don't do it unless you have to, because he didn't know why it was better either. Yeah.
Well, thank you for bringing that into focus for all of us now. What's up, Jeff?
But, since I've never knowingly had a tonic-clonic, do all of you that had them stop breathing at some point? Is that common?
I've never been monitored during any of my bad ones for I mean they took me out. Like they got me out of it before it got to that point. So during like the longest bad ones is when I wasn't in the hospital and being monitored, so I can't say for sure, but I have a suspicion just because of the headache. The longer whenever it's over 2 minutes, been recorded over 2 minutes, the headache will last 8 hours. And it's that
Yeah.
same like dull throbbing kind of always there. It's a different kind of headache for sure.
The kind
So
you want
that's
to
why I
sleep
suspect
off.
oxygen loss. Yeah, I suspect oxygen loss just because of the residual effects.
You
I
will
have some of the same
definitely.
effects. I get that headache as well. And as far as I know, I don't stop breathing, but maybe I do.
That's what had me thinking, like, just because my lips aren't blue, I mean, what else could be causing a headache like that if I didn't thrash around so much and hit like and those kinds of headaches feel different because when you smack your head, it hurts
Yeah.
there. There will be a lump. There's more
Oh, it's
evidence.
definitely a different headache. You can tell right away.
Yeah, but I mean that's the kind of reassuring part of hearing that you guys have the same headache because I'm at the point now where I think this machine is doing more like harm than good sometimes.
Mm.
Who knows if these shocks aren't causing the headaches? I don't think so.
Okay.
I don't think so.
All right.
What's up, Em?
Oh, I want to let Jeff go too, and then I'll go.
I'm done.
Okay. I can't like even relate to Kevin and Annie, Kate, Sailor Mom. So thank you for sharing. That's like very, I want a better word for intimate stories, your personal stories. So I want to preface and say like this can't compare to that in any way. But you can go into non-convulsive status epilepticus, which I did also at the hospital, and they take blood from an artery or something close to your heart, and I think it was my carbon dioxide was very low or my oxygen. So for people who have focals or seizures in your sleep like Jeff, that's why I do push the nanny cam. You have to watch really carefully if you want to see if you're stopped breathing. And for those people, people with focals do need a rescue med, I think. Yeah, even better if you have somebody who can recognize it. In a sleep study, Jeff, I think you already did one. And the CPAP. So that's all. I just wanted to call out the focals, even though they're not really anywhere near a fire
Yeah,
burning your house down.
I did a sleep study for the CPAP, and I recently did one for my neurologist. And I have a nanny cam which is not set up. And when I am going back home, I am going to order your whatever it's called. But the one you recommended, I have it set aside. I just don't remember what it is, and I'm ordering it.
We will remind you nanny cam as much as possible, and you will get some Batman decorations.
Yep.
Get a Batman suit and sleep in it. That will make it more fun to watch the footage.
There you go. That's putting two and two together. Thank you.
Or
You'd
some
rather
like
not know
pajamas,
what I'm
put in
sleeping in.
pajamas.
I don't wear them.
So I just wanted to let Jeff know the tonic-clonics, your brain literally just stops too. And the oxygen stops, so this is an increase in brain damage. Also. So technically, yeah, you're dying every time you're having a tonic-clonic.
Okay, that's what I thought.
Yeah.
But
Oh, sorry.
go ahead. Mama's taught me ladies first.
I was not taught that. So please go ahead.
Okay. But yeah, and I had my first cluster, which, like Anne said, everything that can get you in pretty much in a life-threatening situation, you will need therapy for. Yeah. And I was convulsing for at least 6 hours. And I was lucky that I didn't go into status, but I'm not, I'm sorry. I don't mean it. I'm trying to say to Mom and Annie. You know what, guys? What I mean.
Yeah, it makes sense. Go ahead, Salem.
I'm not sure exactly what I was going to say now. Uh, we were talking about,
But yeah,
I think it was the residual effects of the longer tonic-clonics.
yeah, they're
yeah.
pretty
Something like
severe.
that.
Yeah.
But yeah, you will feel a different type of headache.
Mm-hmm. Yeah.
Sometimes it will last days.
Days. Yep. And
Yeah.
just, well, my epileptologist said just an aura, which is a small seizure basically, before it goes everywhere, is like a 16-hour workout. So times that by however long, you're seizing for. When they say like a 5-minute one is the longest you should be having, when you're having like a 45-minute, or like you, Angel, when you're having 96 hours, however, that's good grief. It's like putting your body through a washing machine. Ouch. I'm sorry. That sucks.
I gotta go be a dad. I gotta put on dinner. Somebody, you guys, go ahead.
Go right ahead.
Enjoy.
Yes, and Kate too, if you need to run out, just let me know. I can't see
Okay.
who's has a raised hand, so if everybody else can just help me out there.
I'll
I'm
keep
on
an
my
eye on
phone
that.
right now. Okay,
Yeah, that's
thank
cool.
you.
Okay, so I was surprised right here, pulling up the Epilepsy Society of the UK .org.uk. I like that one a lot better. And one of the subjects on here is making the most of your pharmacist. Have you guys ever had better luck with your pharmacist than the doctor? Actually bringing up some kind of interaction, or like, I wouldn't be surprised, but I kind of want to know if anybody else has had that.
Yeah.
Mm,
Please elaborate. When did the pharmacist actually do something like you wish your doctor would have done?
Oh,
Who?
sure,
Who
I'll go
goes?
first.
Yeah.
I had a really good pharmacist at CVS, but they shut the CVS down, and I have to go to another pharmacy a few miles away. And these people are weird. They're shady, actually. I don't trust them, and they I don't know. I just don't trust them. And I actually got banned from that store for yelling at them. I did. Yeah, because they keep withholding the clobazam, and I have to
I'm
wait
sure
till
they
like,
deserved it.
well, I yelled at them and I said something very mean to them, and they sent me something from the sheriff's department, and it said you can't come. Oh, it's a big city. Philadelphia is a big city, and I go in there all the time, and they don't know it's me. They don't got my picture on the wall. Like, what? What are they gonna do? Call the
But you
police?
made an impression that time.
Well, yeah, whatever. But my
Nobody's
last,
keeping track of you in Philly. I get it. Go ahead.
yeah, they don't care. The last CVS I went to was actually really excellent. They had great pharmacists there, and the new one sucks. That's my point. Someone else go.
I lurked in the CVS pharmacy subreddit for a little bit. Um, and yeah, I feel like you gotta find one where they're not super overworked, which is hard, or they just all happen to be nice. Um, like you said. My point is that pharmacists complain because they're underutilized and they know all these interactions, but all they do is fill pills. So get a consult, like if you're having a problem, seriously. Not with like a bitchy pharmacy though.
When I first moved to Pennsylvania, it was a little further up the river than where I am now. And there was no large store there, so I dealt with a local pharmacy. And at the time, I was on a lot of opiates and steroids. And one time my cardiologist gave me something, and the pharmacist called me and said, "You can't take this." And he did that on several occasions when different doctors would give me things. He would either not fill the prescription and tell me, or he would call me beforehand and say, "Yeah, if you want to take this, you have to stop taking the other thing." So I haven't had that now that I go to CVS, but when I was in a small local place, I had that. Who's over next?
I wasn't here for the question.
Sailor Mom
I
and Annie had their hand up.
yeah, Annie, you want to go first?
I know I shared this story before, but it was a pharmacist that literally saved my life and refused to fill a prescription for Depakote when I was on lamotrigine because the dosing needs to be adjusted appropriately. Apparently, the way the two drugs react together, and the script wasn't written appropriately. So she stopped the script and said, "I can't do this for you. You have to call your doctor and let them know." And this doctor was a brand new PA, and of course she wasn't having it. And I'm like, "Well, I'm going to have to come in there and, for another appointment." And that was her, the quintessential, "Sorry, y'all just lost a $2 million sponsorship." But yeah, she nearly killed me with Depakote and then told me to hit the streets for medical marijuana. So, but it was the pharmacist that saved my ass that day, you know?
Um,
Thank you, Annie. Always perfect insight. And Sailor
I
Mom.
have a. Oh, sorry. Go.
So 2 times. One time I had a really bad experience and I had to change my pharmacy afterwards and I had to turn them into the pharmacy board because it was one of those things where you're changing your meds, right? So they give you a prescription and you're titrating up as you switch over, right? So what do? They give you, 1 week is going to be this amount and the next week's going to be that amount and the next week's going to be that amount. And so, all together it's supposed to be a big bottle. They gave me enough for like 1 week. And then they tried to say they didn't do anything wrong and that I was drug seeking. Like, who seeks anti-seizure medicine anyway? But and it was a big to do. Oh my gosh, I had to take my prescription back in there and they still wouldn't. I had to get my doctor to call and transfer it to a different pharmacy because they just would not admit they effed up. And then I had a pharmacist do a good thing, and several times where my doctor's office is really big, right? Because it's at UCSF. And so sometimes they don't get back to us in time before the refill is supposed to be up, like, you call them a few days ahead of time and you put it in your mind, try to do whatever. And then you also call the pharmacy to have them call. But sometimes they don't always get back in time. But you need that medication or you're going to start seizing, right? So I've had pharmacists override and give me like 10 days worth of a medication or give me a prescription for my rescue pills, even though she hadn't actually talked to my doctor, because she could look back at my history and say like, okay, you definitely need this. I don't want to be the one to say no, and then tomorrow you're dead. So I had a really good pharmacist down there, and she was really good at that.
Okay, so some pharmacists do come in handy, to say the least. It sounds like she actually did, went above and beyond on that one.
Always. She was a miracle worker. I really liked her.
I wonder why so many other pharmacists just seem like they don't even want to give that information. I'm seeing over here in the UK how they can give shots and do all this other stuff. But, oh, speaking of, what do you guys think about CDC not recommending as many flu shots anymore. Did you guys ever have reactions from vaccinations or seizures
Um,
caused by?
I did, but I didn't know it at the time. But the vaccine caused more seizures, but it also helped a precancerous area. So I'll take that. I seizurely side eye this administration. So that recommendation I don't really trust for that reason. Um, but yeah, I'm honestly more interested in everybody else's input here.
Go ahead. I don't see any hands raised. Hey, Sia's here. So Sia, if you didn't hear, that last question was about vaccines. If they just said something about flu shots, not as many flu shots being recommended, and I just thought to bring that up to the group and see if vaccines have ever caused a reaction, or you think epilepsy was ever affected by vaccinations.
I can't say that I have any experience on if it's affected my seizures because I haven't gotten any vaccinations since I started having seizures, but I will say that myself and my family, like my kids as well, have had a lot of issues with vaccinations. My son had a severe reaction to the DTaP vaccine, and he isn't allowed to get it. I'm not sure how long they want to wait, but he had such a severe reaction that we think that it might have affected his body like long term, but we've yet to see like how that could affect him.
Was it
Does
gamma
anybody
ray?
know? Oh,
Okay, go ahead.
sorry. Does anybody know why flu shots and vaccines affect people with epilepsy badly?
I related to the catamenial. The a vaccine would definitely prompt a change in hormones, and anything drastic or severe from diet to exercise to elevation, and any drastic changes always bring something on for me.
I guess anything that throws your system off, yeah, even in the slightest.
Yeah, you're trying to provoke an immune response with um these
Vaccines, yeah, you're provoking immune
yes,
response with like a little piece of the
yeah,
disease. I don't know, I don't remember how to say it, but I know what you're talking about.
yes, yeah. I had the V. I knew that. I was trying to find the rest of the word there. Yeah, it's intentionally causing an issue. So if it makes sense that we don't necessarily fully understand all the ramifications of that.
I had taken both COVID shots, but this doesn't relate to epilepsy because I didn't have it then. But I can't take flu shots at all, and that's because of my Lyme disease. But that has nothing to do with epilepsy, so I'm sorry.
Yeah.
Jeff, just to jump in, isn't Lyme related? Oh, Kaden. Isn't Lyme related to seizures? And also I do just want to say you might have been having seizures since you didn't know. So if you got any vaccines, or maybe you didn't, you already had Lyme. It could have affected you. Just saying.
Lyme is well known to cause seizures. My neurologist sloughs that off. He says, no, it can't be from Lyme. He's spoken to his Lyme expert, and he dismisses it, but I'm fairly convinced that it comes from Lyme.
So
And,
they're trying to give you the impression that they're positive Lyme disease is not affecting your central nervous system.
in my case, they're saying, no, it's not. They're saying, yes, it can, but that's not it in my case.
Okay.
And I don't know how they're coming at that conclusion. I think they're full of crap. Um, but here's the thing. My wife believes in these doctors, and I do whatever makes her happy.
And just put it to bed with that. All right. What's up, Salem Mom? You had your hand up.
Well, I was gonna say that I don't know how much I reacted to my last vaccination, but two things. One, I can't, like, if I go to the dentist and they try to put needles of numbing stuff in, it is 100% guaranteed that I am either going to come home and go into status epilepticus or a horrible cluster or worse. Like last time I ended up in the ER just from a tooth cleaning. I told the lady, I was like, I don't really think you should be putting like a bunch of needles up in my gums. Like, I will take the pain from your cleaning. It's okay. And she was like, no, I have to do this. And so because of that reaction, it's scary to go to the dentist, when they don't listen to you. But the other thing is my children, they were going to do the DTaP with a bunch of other shots, and we purposely told the pediatrician to break it up because we were like, that's way too many vaccinations at once, like really bad. And thank God they didn't want to listen to us, but they did, thank goodness. So yeah, I know the DTaP can be really, because it's so much all at once, it's really can be a lot. So I sympathize to you. And I hope your son's okay. I'm sorry. It's terrible.
Yeah, he's dealing with some separate health issues. He has to go in a couple of months to get another urine test because he started having blood in his pee. Very random, kind of scared the crap out of me. But they checked out his kidneys, they look okay. But yeah, like I've been like a hawk on him for years ever since that happened because he was a year old. And yeah, it was scary. And they tried to tell me that it wasn't from the vaccine, but you read the pamphlet that they give you, they tell you the side effects of a severe reaction right there on the paper. So it's kind of hard to miss. And ever since that happened, I started breaking up all of their vaccines. So everything that they've gotten since then has all been like one at a time.
We
Yeah,
were
well
like,
said.
why are you trying to do, I think it was like DTaP plus like 4 other things, and we were like, okay, we have twins, and there's no way I'm dealing with 1-year-old twins that have just had like 5 vaccinations each. And also, I really don't think their bodies can take that much at once. They're so little. Are you kidding? That's terrible. I'm so sorry. Blood in his urine, that's awful. I hope they figure that out before it is a bigger problem, I guess. I mean, God, it sounds like it's already a problem, but anyway. Green, I'll be
Annie?
quiet.
I saw that, Annie, and yeah, we did get him tested multiple times. It was twice that they did 2 cultures and 2 tests. Both times they didn't find any sign of infection or bacteria, which they told us was a good thing, but obviously that leads to other reasonings because the only thing that they found in both tests was just the pure blood. No protein, nothing else, just the blood.
Well, on a different note, what I wanted. Oh, Em, got your hand up?
On just quickly on Lyme, if you've had any ticks, I think you can get a test for spotted Rocky Mountain fever. So just check out Alpha Gal, and some fillers in vaccines have mammal fillers. That's
Hey, any advice would help at this point. Oh, if that must be something you definitely don't want to give up on. And whenever a medical professional comes back with an explanation of everything's okay and just expect you to walk out, yeah, in the pediatric office, that's infamous. But like I said, on a different note, Sia, I would really love to hear about your watch.
Let me turn it on really quick. I'll show you guys what it looks like. Um, let me go
It's
to the
nice.
app.
I seen it.
Yeah, this is the app here. So it tracked me last night. I had a spike in my heart rate. I was at 160 beats per minute last night. In the middle of the night, while I was passed out, it started going off the hook crazy with alarms. But I did end up being okay, but I think I might have had a seizure in my sleep. But it tracks it so that I can just go into the app and just press on the log that it created, and then it'll create a seizure event. But this is what it looks like on the watch. My sleeve's kind of covering, but the red one, the red button is for immediate help. The yellow button is for delayed response. So if you know that you're gonna have a seizure like a few seconds to a minute, then you just press the red button. It sends an immediate message out to all of your emergency contacts that you have listed. You can add like a whole bunch. And then the yellow one is for if you're feeling like an aura coming on. Then you can let people know. I think it gives you a choice to see like how long you want to wait until it sends a message out. But that's pretty cool. And then if I hit this button, start monitoring, it confirms start. I know you can't see it, but I'm just reading it. Motion detection. I have that off because if you kind of like you're like me, I use my hands a lot to talk. So that can kind of confuse it, but I have my heart max at 120 and then my heart minimum at 64. And I start it, and then it'll tell me if I go above that or below that. And so it's been really helpful so far.
Sounds like a literal lifesaver. I gave up on that when, like you said, you talk with your hands a lot. It went off by accident once, and I gave up on that feature.
Yeah, I don't use it anymore. But the app, or not the app, but the watch itself still has the fall detection on it, and I have it set to like a certain amount of motion. And then if I like stop moving after a big motion, then it'll go off. But I haven't had it accidentally go off at all. And I move around a lot with my kids. So the fall detection on the watch itself is different than the motion detection on the watch. So I just have that one turned off.
And is this an Apple Watch?
Yeah. Yeah, it's a Series 10. It's the newest one.
Okay, so they definitely have updated it. Sounds like that thing was about
Yeah.
definitely not double digits in the series that I had. So, all right, maybe
Can
it'll
I
be worth
ask
a try.
could I ask the price point on that for people listening?
So I got mine on a deal with our carrier. It was kind of like perfect timing because I had just switched over from another plan to my husband's plan. So I got them in conjunction, my iPhone 16 Pro Max, which was $1,000 off of the price tag. So the actual price of the phone is only going to be $300. And then I got the watch, which is $730. And I mean, it's different between carriers, but we use Verizon. So the watch was $500 off if you buy them together. And phone plans, they can be really expensive by themselves. Like my mom's used to paying like $250 a month, but even though I just got two brand new things, our bill is only 200 a month. So if you can handle it, it's a good deal to get them together because you can usually get discounts, but otherwise, the watch isn't that expensive in comparison to a phone. So if you have a phone that you still like and you're using it still, then just getting the watch shouldn't be too much added on because I'm only paying $5 a month for the watch itself.
Nice. So it's not one of those separate data plans and device charge with your carrier.
Yeah, so you can choose with Verizon to do shared cell service.
That's where we're at too.
Yeah. So we're paying $80 a month for my cell service, and the watch is using that along with it. So there's no added charges.
Okay.
Yeah,
Yeah,
I'm
it
not.
definitely seems like they have a better reputation. Like when you combine families and bring everybody together and stuff, they'll, at least match price. But it might only be for that first year, for that first contract, because then we end up like fighting with them every year. And yeah, my mother's the pro with that now.
All
Because
you
we
have to
combine.
do is be a Karen. I don't know why I was gifted this ability, but I am a great Karen. So I complained about the bill of me switching over, and they gave me a $20 a month discount for the next year. So I got a bunch of money off, plus the discounts for the new stuff. So yeah, you just gotta be a Karen. I love that so much.
Absolutely.
Yeah, I got something here. It said, "What rescue med makes you the least groggy?" I had to use my alprazolam at work towards the end of my shift. All I remember is clocking out, buying food, and getting picked up by my boyfriend. Got home and fell asleep for 16 hours. My coworker said I looked strung out on the alprazolam at the end. I believe it because it does stop the seizure, but holy shit, does it make me so out of it? I can only compare it to feeling drunk, but not in a giggly way, just cutscene recollection. Also, it was very low dose of it. In case anyone thinks it just a high dose, it's the lowest I can go that stops the seizure. I desperately need something that doesn't incapacitate me like that one. I overslept for work today as well, which I never did. Which rescue med is the least groggy? I never taken any because I was never able to give it to myself during or after a seizure. You guys have people there. How's that? How does that work? You guys groggy afterwards?
This person is taking it at work, so they're probably using it for daily maintenance, I guess. So what I do, maybe cut this. I actually like fresh mine up and just take a little bit. So I don't actually think I don't need that much every day, whatever they give me. I think it's 1 milligram or 5.5. Yeah, I just do as little as possible, and I think it's good to find where that is. And then you'll be less groggy.
I I used to take lorazepam, and I actually still have a prescription for it, but I don't take it. Only 2 milligrams. And that's not a lot. I don't remember it making me groggy, but like I said, I used to have a ton of energy. I used to be really, really wired, and I don't think 2 milligrams of lorazepam would slow me down. So no. So the answer to the question is no.
Angel?
I took the Clonopin dissolvable ones, and they didn't make me feel groggy at all. I could go on without it. Like everything would stop. But yeah.
Any other
And
rescue meds in
the
life?
initial question, were they talking about alprazolam?
Yeah.
Alprazolam? Oh, okay, so that's Xanax.
Oh.
That's what I'm seeing here. Alprazolam is Xanax, so that's what was confusing me. I didn't know if they were actually talking about like a seizure med or alprazolam is Xanax, but some
Yeah.
people still take that. Yeah.
She said she was
Yeah.
I
working
read
out of
about
it.
something called clobazam. It's supposed to be like less addictive, and I don't know about sleepy. Does anybody take that?
I do.
It's a benzo.
Yeah, they're all benzos,
Yeah.
Xanax, lorazepam. Yeah.
And then there's nasal, which is mitozole or something like that.
Midalazam.
Yeah.
Yeah, yeah. Xanax, I don't know. Do they? I've only had that once from a neurologist. Do they still give that to people with epilepsy? Is
I
that?
hope not.
Yeah. I mean, it is fast acting. And that's why the doctor gave it to me, but he forgot to tell me that that bar that has the 3 lines on it, you're supposed to break it up and not take the whole thing at once. And it just said take 1 tablet, so I took 1 tablet, which really was 4. And I was like, no, I'm not
Night,
taking.
night.
Yeah, but it was fast. It was fast. That's the problem. It was like a warp speed benzodiazepine, at least to me.
Okay. Well, that puts it in perspective because it sounds like they do still prescribe it to epileptics, but it's not for the epilepsy, it's for the anxiety, and it's definitely not viewed as a long-term seizure control.
Yeah.
Apparently, maybe it's just a first try fix it if somebody's so stressed and having multiple panic or anxiety attacks.
I don't know. I don't know. It's tough to get from what I understood. But I mean, I would love to have it on hand. Um, but not really because the effect. I'm just like it literally is a warp speed. Just yeah, it knocks me right out.
Sailor Mom, you there? I know she has some rescue meds. She talked about taking quite a few. I had nasalium. I never took it. Because like I said, you gotta have someone do it for you. Yeah. But I got something else here. Oh man.
Okay, I've
Oh,
done nasalium for myself.
you did nasalium to yourself?
Yeah, you
Hmm.
just hold it up your nose, all the way up your nose, like a nose spray, and push the plunger. It's simple.
Well, I mean, when you're down the street or
I'm not
downstairs,
doing it. Yeah, that's different.
yeah, I'm
Never
not
enough.
where I left where I was at when I started.
Yeah, that's
Yeah,
true.
when you
I forgot
go
about
down
that.
the
You're
block or
wandering.
something,
Yeah,
you don't have nasalium when I'm down the street.
that killed me.
Yeah, yeah, this is a big one. So you guys got to pay
I
attention.
will focus.
It's too much. Anyway, it says found out in my late 20s I had childhood epilepsy during sleep. I try to keep this as short as possible since I have trouble staying consistent when writing longer texts, especially in English. This mostly only scratches the surface of my problem, but here it goes. I've always had trouble in school, sports, and later in life in general at pretty much everything. That's assumed by society. You can handle by yourself with moderate ease, at least. Ever since I started school, I always came home empty handed, knowing nothing of what had been taught during classes. My parents made extreme effort to push me to learn and making me think it's the same for everyone else. I knew it wasn't. In sports, I was in my own world. I played soccer from age 5 and I actually don't remember this myself, but my dad had to shout out instructions from the sidelines on where to run and what to do in general. I see this similarity in multiplayer video games. I'm like a headless chicken. No matter how good my mechanics are, the best way I can describe it is it's like I'm completely distracted from things happening outside of my own thoughts, and that little pinpoint of my concentration, it's like tunnel vision. The point is, I've had many problems my whole life that completely escalated around the time I turned 18. Right when I should have started to take more responsibility of my own life. I had fallen behind in school, decided to drop out, and got really depressed. Seemed like I wasn't suited for normal life. I couldn't tell what's wrong and definitely couldn't word it out because everything was a mess, and my whole life I had been told try more. Fast forward 14 years later, I'm currently 32 and feels like nothing's gotten better. It feels like every single time I seek for help, I get treated for consequences and not the root of the problem, whatever it is. I have been treated for depression, ADHD, panic disorder, and everything in between. I've had maximum doses of every legal ADHD medicine in my country, but it's like taking vitamin pills. I feel nothing. I've always been the odd one out and had my own way of socializing that came up when monitoring other people. At core, I have low self esteem and I can't deal with failure too well. My memory doesn't work. I have no memories whatsoever. I can't even tell what I did yesterday or the day before. I can't remember conversations, not even the ones that are interesting to me. Heck, I can't even most of the time remember I've had a conversation at all. Everything's a blur and it feels like I'm absent in my own life and trapped to the life of what's happening right now. And even then, not so much. It's hard knowing all these memories I should have. I can never visit again. I don't use any drugs or alcohol. I eat clean, take supplements, go to the gym 5 times a week, and in general, take care of myself. And I don't feel like I'm depressed, just desperate to find these obstacles in front of me time to time. Now, for epilepsy part, I have no memories of this time, so it's all from the relative's mouth. I never knew I had epilepsy diagnosis until a few years back when my dad started talking about me losing my ability to speak when I was 2 years old. My mother later told me that I had learned to speak basic sentences when I was about 11 months old, but at 2 years old, I suddenly, in a flash, completely lost my ability to speak. EEG showed that I had epileptic activity during my sleep and ate some unknown medicine until 7 years old when I started school. That sounded weird to me since you would think having the nightly seizures untreated would affect the brain, especially when the brain is developing. But what do I know? It was, after all, a neurologist who decided against continuing the medication. This leads me to thinking, could this epilepsy be a completely mystery to me be the root of something of my lifelong problems, and why was nobody picking up my severe learning deficit and maybe connected the dots to epilepsy that was just treated literally a year ago before that was treated literally a year before I started school. Problem is, not even the mental health experts could have known about the epilepsy when treating me in my adulthood because of the files being pre-internet age and not available readily. So basically, I've had epilepsy, but I've been living without knowing I've had one. Sorry if this came off as a mess. Um, Advice, you guys? That was a lot.
Yeah, that was amazing that you read all of that. Like, hats off. I don't know how you did that. I hope you are eating. I put a summary of it from ChatGPT into the chat if you guys are like me, had trouble following the actual post. But what I got from this was he had childhood epilepsy. Probably he didn't know much about it. He was very young. He was medicated until 7 and then never told like throughout his life what happened. And they took him off of meds when he was 7. So all this time, what I got was he's probably having seizures and doesn't know, because I think people with childhood epilepsies continue to have them. They're just not checked for them because it's an idea that they stop. So what I'm interested in is like Annie and anybody who and anybody who maybe somebody can help me out here. Anybody who had their medical agency taken away, yeah, because I do believe that my ADHD is really epilepsy.
Yeah. Or PTSD. Just throwing that in there.
Oh, they do diagnose it that young? He said he stopped
He,
talking at 2, right?
Yeah, stop
He
talking
was
at 2 years old.
He was diagnosed at 2 and then medicated until 7 and then stopped being medicated. He wasn't really aware because he and
Yeah,
also his parents didn't tell him much about it.
So that's not a good place to start for a practitioner when you're already an adult, not letting them know of pre-existing. The part that stood out to me was that he had basic sentences at 11 months. That was impressive. And then stopped, seemingly regressing. Oh, that once doctors put that label on a child's chart, I can't stand that.
Yes, thank you for saying that. Like, I think a lot of kids are not having developmental disorders. They just need treatment for things like epilepsy or neurological or PTSD.
Or not everybody talks at 2 fucking years old. You get the vibe
Right.
they're saying that about my boy right now? Yeah. They're thinking he should have about 1,000 words, give or take. He gets it. He knows it. But, he could say Audi and BMW and fucking Rolls Royce for some reason, but, he doesn't put it
Millionaires
all together,
Club.
that's all. Oh, he
He's
wanna
making
be.
$1
He
million.
love YouTube.
Like, what is the standard of what kids are supposed to do? Like, you're caring for your kid. He's doing well. He's being loved. What the fuck is this standard? Like, it's such fucking bullshit. And it's all based on psychology studies from the 50s that were just all wrong and based on like poverty versus wealth.
Good old American dream.
Okay, so this I suggested to talk about. Let's try to remember.
Jeff is after you.
Oh, go ahead, Jeff. Sorry, I can't see him.
Those studies weren't wrong. They were based on how life was in the 50s, which has changed quite a bit from now. So, with what doctors, scientists, researchers knew in the 50s is quite less than what they know today. I feel I have to defend old people all the time. And you said something else, but I forget. So go on. I'm sorry.
Yeah, I don't think it's fair to judge the knowledge base of earlier treatments based on our current expertise. I mean, yeah, like Jeff said, it's completely unfair, and these standards, specifically the psychological standards for all of these diagnoses, are updated on a very regular basis. The DSM was just updated back in, I think, 2014 from the DSM-4 to the DSM-5, and I think it was further revised again since then. And the conditions of the past are not, non-existent currently. A lot of these more, backwards, barbaric type of things that, or what we would consider backwards, barbaric right now. I mean, we know now what we do because of what was being done then, and finding out that that doesn't work, and working more, and patients speaking up. You know, uh, we can't expect the next revision of the DSM to be any better if we don't, explain and
Does
speak
the
out.
DSM you're referring to only apply to mental disorders, right? It's
Yeah,
psychiatric,
it's
not the physical ones?
psychological. Yeah, so I
Psych
mean, the
okay, okay, that's what I
diagnoses
wanted to make sure.
of like childhood conditions and stuff like um, these change as we learn more. And, you know, I think having these sort of discussions are good. Um, and I think that we need to take the sort of knowledge that we're synthesizing together here to all of our various practitioners, and educate them, let them know what's up here, and help to build moving forward, because come what, 50 years from now, 2080, we're going to be judged pretty harshly, possibly. And I don't know. It's
Would you ever get behind just saying,
it's
a blanket statement like not supporting the DSM? I saw that
I'm
genius
I'm
statement in the chat. Not supporting the DSM, approaching all psychological care for juveniles and adults as an individualized approach rather than any kind of blanket diagnosis based on, 3 or 4 factors or whatever kind of algorithm they use
DSM
in the DSM.
is the manual for what these conditions are. It's not scripture or a mandate for how they be applied and treated. That really still comes down to the individual practitioners, the doctors. They're the ones who take this, you know, set of symptoms and say, okay, this person fits it or doesn't, but it's, I don't know, it's not always easy to define, the border between one thing and another thing. Um,
It's just a
and
bitch when the
that
insurance company takes
includes
advantage of that.
I'm sorry?
I was just saying it's pain in the ass when the insurance company takes advantage of that by saying, we're not going to cover this because according to the DSM, this isn't accurate, or they can go the flip side and say according to the DSM this probably is psychological and not physical.
Can I just jump in and say I support everything that Jeff and Mark said, and Annie too, even though she is expressing that the DSM has like not been good for a lot of people. And also to Jeff, I completely agree with you. I was a psychology major, and I only say that in response to Kate talking about her family and how her son is being judged. Um, but I don't mean to be condescending towards people in the past. And what I'm saying is actually based on in the 2010s, just the revisions to some of those studies and updating how they were performed. And a lot of them, I can send you guys more information. I don't want to keep going on. A lot of them were based on boys and poor people, and people in the middle class were judged on the same level, and that has led to a lot of updating. And the point of psychology is to be constantly updating itself. And I agree, Annie, like a lot of the studies now are being reevaluated, but it's such a mess, like with insurance. But you know, psychology is very friendly to women, so I think it's a ultimately good. But once fucking capitalism gets involved, man, good luck.
But I think again, the capitalism that comes down to the individual. So
Yeah. My therapist uses the DSM for coding. That's all.
Understood. So the next one, you see here, it looks like there's still a lot of rants and just trouble about accepting diagnosis. People are having hard time, like a lot of these new patients, making adjustments of not going to the gym or not doing the same physical activities as before. Has anybody here kind of picked up something else to put their energy into that feels like there is still exercise and just not as dangerous?
I
Other
recommend
than
I can't
this,
see anybody's hands. I'm sorry. Look up Indian epilepsy yoga. That's all.
um, other than this,
I'm talking about physical exercise, not just mental stimulation here.
oh,
I
Yeah,
guess that
that
wouldn't that depend on how severe your epilepsy is. I don't know your condition or not. I know the condition. I don't know the types of seizures you have, but uh, I always loved the swimming, and I always and I at different points in my life, I had trouble accepting it, and right now I'm having a real difficult time with it, and finding exercise is a little difficult, and yeah, I'm trying to join like a tennis club or something. I really enjoy tennis. I'm a really good tennis player. So yeah, I mean there's plenty of you know sports clubs and stuff like that. Go out, meet people. It's yeah, that's a good suggestion. So but you do have to put in some effort, and it's not that hard necessarily. I mean, and
except that you are going to make changes, but you don't have to give up like your
right,
favorite part of, you know, those workouts don't have to go away. They just have to change.
yes.
Kevin, do you feel comfortable like still swimming, but just in a supervised setting?
Yes. Actually, I haven't gone swimming in a long time because um, just because I had a pool out there, but it broke. Um, long story. Um, so yeah, I'm really sad about that. But yeah, I love the water. But yes, to answer your question, I did swim for a long time, even when I had active seizures, because I knew my body rhythm. Like I never had seizures like after 6 o'clock or like when I was in cool water. I don't know. Like I just had a feeling. I knew when the really bad seizures were coming. I don't know. Does that answer your question?
Yeah, yeah, it's I kind of I haven't gone swimming since I got the diagnosis, but I mean living in Florida, it's hard to give up
Oh,
swimming, and my niece and nephew are gonna be coming and visiting and are gonna have like a 2 night sleepover, and the pool here at the house is kind of a big draw, and I don't know if I'm kind of trying to gauge whether I should participate and to what degree.
well, I imagine
Well,
if
how
there's a
old are they?
lifeguard.
Yeah. I was going to say if they're old enough to look out, or if there is a lifeguard or somebody there to
Oh no,
oversee.
they're like 5 and 7, but my family
Oh,
will be
okay.
here. My sister and my father will both be able-bodied people here. Um,
All right,
so
go for a cannonball.
Yeah.
yeah, nice. Yeah, that's reassuring. Thank you.
Cannonball for me, one time.
We're at the
So
senior citizen community now, and there's lots of these in Florida. So no lifeguards here, but they've I'm sure had to deal with some incidents at the pool, and they're usually not that deep, but you're not far from being discovered. Basically, that's my only reassurance about pools in Florida, especially if you're in one of those community pools.
got something here. It says how to sidestep Keppler rage. My son, he's 8, diagnosed in March, and has been on Keppler ever since. It's been effective in preventing further seizures, but he's getting progressively more irritable and depressed. Our neurologist is on vacation, and we have a follow-up scheduled upon his return. We're also on the waiting list to move this appointment sooner. But in the meantime, does anyone have any tips on how to gray rock or otherwise sidestep ridiculous conflicts with him that are causing him further stress? Arguments are popping up from many benign situations and are making no sense. Unfortunately, he's also expressing that our lives would probably be easier without him, which has us quite alarmed. And he's 8, so um, for my kids,
8 years old.
8 years is really young to be expressing that type of sentiment. That's that's a reason to switch meds, I think, just alone. Anger Anger is another thing, but suicidal thoughts or even any degree of depression at that age is red flags all over.
Now, I wonder, anybody who has juveniles with epilepsy, do they still see them every 3 months or so? That's something that always blew my mind. That starting a child on a medication, you wouldn't have a follow-up appointment like the next week, even if it's uh via
Telehealth?
yes, thank you. Even if it's one of those, um, you would want to stay on top of it, not just call me if you have a problem.
I think that it should be a goal to get some parents who have kids with epilepsy on here. I've had a few really good conversations with them and like their advocacy, and I would love to hear from them. So, goal for the upcoming Zooms.
Oh, I'm not gonna let up on that kid from Illinois, that Baker, Brandon, something. Yeah, I got all his name in here. I know his last name's Brown. We're gonna see. He was diagnosed at 15 and total advocate, and his parents were backing him. They had him on the news. Yeah, that's a celebrity. I'd rather him than the social influencer personally. you know, I'm not gonna downplay like success in fashion or beauty, but children are just always so much more impressive.
The word influencer is very triggering if you're over a certain age, I think, at least for me.
That could be
and
it.
any advice for this lady, you guys? You only get like 1 or 2.
Get off
Get
the
him off the
Keppra.
meds.
Yeah, get him off the Keppra. That is, I totally agree with Mark and Kate. Like, that is so awful. And this parent is just trying to navigate helping their child. And that is so hard. So I think they probably need to hear get off the Keppra. What do you
Not to
think,
mention get a
Sailor?
new doctor.
Get
Well,
off the Keppra and get a second opinion.
I guess for
Yeah.
now, if your child is on Capra and you have to deal with it right now, I just watch out, and just constantly watch them. If they are suicidal, they're saying these things, you got to just constantly supervise them and know that this is not them, this is the drug making them go crazy.
Right.
And my mom had excellent patience with me. She's a good person, and you know gave me more than I deserved. So uh yeah, when I was on Capra especially, just be very patient.
Yeah, now that I think about it, it does it's not as simple as changing doctors on Medicaid, especially for pediatricians. They give a big problem about seeing another pediatrician on Medicaid. They get that out of holding my breath on whether we're gonna get a bill from the physical being with the NP. So yeah, that can be issue. What's up, Benny?
Yeah, my battery is running low. Plus, I've got some lorazepam kicking in, so I'm gonna have to cut out for a while. I'll charge up and then I'll check in and see if you guys are still here. But
Come on, you
yeah,
see Jason? Just chill.
yeah.
Lay
Well,
back.
yeah, I gotta plug in and then and then I'll come back. All right. All right, you guys, I'll see you soon.
Bye, Annie.
Love you guys.
Nanny, we love you
Love
too.
you.
I'm not sure if I read this one already. It says lamotrigine insomnia. Okay. It says I take 100 milligrams in the AM and 100 milligrams in the PM. How the fuck is it that I'm so fucking sleepy and dumb all day, but as soon as I try to sleep, I'm completely wide awake and I just cannot fall asleep. I'm so frustrated. I just want to be asleep. I have work in the morning. Fuck my life. I've been taking this for over a year, but the past 3 months or so, past 3 weeks or so, I just cannot sleep at all. I feel like crying. What should I do? What should you do? Well, I take lamotrigine, and I've recently found out that I have insomnia, so I just kind of ride along with it. They try to give me some pills to go to sleep. I'm not gonna take any more pills to sleep. More side effects. I'll just stay awake. I don't have to work in the morning.
Is Angel in here? He's tried a lot of anti-epileptics, and like everybody said, like the sleep is gonna like it's such a trigger for seizures. So like I know Lamictal works for a lot of people, but maybe the timing and maybe adding something else. Personally for me, I know Pepper doesn't work for a lot of people, but I take it at night. It knocks me out. I don't know if it's helping, but it at least knocks me out.
What was that
But at least you're
you
not awake
said?
for it.
I'm afraid to check the nanny cam.
Anyhow, it says they just throw meds at me instead of the problem. I genuinely believe that I don't naturally have epilepsy. What I know is that my body is addicted to seizure medication. I swear my neurologist doesn't want to think about why I get orals now. I'm tired of him just saying my brain is complex. Okay, dude, yeah, I know, but why am I getting orals now? Why are my seizures different after 30 years of the same triggers? Now I don't know what the triggers are. Help me instead of helping me with the triggers. He just throws a new doctor or a new pill at me. I'm tired of the pills or the lack of explanation. He's the doctor. He took the oath to help, not just throw a pill at me. Advice from the people. That's kind of what I just said.
Maybe don't get overwhelmed. I mean,
That kind of
getting
goes
so
with what I just said,
frustrated.
though.
Yeah.
They told me the pills from insomnia. They just gave me some more pills just because, oh, you have problems with sleeping. Well, take this and still take the pills that are giving you insomnia. So yeah, that's kind of what that sounds like. Opinions help this person?
Oh, you're still having more seizures? How about 5
No.
medications? And 2 rescue meds? I feel you, man. I don't know. I'm sorry.
Yeah.
You're muted, Sailor Mom. You guys know better about being on multiple medications, but personally for me, after I went on anti-epileptics, I realized that it cleared the way to not have crazy seizures. And then I thought I was having more auras because I was able to recognize that I was having small seizures, whereas before I couldn't. I am so confused why people don't think they have epilepsy, but I wonder if it's not the meds just scrambling their brain.
Or wanting to trust a medical professional that's trying to avoid the real diagnosis. And that's kind of where I got backed into a corner for a little bit.
Everything, they're just afraid.
Really?
What was that, Mark?
Or out of their league?
Yeah,
Yeah,
I
and
think I have
sometimes
yet to see an epileptologist.
Or
Yeah.
does the person not want to accept it?
Yeah.
Is that
That's
what we're
kind of what I
saying
think.
here? Well, sheets. I think we've all gone through that, haven't we? I mean, long or short, no matter how long it lasted for each of us, right? And whether you've accepted it now or not, like, is that not a giant hurdle? It was for me. Was.
You'd be surprised by people. They're like you said, the brain is very surprising. It'll when you're in denial
Complicated.
about something, you'll blame everyone else.
Yeah. You know? I know. I mean, yeah, I'm gonna shut up now.
never shut up. We don't want you to shut up.
Don't bring it on.
Well, I was just gonna say that, I went back to work against my epileptologist's advice and wishes and in my medical file over and over again because I was like, I can do this. I'm strong. I love my job and I can do this. Like, I haul hundreds and hundreds of pounds of ice cream every day and I, run like a Energizer bunny back and forth and I decorate 30 cakes a day or whatever. So I was like, I'm not going to accept that I can't do that until it got to the point where, yeah, I mean, he kept telling me not to do it and I kept going back, but then I had to realize I couldn't do it. So maybe they just haven't got there yet. I don't know. I hope they're.
You're muted, Sailor Mom.
Yeah.
Oh, can I just jump in if Jason is here and has any input? Because I know like he said he stopped drinking too, which I feel like is kind of similar in terms of having to accept a diagnosis.
Go ahead.
And no, you're
Maybe
not
he's
talking
not
about
here.
Jason.
I
No, he's
don't think
passed
Oh, no.
out.
This is not here.
right now.
Okay, well, sleep well, Jason.
He is. So I got something here. It says, ever just say fuck it? I guess it's a rant. I don't know. Ever just say fuck it at all and do everything you aren't supposed to do? Keto, meds, alcohol, stress, lack of sleep, whatever. Sometimes I just want to enjoy a night knowing the consequences the next day. Anyone else? Or am I just being stupid? I like your
We can all answer this. We can all answer this.
You first.
Yeah, fuck it. Seriously, get that out. And whenever you need to, fuck it. It sucks. Like, fuck it. I'm chain smoking right now.
Anyone else?
I
How
know
can
you
we
guys want
top
to say
that?
fuck it. I want to
Okay.
hear your fuck it.
I don't
Yeah, I was
drink.
gonna say, are we just saying yes or no, or are we giving our each of us like our own personal fuckets?
Any thoughts?
Yeah.
Are we describing our fuckets? Is that what we're doing?
Right, yeah,
In
is
Any
that
great
what
fuckets are
detail,
we're
welcome.
please.
Any flavor. I mean, you were hauling ice cream. You know there's a lot of flavors.
Yeah, because it does say a lot of things, and then it says whatever. Keto meds, alcohol, stress, lack of sleep, or whatever. You ever done one of those and just say fuck it or whatever it says? So
Yeah, you guys ever rebel?
yeah. I rebel all the time. I'm 35. Anyhow.
I rebel every time I go pick up my own pills when they tell me don't. I say fuck it.
Yeah. I was just told go get the pills, so it's a different boat.
Yeah, I guess later in life you can still tell yourself that, achieve that same satisfaction, but without like actually putting yourself in danger.
I think
That
this
Like
is different too.
smaller
you gotta
scales.
be a little ornery.
Yeah, I'm trying to think
Yeah,
of
you
something
can
that.
trust that. Trust that coming from Jeff. It's true.
Oh yeah, the
You gotta
wise
have
man, the
fun.
wisest man I know.
Life is about fun. Otherwise, it sucks. So have fun.
I
Yeah,
also
I'm
think
trying
it
to think
depends
of.
on what kind of seizures you have, because I had a bunch of focals earlier. I probably got goofy with you guys. So that you can fuck it and I mean don't go into status, but like see the consequences every once in a while if you need to. But if you're having like I think Kate has tonic clonics, maybe don't fuck it.
Right. Yeah. Okay.
By the time I'm conscious enough to be able to make that judgment, I'm already either inpatient or with the nasal am by somebody else. So when it comes to that, it's not up to me. It's the more conscious decisions that I make on a daily basis that I have to keep in mind. Yeah, I kind of want to say fuck it right now, but the dog
It was
isn't
a
trained good
robot
enough,
money.
so I shouldn't walk even further because it's after 7. It's already 85. I didn't get up early enough today, so I'm only going around the block once, even though I really want to walk further with the dog. It's just not a good idea.
I thought it was asked about older people. Being an older person, I thought that's what it relates. Sorry.
No, it's good to
Yeah,
have
but you
like a
you got to
range
know how
of
we feel
ages.
older already. And they're telling
I
us the
mean, we
life
just
expectancy. Yeah.
None of us
waited
are
around
old
and it
in
happened.
here.
Somebody said something. Angel,
I
did you
said,
stop talking?
I said none of us are old in here.
Everybody's 14. We look our age.
Did I
We need
mention
Lufa
Everybody's
in here who's
18.
like, to balance this out because I think we got like 135-year-olds. We have one Kate who's 10 years old, and we have Jeff. I like having a range of ages in here because it so depends on demographics too. And if
I'm
you're a parent or
24.
Yeah, see, so
yay,
people are
yes. What do you think? Do you fuck it?
I mean, I got 2 kids. I can't really say F it all the time, but but sometimes I mean like with the small things, like I'm supposed to be on keto, but sometimes something looks really yummy and I just want to eat it anyways. So I go for it. Because I can't eat really good all the time. And I'm a mom, so time is not on my side.
Yeah, that's my fuck it. Like I can't go all the way. I mean, like drinking or anything, but you know, like smoke a couple extra J's, or I eat something that I shouldn't, or I have a soda or a cup of coffee when maybe my family doesn't think I ought to, but you know what I mean? Small things, small
It's
fuckets.
totally different when you have, people who are relying on you.
Yeah, exactly. You can't go overboard, right?
That's what
Like,
bothers me a little. Is my kind of fuck it is the time thing. Is am I gonna have time to establish a life? I don't want to. I mean, I'm almost. I mentioned my age before. I'm not gonna mention it again. Am I
tell
gonna
us
have
your
time to
age.
get out of here and establish a separate life aside from this life? A new life. That's what I want. And
And do it. You have to do it.
all right,
Look
see ya.
at this.
Yeah.
Anywhere? Friday. Not doing anything.
That's going to be a
Rode
short.
dolphins. I rode dolphins.
All right. Yeah, I mean,
Poor dolphins. Did you just say you rode dolphins?
Yep. He posted a picture. He was like holding their
Along
fins and
with
they were
them.
like going, and Angel was smiling really big.
Yeah,
What?
Be careful
it's
with those.
awesome.
You know what they do to people. Have you heard?
Yeah, but they're smart too.
Yeah, that's the problem. And they're
They were
like, filthy.
they're like chasing people out of the water at the beach, like the second or third, like 2 or 3
Floridians can
times
tell you some
ago they
stuff
were
about
there.
dolphins.
Yeah, I bet.
Water was so clear. I like that picture, Angel.
It was Isla de las Mujeres in Cancun. Yeah. So you could see we were riding on the boat and you could still see clear water riding on the boat.
Yeah, so I got one here. It says, "Is nicotine a common trigger for you guys?" Basically, just the title. Whenever I hit a vape or smoke a cigarette enough to get a buzz, I end up getting an aura, and shortly after a seizure. Just curious on anyone else's experience with this. I also think it's a great excuse to quit nicotine, as it's such a pointless drug to me. I'm glad the person took some accountability and they were willing to quit. Yeah. Thoughts, opinions, advice, you guys?
Well, they were willing to connect the two, right? That if they have the nicotine, they're going to have a seizure. That's very adult, you know.
Yeah, that's adult of that person. So yeah, I had to stop. And they
Sounds
said
like
it's
they've
a
got their
pointless
facts
drug.
straight, and now they have to act on it. Oh, now we see the pictures.
There you go, Kate.
That's crazy. That shit looks edited. That doesn't even look real. That's insane.
This is like Mission Impossible or some fucking movie.
Yeah,
Triple X.
crazy.
I got something here. It says, "What are some things that personally keep seizures away that don't involve meds?" Mine's is a fun attitude, laughing whenever I can, just keeping the dopamine naturally as high as I can, even acting a bit childish, which is all hard with depression and BPD. But for me, it's much of a fun, happy mood, and having the best outlook on hard times seem to make me have a lot less non-catamenial focal seizures and keeping all my senses busy, like VR chat. Yeah, I try to like stay in a place where I'm not angry. Well, I don't get angry often. I think that's the pills, just nonchalant about everything. I've heard. Um, let's see. Yeah, you guys come back to me.
Yeah. I mean, I tried to play either video games with my husband and kids at night or play board games because or watch a funny movie because then, you're always got the dopamine high before you go to sleep or you try to go to sleep because insomnia. But yeah, I can understand that. That makes sense to me. I can see how that would work. Keep you in the moment. Anybody
But
else?
this ties back into the fuck it thing because even if I know getting all this shit done and the multitasking and the packing and getting everything ready is gonna probably stress me out, put me at a little bit of a higher risk. Shit's got to get done. And if I ask my mother to do one more fucking thing, then, I should just like, I'm not gonna finish that sentence. But yeah, this ties back into the fuck it. I do whatever I have to do, and if it causes seizures, it does. But you know, now we get times
I
like this, and this totally brings it all back full circle.
I'd have to agree with Kate on that because, like, especially as a mother, you kind of gotta say screw it, especially if you don't have that much support on some days. And you just gotta get through it. All the things that you have to do. There's a lot that you have to do. And if I have a seizure, I have a seizure. But if I don't, then at least I got the stuff done.
Especially when it's just phone calls. It's just, simple things, but doing 10 things at once gets a little, yeah.
At a certain point, you
But
stop being able to speak properly.
yeah, fuck it. I'm not in physical danger, but okay, the stylist might think I'm stupid. I
hmm
can't tell you like anywhere near how many foils she's gonna need, but book the fucking appointment. Like, let's just get this done so I can move on down the list.
Get it over with.
And one that says motorbiking. What are y'all takes on motorbiking with epilepsy? When I'm a year episode free, I want to take lessons. I really want to do it, but I don't know. I don't trust myself. I wouldn't do it.
No, I don't. I don't either. It goes along with driving. No.
Yeah, mine are so sporadic that I don't trust myself.
I would have to say that I still hold out hope for number one, horseback riding, and number two, dirt biking, because I love those. But as far as driving on the road, no, I would never do that.
Okay, yeah, dirt biking does sound fun.
Yeah, like if it was out in the middle of a desert, nobody else around me, just me and the dirt bike, and if I have a seizure, then I'm the only person in danger. I think that would be one of the best ways to experience motorsport as an epileptic. Like can't go out to a track. I love driving. I miss it, you know. But yeah, like dirt biking sounds awesome.
Yeah, like you said, somewhere where only I would get hurt. That would be
So
great.
would he be dirt biking on a closed course?
He actually said motorbiking. He didn't say dirt biking, but I'm not sure if there's a
Sorry.
difference. So
Well, I mean, I don't know if it matters, but I mean,
It's a little
motorbiking,
safer.
it's a little, it's not much better, but
Yeah.
not good for him still, or this person.
Yeah.
That would
they
be a
said that.
good bucket, I guess, for me.
That's what I
Like,
was gonna say. That's my
His
that's my new fuck it.
his body, right? He can.
Right, that's a big one right there, like you said. And he's a year without an episode, so I mean,
Oh,
still, I'd take other precautions, but yeah, I'd do that, I guess. Not on the streets.
Like
But that thing
three
Sia
and
said about the horses, I know I've seen kids with disabilities at the farm, and if they're on the right horse with a helmet, and somebody's around at least supervising or monitoring, that's I've seen trail rides. They can definitely do horse. Epileptics can definitely ride horses. We're not talking jumps every day, but
If you
you
find
know
the right person or you have a horse, then for sure. But so far,
Will
I've
exactly.
they
been turned
adopt it?
down.
I
Oh yeah,
wonder
some
if
English
horses
places.
would
Come
be able
on.
to pick up on it like dogs can, if they could be trained to like tell when somebody's having a problem and stop and signal to someone around them or to the rider themselves, you know.
I'd love to get a horse and train my own horse because I agree with you. Horses are extremely smart. They're even smarter than dogs in some cases. So yeah, I would say that that would definitely be a possibility to train them how to, respond to you if you're about to have something go wrong.
This one says, "How to rest without guilt." I hate taking off work because I love my job and my coworkers, but sometimes I'm absolutely useless and need to rest, but I always feel so bad. My coworkers appear to be very understanding. TBF. I'm the undergrad student and in research lab while everyone else is in postdoc. And they also not American and are always telling me to make sure I rest. But I feel like I'm being annoying by needing to rest so much. I'm also the type of person who works multiple jobs on top of 18 college credits per semester. But since having seizures, I've been unable to do that as well. I think the post seizure, my brain is like slime mold, and that makes sense. It's not like thinking I'm sleepy, but I get antsy and need to at least puts around, but then I'm exhausted still. So how do you get over this? Will I ever get over this feeling?
I mean, the mush thing, that sounds post-ictal. So getting over the feeling is, just
You're
gotta
not gonna,
Just
let it
time.
finish.
yeah. And you're not gonna not have that until you don't have seizures. But the guilt thing, I don't know how to tell you how to rest without guilt because I have the same problem every single day. I don't know if you guys do, but
Yeah, I'm still trying to figure that part out.
right, you know, even if they tell you to, sometimes it comes back to bite you because then they're unhappy and you feel guilty. I don't know. I'll be quiet now.
Yeah, it's like the people who say, it's okay, don't worry, I'm not bothered. But then it's hard to not because there's always something I feel like you are bothered by, but you're not saying it. So there's that.
A post I'd like to ask everybody about if
Oh
we're
man, I've
ready.
been waiting for that.
Okay. This one is from a year ago, but I'm gonna read it. Do all of your friends know you are epileptic?
I have no
Yes.
friends.
Do
I'm
all
sorry,
of
Oh,
you
little
guys
buddy.
know I'm epileptic?
Huh?
Yes, Angel, we're here for you.
Yeah. Yeah, all
Um,
my friends know.
I guess. I mean, sort of. If I've talked to them in the last 4 years, maybe.
Right?
Yeah, well, all my friends,
Only reason I can say yes is because my friends from high school, I had it in high school, so they were the ones protecting me and thinking we should not tell my mom because I had a seizure in public. So yeah, well, that's the crowd I was around. Um,
Well, the unknown can be scary, and you might think you can get in trouble for it.
Okay, I also have another question. Has anybody ever known anybody who said they had epilepsy and did not, or you suspected it, or were faking a seizure?
No, I'm playing. No, no, not personally.
Okay, well, I had an experience where somebody told me somebody else had seizures. Hey, and then I had a very, very bad seizure. And I ruined somebody's party, and this person was there, and we ended up at the hospital. And everybody came to like comfort me, and like I barely remember any of this, but what I do remember is the person who supposedly had seizures, and maybe they do, hanging back and looking very nervous. And they haven't talked to me since, and it just is in my mind like, did I inadvertently call this person out by ruining the party? What do you guys think?
Bound
Yeah,
to
I've
be
gone to
found out one
parties.
way or another.
I thought I was the only one ruining parties these days. Yeah, that sucks, but comes with it.
Yeah, I don't know. Maybe. Maybe. It sounds like they were pretty uncomfortable seeing it in person. I don't know. Or maybe they're just uncomfortable because they've never seen themselves. You know? That's possible. I've seen myself, so I'm not uncomfortable with that. But yeah, maybe. Oh,
I've seen myself on video, so
yeah.
it was interesting though. So that was the difference between me. But you got anything else?
Yeah, this isn't from epilepsy, but I am interested for people who had clinical correlate, meaning it showed up on a labs. Do you know where your seizures are happening?
Um,
I,
mine's
Like
I'm
inside
right.
my
sorry.
head? Oh yeah, for sure.
Yeah,
Yeah.
like what lobe or general
Oh,
area?
so I have a thing it's a rod shaped indentation behind my ear that goes straight in, and my skull was banged in there, and it made my brain go in, and it never grew there. And it took about 5 MRI specialists reviewing my MRIs to find it. They knew where it was coming from. Every EEG would show where it was coming from, but they couldn't see why, except for this one very special specialist that finally found it. And as soon as they found it, they were like, okay, we know exactly what this is. This is not like, you were born with this. Somebody did this to you before you were 6 weeks old. And you probably had seizures your whole life, off and on, and for whatever reason now it's switched 100% on, and it's yeah.
So is that
Anybody else?
occipital lobe? In the back? It looks like on the back of your head it's occipital or
Yeah,
parietal.
it's like
One
right
of those sounds
there.
familiar.
Yeah, right. I think it's in the back. Yeah, it's in the back one, whatever that one is, the occipital, I guess.
Yeah.
And it
Yeah, it looks like that's
generally,
the one that's like closer to the stem.
yeah, and it starts right there. It's like it's actually rod shaped. It's really weird. Once they showed it to me, I was like, oh, for fridge's sake, I'm pretty sure I know where that came from. But anyway, and I can actually sometimes feel it coming out across there and going over to here like a, I
Oh
don't know,
wow.
like an electrical or like a thunderbolt kind of when you
So
see
maybe
a.
that's long enough to like cross up into the parietal, and since that's connected, yeah,
Oh, it goes
that's
all over. And once it comes across to here, then it's everywhere. It goes everywhere, and I'm probably gonna have a TC. Yeah.
Yeah,
Yeah, I
when I get that
was.
shocking thing, it's over. That's when I know it's too late. It's like, oh, it's over. And it's like it starts from this side, and it just feels like it just shocks and everything goes that way. And then I don't remember anything else.
so maybe that tells
My
you where it's starting. If you always like turn that way, then it's probably starting on the opposite side. That's
No,
what I was looking into.
I got encephalomalacia on the right side of my head, which is basically soft brain tissue from getting hit by a car. So it starts where the problem is at, and it just takes off very fast.
When I was diagnosed, the neurologist told me it would start on my left side and then just go bilateral. Yeah, I'm focal to bilateral. Yeah, front, I think, because I get the absences and stuff.
Did
Anyone
anyone have
else?
an EEG that, like, maybe I'm asking this over and over, that showed something in a lobe?
Mine showed up in right, well, she said right frontotemporal, um, and then it spread secondary generalized. Um, so my focal was like a tingling, rushing, dropping, weird. I mean, the English language doesn't have the right words for the sensations, but on my left side, and then I went unconscious. Or that was the one that I have seen a video of, which uh, terrifyingly enough, it happened. My mom was standing in the doorway, and we were having a conversation, and then I started to get, the focal, and I wasn't able to talk very clearly, but I was able to lift my arm on the left side, and um, so she ran to get her phone to come and sit next to me, and by the time she got back, I was just staring out into space, so it had already spread, I guess. But my symptoms don't always occur on the one side. I sometimes get the sensations on the right side. So she said that it might just be something deeper in, and that they go to either side, and just the ones that they happened to catch on that EEG while I was hooked up were picked up first on the right frontotemporal side. But she did get that specific lobe first.
Is It's so crazy because it seems like a lot of people have left-sided issues. Mark, I think you just said you had right-sided issues. Is that right?
Yes, right-sided, but left-sided physical sensations. So, I don't know what you had meant when you said most people have left-sided issues. So,
Yeah, I've noticed, I think that's what people are saying. They have um labs that show issues on their left side, so they have right-sided symptoms. So it's interesting you have the opposite, because I haven't, like, just reading through the Reddit thing, seen as many of that. Um, it's odd. Yeah, I just actually got a book about blood flow and how it affects the brain. So maybe I'll share that. It's written very simply, so it's easy to read.
Oh, is there anything that you like about having epilepsy? As the question says, anything you like. For me personally, it's I immediately get an appointment with a neurologist and don't have to wait months to a year for an appointment. Same with therapists and any other doctor. I'm in Germany, so it might be different wherever you're at.
You know, I kind of I like not driving. Yeah, people say they miss driving, but you know, the public transit's pretty good in Philadelphia for the next year, and it's going to shut down for the most part. But yeah, it's a good city to get around in, and uh, I don't gotta pay for car insurance. Don't gotta do all that mess. Don't gotta be one of those crazy people. So yeah.
Yeah, I don't miss the traffic. Can I like amend my previous statement about missing the driving and wanting to dirt bike? Like I miss operating the motor vehicle, like manual transmission, clutch, but everyone around me is it was a problem even before I had seizures. So now that just I wouldn't, yeah, in the middle of an open track or something, that's kind of what I miss. So I'm realizing now that yeah, it's I agree with Kevin. It's kind of nice to not have to, you know, I'm not the person who has to get angry at the guy cutting whatever vehicle I'm in off. You know, I
Yeah.
get to laugh at it while they get angry.
Mhm. Oh yeah.
I like being
I'm
able to sit in the passenger seat. I go right to the passenger seat. I like that part. Yeah.
Mhm.
um I'm interested in what like got led up to your immediate diagnosis. Like what's the thing that really told your doctors you needed it?
My second seizure in high school, and then they had already knew I had encephalomalacia on the right side of my head since I was a kid, but it didn't cause seizures, like I said, until I was in my mid to late teens. So yeah. Hey Rick, hey Toaster. Welcome back.
Hi,
Oh, I
Toaster.
love the last
Hi
story.
guys. We're all like fading a little bit. I think we need some energy pickup in here.
Well,
Oh,
just so
folks
you
will
know,
give
okay,
us
okay.
energy.
Take this. Get this. Apologies in advance, Pookie, for the editing. Bro, it goes in the closet in his, spot of don't bother me, I'm doing my business. So they call me over there and I'm going through the routine, lay him down, do the thing. It was gas. And he was laughing like a maniac for this whole time. Clean diaper, didn't need me at all, went through the whole routine, said the same lines of come back later, don't bother me now, and it was gas the whole time, and he was planning it and holding it and let it rip and laugh like, oh my god, he's a boy. Oh my god. He is a
Mira,
boy.
pero
Yeah, there's a subreddit called when guys turn to dudes. There he goes, doing some dude stuff. Start him early. Anyhow. Kate, anything that you like about having epilepsy?
Uh I mean, it's just part of who I am now, so if I say everything about it is horrible, then I'm just kind of talking shit on myself. But on that point, I definitely want to rave on Toaster stories. Those brain chronicles, brainstorm. Yeah,
Yeah.
those stories are amazing. A lot of fun.
Hey, I like
Rick?
nothing happens to Tom.
I've been having way too much fun with those.
They're fun to read. You might
I
have a
have
book one day.
in my head. I have. Um, I know it has nothing to do with the little arc that I'm doing, but I have um I have a person who is epileptic and she goes to a pet adoption event and cat, of course, cat, because we don't have a cat yet. We need a cat. Um, basically is like, I'm gonna be yours now. You're about to have a seizure. And of course, they take him home. So random
Rick,
things.
is
So
there Toaster and Rick? Is there anything you guys like about having epilepsy?
Well, it gets me out of doing a lot of stuff at work. um, so I guess let me rephrase it. So I'm very busy at work and I don't shirk any responsibilities, but it is nice to split the shift. So that way I could work like 4 hours. Hey, I need a nap. Take a nap for 2 hours, work for four, and then later on in the evening, after I take my meds and, oh, look, now you're awake, then I could do some work. So I kind of like that flexibility. Um, Also, my job, they really don't want me working remote, and they'll allow 1 day a week for people, but they really don't like it when you do it. I got carte blanche. I can just wake up in the morning, I'm not feeling it, tell my manager, I think I need to work remote. Yeah, you work remote. We'd rather you fall there than at work. So that's what I like about epilepsy. And especially since I can't drive right now, the more I work remote, then the less my wife has to get stressed and drive because she's having eye surgery soon. So hopefully after she recovers from that, she'll be able to see better, but she doesn't really like driving. So that's really cool that I'm able to do that more. So that's a benefit. There's that.
I like that there's a spot on the train that says only people disabled. The train is full sometimes, and then there's that one spot. Disabled, old people, or pregnant people. Yeah. Yeah, a good part about having epilepsy is the Zoom. So I got something here.
Oh,
It says,
Pookie, can I interrupt you very
go
quickly?
ahead.
You can take this out, but I'm trying to get a hold of you for if you have any novels again, so you don't have to like suffer through them. Just send them to me and I'll throw them into ChatGPT.
Got plenty. Anyhow, I got one here. It says, if I failed the following drugs, does it even make sense to try another sodium channel blocker? Keppra is able to stop my tonic-clonics, but I'm still getting weekly complex partial seizures. I failed Lamictal, Trileptal, and Vimpat, and Depakote. Does it make sense to try something like Topamax or Zonisamide at this point? My neuro said I probably wouldn't handle Topamax well as far as the side effects go, and said would rather avoid it, and said Zonisamide is an option, but unsure if it's safe as I've had a bad reaction to a sulfa antibiotic in the past, although I'm uncertain if the reaction I had was related to sulfa or the actual procedure I was undergoing at the time when the sulfa containing antibiotic was given to me. The neuro said we should probably go with clobazam next. How are the side effects on clobazam compared to the ones I already tried? Have any of you tried zonisamide, clobazam, Fycompa, and can report on how these three are in comparison with each other in terms of side effects? And these are the only three options I have left, basically, to choose from. I haven't taken any of those. This person just asked about zonisamide, clobazam, Fycompa. I haven't taken anything besides the Lamictal, and he said that failed. He or she or someone. They.
I've taken all of them and they didn't work. So That's the that I'm not the right one to go from though. It depends on which ones haven't worked in the past. Do they have a history of like more of the AEDs failing for worse reasons, or the benzos going the wrong way, or you kind of need more medical history to make like a good decision on that one. I don't remember any. I know Fycompa was the quickest one, so I don't know if maybe I actually felt something on that one, but I think the other two just didn't work.
It said how are the side effects with clobazam compared to the other ones? You don't remember? Okay.
Oh, we got some hands going. We have Angel and we had Rick and maybe Kevin.
Go ahead, jump in, Angel. Unmuted. Unmute, buddy.
I was gonna say I haven't tried zonisamide, but I've been looking it up for Anne and stuff. And I definitely recommend if you have any type of kidney problems, do not take it because it can cause kidney stones.
So they said something about being on an antibiotic too, and that alone, the sulfamethoxazole, I don't know how to say it, but
Right.
that one can definitely lower your seizure threshold.
So there's a couple things with that. So first, I was answering the first part of the question. Um, so um, the sulfa blah, 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 type of antibiotics, which I believe some of the medications that the sodium blockers use. My son's allergic to that, so he has to be extremely careful what type of antibiotics he's given. So obviously, this person was talking to the doctor. The doctor said, no more monkeys jumping on the bed. No, seriously. Said, you're not going to do well. I would trust a doctor because based on those ingredients, if it's that similar to the antibiotics, I would give it a hard no. Doesn't mean that there's not other options or there's the type of sodium blockers that have different ingredients in it. That's going to have to be a, neurologist, neurosurgeon, other type of doctor and research type of thing. So I would definitely tell the person be very, very careful. It's not a hard no, but be very careful and make sure the research is done by all parties involved because once you have a reaction, all further reactions are going to be so much more severe. Kind of like if you have a bee sting allergy, the first sting is bad, the next one most likely going to be deadly. So it's the same thing. So definitely that's my major red flag or two that went up when the first few sentences there. So that's what I would say. It's yes, there's other meds you can try. Yes, you can try some of those meds you were talking about, but definitely, I know I'm repeating myself. So stop, just stop. I said what I said.
And the summary helped it. Thank you.
We're
Sure
all
thing.
on that page today. We're just like, oh, what? Wait, how much did I just say?
Okay. I got another novel here that I'm interested in reading it.
Let
It
me go
says
get
ER.
popcorn.
Huh?
I said, let me go get popcorn.
Right. Bring me some. Anyhow, it says ER doctor told me I'm not epileptic. I was diagnosed with epilepsy last year after years of uncontrolled seizures. I had a lapse in insurance and was waiting for my new insurance card and was unable to get my medication for a month. I've had a lot going on recently, very high stress at the moment. Last night, whole getting ready for work, I was getting out of the shower and started seizing, which resulted in me hitting my head on the bathtub and potentially the toilet before I hit the floor. My husband found me in the bathroom convulsing, and I had vomited on myself. So he got me dressed when I stopped seizing and took me to the hospital because we weren't sure how bad I had hit my head. We get to the hospital and go back in the room. This is the fastest I've ever been taken back into a room. The ER doctor tells me I don't have epilepsy because my EEGs came back last year. They came back last year, came back clean. He asked me how I can have epilepsy with clean EEGs. This made me start sobbing. I was already in a fragile state. My head was killing me, and now I was being interrogated about my own epilepsy. I told him I had an appointment with my neuro the next day. Thank God. And then he shut up. He did the blood work, CT, and then had the nerve to test my blood alcohol and ask my husband while I was in a CT if he thought that I was seizing due to me drinking alcohol. When I saw the BAC test, I was livid. This man made me feel so dumb, upping discharge. He told me I have closed brain injury, which is a mild TBI without penetrative to the skull, which whatever, but I'm just so upset with how I was treated in the ER. Ladies and gentlemen, any advice for this person? This was yesterday, so it's fairly new.
Yes. I don't know if they had someone with them, but if you can find a white man and you're not one, just bring more of them wherever you go. Have a lot of people with you. I know that's hard because you had to go to the ER. But witnesses are really good to help for that. Like when I ruined the party, I had the person whose party it was, like, and their friends in the room, and they told me later that they knew if they left that they would just fuck with you. So I highly recommend that. Anybody else?
Yeah, friends are the best. You need a support system. Next.
Yeah, so my wife got really upset at one of the ERs I went to because they were being dismissive. And yes, she got a little bit New Jersey loud, but she got kicked out because of that. Whereas, she kept insisting. The problem is I was giving wrong answers because I'm very confident, so I confidently gave wrong answers. So that was another pointless ER visit that nothing happened. So you definitely have to have witnesses. You definitely have to have people with you, just for, your own safety with doctors. And then also with, you know, who knows what they're even asking you or if they even care what the answer is or writing down the right answers. So all around, everybody needs to have witnesses with them.
Just all the evidence possible, especially when you're going to the ER. I mean, for me, I think they only send me to the ER now if it was too long and I'm just taking too long to recover. I mean, we minimize ER visits unless there is actually an injury that needs tended to, stitches or, whatever. But the last one, that the lump was just too big and they wanted to call the EMTs over. It was the same thing. They ended up just leaving me with the impression of like, why'd you bother? But I
I
didn't
was
want to go
just
for
going,
the hospital. So
yeah, none of us want to go to the ER, but I was just going to say ERs can't diagnose you or mm, uh, undiagnose you as an epileptic. You have your paperwork and um your charts done by your neurologist and everything. You know what you have. Don't let them tell you no, you're already in a confused state. I understand that, and but they can't really undo that because you already have your doctor for that.
Wow.
No one else?
That was really great. That was really great, Angel. Like, I
Yeah.
think that's so hard when you're in a state to keep in mind that every doctor you see does not control you, and that's like so difficult to remember.
Well said.
Yeah, I got something. Says someone just tried to induce a seizure with a flashlight because they disagreed with a personal opinion of mine. How messed up is that? I disagreed with you, so I'm gonna put a flashlight in your face purposely. That was in quotes. They did not like when I laughed at them and told them that flashing lights generally affect less than 5% of epileptics, and certainly didn't like when people told them how straight up effed up that was for trying that. What do you want to tell this person? That person obviously isn't your friend. I mean, there's no context on it saying anything about the person, but
So this wasn't some kind of ER or doctor visit or something. This was just somebody saying, "I have epilepsy," and then another person in the vicinity coming over with a flashlight.
this
Yeah.
is a different one.
Yeah, so just remove yourself from that situation entirely. That person's not taking you seriously. If anything, they're trying to cause harm to laugh at you or something, and no.
Temporal lobe epilepsy and learning disabilities. Does anyone have TLE, left side, and a learning disability? I was diagnosed with TLE last year, and of course, the depression and loss of life you knew comes in waves. But recently, I've been feeling very sad for the kid I was growing up. Literally couldn't do schoolwork because her brain couldn't be comprehended. Sometimes when I ask when I'm at work and I can't do something, I feel like that kid again. So it made me start thinking, do I have a learning disability because of the malformation in my brain that causes my epilepsy? Like, could it have been fucking me up my entire life and I never knew? I feel like I'm giving up the 13-year-old version of me did a long time. Trauma is a bitch. Um, anyone with temporal lobe epilepsy that feels like they had a learning disability or want to give this person something?
Go ahead, Rick.
So I have TLE on my right side, not the left side like the poster. I wouldn't say I have a learning disability. I also got mine in a weird way later in life. Um, but I was able to still go to school because I was going for a master's degree when it all happened, trying to keep it short. So I do feel that my comprehension level has changed though. So I don't know if that's considered a learning disability or not. That's something where the person asking the question, I think, should get tested, should bring it up to doctors, definitely make doctors aware so they know what to look for, because if one thing I've learned over the years is no matter what the issue is, if you don't bring it up to the doctor may not test or know what to test for, just because there's a bajillion things that could be going on and not every doctor is going to know all of them. So bring up concerns and then go from there. And the doctor may even say, go see a different doctor to work with that. So that's my spiel.
Yeah, so this is another be your own advocate thing because it sounds like TLE can be a factor in influencing learning, like Rick said, changing comprehension, but it's not typically the cause of a learning disability. So if there is actually something, and it sounds like this person's been dealing with this their whole life, then long overdue for a detailed evaluation.
Yeah, and if they're on like anti-epileptic meds already, remember they mess up our cognitive stuff. So
Got prescribed Keppra, 1,000 milligrams a day, 2 pills. Is this the final dose or is it just starting one? For how many years? Those are two different questions. I got prescribed Keppra, 1,000 milligrams a day, 2 pills, each 500 milligrams. Is this the final dose or just starting one? I forgot to ask the neuro. I know it's different for everyone, but I want to know about your case. How many years will I stay on Keppra before tapering down or leaving it? I was in my late teens to early 20s. I don't remember anything. I don't remember yesterday. So take that.
Yeah, to expect anybody to or to get an impression of what your treatment plan is going to be on a medication, how quickly you're going to ascend and like descend off of it. I don't know if that's the right word, but that's just not something you can really relate to any other patient with, especially Keppra. But 500 once, I think 500 once a day was what they started me off to. Maybe it was like 250 a.m. p.m. or something like that. That was one of the quick ascending ones because I think 6,000 is like the max dose. They usually start off at a higher dose there.
I have experience with Kepra, but I forgot the question. Can somebody repeat it for me?
It sounded like they were basically just asking for insight from others that have been on Keppra. How much did you start off with? How long were you on it? Things like that.
You know, the person says, how many years will they stay on it before tapering down or leaving it? Yeah, I don't
Oh,
remember those days.
I don't really get that part of it, but I was started on 500 twice a day, so 1,000 per day. And then moved up to 750 twice a day. So I can't do math, but uh whatever that number is, I was moved on to that pretty quickly. But there's no thoughts of like tapering.
You still on it?
Yeah, I am.
Go ahead, Rick.
I was on Kepra 1,000 twice a day for it was either 3 weeks or just a little bit over 3 weeks. I had a really bad reaction to it. So, everybody's different. I had a coworker who was the mellowest person that I thought he just didn't care about anything, but turns out he was on a lot of Kepra, and somehow he was like sleeping at his desk and things like that. So it affects people differently, which is why we try it. It didn't work for me at all. My coworker was surprised about my reaction to it. So with all that, you can't say, oh, I'm on it for a little bit and taper off. It depends. If it's something that's working, you don't want to taper off. You may not work. So that's really something for the person posting the question and their doctor to work through it.
Yes.
Well, it looks like at some point I was on 1,000 milligrams a day of Keppra. I mean, it failed, but it looks like it was around October of 2021. And they may have upped it after that. I could keep going through my bag, but I was if you want to know, I was on at least that much, and I weigh about 100 pounds, if that gives you any insight, person who asked the question. Frankly, I don't like Keppra, but if it works for you, great.
How's that 100 pounds for you? Because I'm 170 and I feel like I'm gonna blow away. I feel like I've lost so much weight, and this 170, I feel like the wind moves me every time it blows one direction. I got one here. It says, hey friends, my depression has kicked into overdrive as I can't handle this disability anymore. Is anyone on depression medication along with their epilepsy meds? I'm on 100 milligrams of Excopri, 300 milligrams of lamotrigine, 300 milligrams of Briviact. What do I do? And there's capitals, so what do I do? It's like screaming.
Have they already had some kind of bad reaction? Or
I
they just
read
feel like
you
they're
all I
getting
could
like
say.
overprescribed. Yeah, it sounds like maybe they're just stressing because they're getting overwhelmed at the aspect of taking that much medication, or the combination of feeling like now they have another diagnosis because they were prescribed a antidepressant. So maybe in that case, if your doctor's ordering you to take this, don't be shy to ask why and do your research. Another conversation with the pharmacist, if you've already got, your doctor's opinion and a second opinion, if you're confident that they do have your best interests, but you still have questions, then there's the pharmacist. But yeah, if you don't feel comfortable, don't be shy about not just willingly submitting.
Don't be shy, guys. Come on, somebody. Go ahead, Jeff.
Well, I wouldn't take an antidepressant. I would just smoke weed. It's a natural antidepressant. And if you're depressed, it'll help you out.
Yeah, you make me want to smoke pot.
There you go.
Anyone else? Oh man.
I was
And
going to say, prior to starting Xcopy, I was already on Lexapro. And I was on Lexapro for 20 milligrams. And which is an
when you go out,
antidepressant medicine. But also, if your depression went into overdrive, see a therapist.
that's a good one.
This one's
Just
another rant here saying, oh, go ahead, Rick.
Oh, so I feel that so there's an echo going on. So I don't know if people are signed
I
in
was just gonna message
multiple.
Pookie about it. Either Pookie or Toaster.
I'm
Oh,
glad
Jeff
I'm
is
not the
unmuted
only
too.
one that's hearing it.
So, it's just like with me for, every time I hear my own voice or any voice echoing back, it kind of distracts me, but looks like it's gone now. So everybody hear me okay? Okay. So, I guess first of all, was the person on antidepressants before, and I could imagine being diagnosed and then having to take all that medication is definitely overwhelming. So joining a group like this to talk about it, joining any type of a group, going to therapy, having hobbies, going out doing something. I totally understand. These are, depression's no laughing matter, and depression also has to do with not just mood, it's also chemical imbalance, which, hello, we're taking chemicals. So it's not just a check these boxes off and you're not depressed, or somebody saying don't be depressed. So it's a matter of try a bunch of different things, and definitely talk about it. And like I said, this type of a setting I think would be perfect, as well as letting the doctor know, and getting some other assistance. I think it would be really helpful.
And if you've ever had depression before, it's a lot easier for your brain to slip into the same patterns. So, just if you had some depression before you were diagnosed, and now you're really depressed again, just understand that's because it's like a super highway and it just reconnected, and you just really got to do something about it before it's too late. That's all. And I don't know how I feel about Lexapro particularly, but definitely talk to your doctor and therapy. Therapy's always good. I'll shut up now.
Anytime you advocate for something, we want to hear it. Sailor Mom has knowledge and insight to share, and we can all benefit. Because right now I was looking for other posts to read, and it's just a lot of rants. This one is saying I've been on outrageous arrest videos kick lately, so I mean this one's obviously like looking for it, but it's about faking a seizure, saying it amazes me how many people try to fake a seizure and how poorly they perform at it, saying, "Come on, I want to see some blood squirting out of your mouth or bleeding, gash on your head or hundreds of other things that I've experienced throughout my professional epileptic career." Have you guys ever seen somebody try to fake one?
No, but I
I've
heard
seen
about it.
TikToks. I've
Yesterday.
seen TikTok. Oh, go ahead.
Oh
Tell
no, I was
us.
just gonna say my husband had this. Somebody was doing something yesterday, and it was two dudes together. They were doing it in like Walmart or whatever, and I was like, I have never. Why would you think that is funny? First of all, I don't know.
Your mic cut out there. Oh, we can't hear you.
I think she said she's
She
doing that on
said she
purpose.
was done. It's cool. Yeah. What
Okay.
were you saying, Mark?
Me?
Oh, okay. I thought I
What?
heard somebody else speaking up about seeing people faking seizures.
Yeah, I seen a video of it. I showed you guys the other day. That was about it. Um, and yeah, they were talking about that's a social experiment. It said, oh, people.
Yeah, I had a question about this too because so many people get the diagnosis of psychogenic seizures. So I made a TikTok account and I searched for psychogenic seizures, which is probably my fault. And I don't know if anyone's done this or seen one, but I am really curious, like how do they make the distinction based on watching somebody or if ones on TikTok are actually what they look like?
No professionals or respecting professional would ever make a diagnosis just based on watching a video. That would have to be EEG type.
Yeah, I guess I'm asking like what they look like, which is kind of probably a question I'm not going to get answered unless we get somebody who only has that diagnosis, which is what I'm curious about. Because a lot of doctors will just slap on that, I feel, from what I've been reading. Without, I mean, even if somebody has a clean EEG, sometimes they just slap it on, which to me seems negligent. So I'm curious, like, what the experience of somebody who's had that diagnosis is.
Are you talking about the diagnosis of PNES?
Yeah,
I have
especially for
both.
people who only have that, or Toaster, go ahead.
Sorry, I have both. And it was over the course of over a year, about 4 different tests. Um, before I got surgery, I was diagnosed with. They saw it on the EEG, but they also noticed other ones that didn't look the same. I would still stiffen up, um, but it wasn't. You couldn't see my muscles moving underneath my skin. So I was diagnosed with PNES. And yes, I can tell a difference afterwards. The PNES ones are that I can jump up and just go back to what I'm doing. Seizure ones, I'm just out. I am zombie for the rest of the day. And the good news is, with my seizure journal, I've been able to again keep track and tell. And I actually have not had a PNES seizure in over a month. They've all been epileptic ones. So yeah.
Do you thank you for sharing that. That's kind of answers my question. Do you get treatment for those or do you just stop doing them?
So I go to therapy. I have she is the biased opinion best therapist in the world. Her son actually also has epilepsy. So it's we clicked right away. And so when I came up with the, hey, can you help me with this? And she was like, oh yeah, I gotcha. And I've been working with her for almost a year now. The therapist I had before, I don't think helped me that much. But that was before my life changed.
So did I hear right when you said that you had the PNES seizures that you did have something about like not being able to see your muscles move? So those do manifest
Oh no,
physically?
that's what my mom says. My
Okay, so are
normal
you present
seizures,
for
normal
those? Are you
seizures,
aware?
you can see my muscles like contracting and
Yeah, yeah,
detracting.
the convulsions.
Yeah.
So during the PNES, I was under the impression that they got away with the PNES diagnosis for the people who said like I just feel a twitch but can never get the evidence of it. So do you
No,
definitely
that's
have physical symptoms when you have a
yes,
PNES?
yes.
Oh, okay, you do. Okay.
They start sweating, um, and it's just I don't know how else to describe it. I just start sweating. Um, it's not the same type of fear. I know that makes no sense that I would get during a focal. But it's with the focal, it's world-ending dread. With the PNES, it is I gotta get out of here fear until it just overwhelms me and I just can't do anything else anymore.
That makes sense. Thanks for explaining. I won't dig any deeper. Sorry.
No, no, you're good. You're good. I don't mind.
Well,
If you guys
my
don't
only
mind that
other
I'm
thing about
that
the PNES.
I am on my I have taken my medication, so if I fall asleep, I'm sorry.
Okay. Okay, so I promise this will be the last question. Like for the focals, for example, like a lot of before I was on this, I guess, kind of better balance of control, the focals always led to a tonic-clonic. Do your PNES usually progress to more
No, not to a
generalized?
tonic-clonic.
Oh, okay.
No. But again, that's another reason how we know the difference.
Yeah.
Oh,
Mm.
tell that one to my
Do,
mom.
do you keep or do you retain consciousness through?
Yes. For the
Yeah.
PNES ones. Yeah. But not epileptic ones.
Oh, that's interesting.
I know. Anne could tell you about it too.
Oh, Anne knows
Oh,
everything. We all know that.
Well, Anne's been around the block a couple times.
Anne knows everything.
But
Anne's
that's
been
the
around the
thing. She's
world a
had
couple times.
so much experience, and she can remember it. She can remember names of legislators and lobbyists. Who the fuck can do that with seizures?
Right.
I'm proud of her.
Really not me, man. Anne's amazing.
Can you guys hear me? Okay.
Yes.
Hey, dang it.
Yeah. I have one that says, my family backed out after years of evaluations for my brain. I feel betrayed and devastated. I'm a 22-year-old female. I don't even know where to begin. I've been living with drug resistant epilepsy for 8 years. I've tried multiple medications, endured the side effects and stigma, the memory issues, the exhaustion, everything. And when meds failed, I agreed to go through years of pre surgical evaluation to see if I was a candidate for surgery. I did it all: MRI, PET, MEG, EEG, VEEG, neuropsych. Hospital says, oh no, hospital stays. I put my entire life on hold. I'm a year late to completing my degree because I believed the doctors and my family when they said this process would help lead to something better. And now, after all this time, I finally have a concrete option: laser ablation surgery for gray matter, heterotopia. The success rate for isn't perfect, but there's a 40% chance of seizure freedom and even higher chances of seizure reduction. It's something I hope. It's hope. But suddenly my family is pulling back. They say they never agreed to surgery. They say I misunderstood their support. They're worried about what if something goes wrong, as if I'm not already living in a constant fear that my brain will betray me at any moment. And to make it worse, they're reminding me that they'd be the ones who'd have to take care of me if something happens. It feels manipulative, like they're trying to guilt me out of choosing myself. If they were never going to be there with surgery, they should have said that earlier. Not after years of testing it. Would have been easier to cope at the beginning when I questioned the possibility of surgery, not after letting me build hope and am done with the evaluations. Not after believing they were on my side. I feel completely shattered. I want this surgery. I need this surgery, but I can afford without them. But I can't afford it without them. And now I don't even feel safe wanting it. I'm angry. I'm heartbroken, and I don't know how else to move forward. I don't want to keep surviving. I want a chance to live. What would you say to this person? Come on, I want to hear
Go
what
ahead,
everyone would
Rick.
say to this person. Let's get involved.
Well, I could understand where his family's coming from because they probably did a little bit of research and they're scared. Is what I hope is the sudden, changing of their mind. Um, I had a situation where I needed brain surgery. We had zero time to think about it or research it or anything like that. So we went with it. So what I would recommend for this person is to sit down with the family members and, if they really care for this person, they will all get together and go over research. They will talk with the doctors. They will invite the doctor for some type of a meeting and discuss here's what the risks are, here's what the rewards are, and really go over the numbers, the percentages to show, look, this surgery is more worth it than not. And I think that, hopefully the person's family, it's about a caring perspective and that they're nervous and that this would help their fears. That's what I gathered from this post is that, that's what I felt that the family is maybe backing off from.
Yeah, I
Well,
mean, being told there could be risks is scary when you're a family member, but I don't know if they
Yeah.
really want to do it. I would agree with everything Rick said.
Yeah, and like when my wife's biggest fear was as they're wheeling me into the operating room, is they did warn there's a chance that I might not remember her. And that really freaked her out. And if we had any type of time, because the abscess was ready to burst in my brain, if we had any type of time, we might have had to talk about it, but we didn't. So I totally understand, some of the fear that the family members may have here.
Well, the longer you have to think about it, the scarier it gets, frankly. I mean,
Yeah, especially when you see what type of tools they're going to use to cut your head open.
oh yeah, yeah. Mm-hmm.
Kate, you guys, how would you talk to this person about this? They said they feel betrayed and devastated. They want to hear for
It
Kate,
sounds
they said.
it sounds like I mean, Jeff's unmuted. You got something to say, bud? I want everybody else to speak up. I'm sick of my own
I,
voice.
I don't know. Since I've been on Reddit, both through epilepsy and the universe board, I've heard such horrific stories about parents and siblings and how they treat their children with epilepsy. It just it sickens me. But the other thing is, I'm looking at everything from a 77-year-old's perspective, and I might look at it differently if I was a teenager like Ann, or uh, a young man like Angel. But I'm not, so I can't. As much as I would like to think like that, I just can't. Uh, but what I would do, I would say, fuck it, and I would go in the hospital and have the surgery and let them deal with it after. But that's probably not a wise thing to do. And that's coming from my 77-year-old self. So I don't know.
Unfortunately, he probably just, yeah, I mean, he probably just can't take that route because of the cost.
Yeah,
A lot of prior authorizations and down payments essentially needed before they'll even book it. So, I mean, I think Rick said it perfectly about just keeping the focus on the facts, why this
yeah.
is worth it, necessary even, and worth still worth the risk of side effects, and just be prepared to not, I don't want to say gaslight them, but I kind of had the family thinking what I believed, that after the surgery, medications are over. I have a chance of getting back to full-time work and behind the wheel even, and be realistic at the same time. Be real with your family, be totally honest, and keep it to the facts, not about money. And it's got to be hard at this point because you want it so bad, but the more you seem desperate, that might be a burden for them
And
from
can
their
I just say
perspective.
before I have to leave for a while, I just want to say we're all lucky that Rick is still here with us. That's it. And I'll see you
Absolutely.
all later if you're still here.
Yeah,
Absolutely.
thank you.
See
Bye,
you then.
Jeff. That
Yeah.
is so true.
Bye.
Thanks,
Right.
Jeff.
No,
I think the post said they want to hear from M next.
I think
Okay.
at some point they're just gonna have to stand up and say, "This is my life." And it's gonna hurt when they do it at that moment, but afterwards, when they have the possibility of, well, yeah, working again, driving again, it, and even the just the reduction in seizures is amazing. Of what that's done, at least for my life. So I think it's worth it. But again, I'm biased. I
Yeah,
also got
I
same.
extremely
wanted
lucky. Duke paid for mine. All I had to do was give up part of my brain.
Mm. Yeah, I
Take
remember
it.
you saying that. Free surgery, as long as you can have the brain.
I wish I could. Oh, I still need to post that picture of the hippocampus.
Yeah, I think I remember you saying something about that.
Are you talking like you got a real picture of
My
y-
hippocampus, yes.
wow. Okay. That's one for the books.
Yep. What can I
Andrew, you were
say?
saying
Duke is
something?
awesome.
Oh,
Okay, I do have to go to bed now.
all right. You
Sweet
have a good night.
dreams.
Night, toaster. Thanks for
good
See
checking
you
in with
night,
next
us.
time.
Yeah,
sir.
good
I love
night,
you guys.
Toaster. Have a good one.
Let your
I
parents
love
ground
you.
you.
Angel, were you saying something?
I was going to say we all dream and we all look for that miracle, like take take the seizures away. Um, we all do it. Take the epilepsy away. And you have to put yourself in that situation. Is this that situation where you're just like looking for the next miracle to take it away, not even sure about it? Or have you really, really done your homework? And, you know, if you really have done your homework, then yeah, it's risk versus reward. Yeah. It's, you got to go with it and you got to get your folks on board, but it is your life.
Yeah, it's just another one of those harsh reality ones.
Yes.
This
I
one
want to
is
say
somebody
amen to
saying,
that.
yeah, go ahead.
I just wanted to
Oh,
say
okay.
amen to that. Angel is always like flying is in as an angel and just
There you
like giving
go.
some great empathetic, like very true words.
Yeah. So this one is celebrating 1 year seizure free. Genuinely can't believe it. I've had multiple seizures per month for more than a decade, and now I'm celebrating my first anniversary year, drug resistant, so it's all because I stopped both studying and working, not willing to sacrifice my health anymore for the sake of capitalism. It's insane. I always thought it was something I could never experience myself and rather was for others to live. But yeah, now I just want to keep going. And all the comments, of course, are just congratulations. But wow, over a decade and now a year drug resistant. So I don't know if they're implying that they're not even taking medicine, but that would be a miracle. You guys ever think if any major changes took place that a lot of other epileptics would be able to cope or at least have less seizures?
I'm sorry, could you repeat that? My audio.
Yeah, no problem. They were just saying that they're 1 year seizure free after over a decade after stopping studying and working. Yes, it stopped both studying and working. Now they're 1 year seizure free, and they just said they always thought it was too good to be true. Now I want to keep going. And I'm impressed. But do you think like major lifestyle changes for other epileptics would make that much of a difference, or this is like the one in a million?
Personally, I think if I went on, if I cut out carbs, I probably would stop having these crazy focals during the day where I get weird and, whatever, like earlier. Yeah, I think that my diet, I just can't give up bread. It's just such a problem. It's like I'd almost take like getting weird on Zoom than like giving up bread. I don't know. But I also like this person said they're seizure free for a year. Are you having nocturnal seizures? You should get a nanny cam. I'm like so suspicious of that because I can't imagine it. Kevin, I think is the only one who's mostly seizure free. Yeah. Kevin, do you have anything on that?
I actually don't eat bread. I a lot. I do eat it, but rarely. Like I don't eat a lot of pasta or not even pizza very much. I do eat it, but rarely. And as far as food goes, I just put chicken into the oven and I'm gonna cook broccoli with that. And yeah, I stick with lean meats and not a lot of red meat, rarely on the red meat. Um, yeah. And I know carbs. I was eating Pringles earlier, so I know, I know. I'm not perfect, so what are you
After
gonna do?
your VNS, if you have Pringles, does it really affect you?
I don't feel great. I mean, I'm a little dizzy, but not like seizure dizzy. Just like my body doesn't feel strong, because this isn't food. This is just junk food. Yeah, know what I mean?
The salt might just be
Tastes good though.
dehydrating you and you're getting dizzy.
Yeah,
At least it tastes good.
there you go.
Oh, I have
The
a
bright side to
question.
everything.
Oh, sorry.
No, I was just saying there's a bright side to everything. Delicious, but it isn't good for you. You just gotta
Okay,
choose.
there you go.
Go ahead, Em.
Okay, this is kind of a dumb one, but everybody, if your seizures were a movie, what type, like what genre would they be?
Sci-fi.
What was that?
Sci-fi. If they made a movie about epileptics, it would be a sci-fi to everyone else. We would be like, "Oh, this is cool," but then everyone else would be like looking at it like Star Wars.
It
Like
Horror.
would
Phil
kind
was
of be
talking
like no
about.
plot, but it would just be weird the whole time.
I would.
Yes.
No, I couldn't let it be an accurate biopic. It would have to be Lucy, you know, it would have to be some crazy action movie that like, is the cure for or how to actually utilize like your brain's full potential and come up with superpowers in the meantime. Like, yeah, I would definitely want like more of the action than sci-fi side because I think if it was too close to reality, it would just be depressing.
Yeah, could you imagine, found footage shaky cam the whole time?
Well, yes, because I have a nanny cam. But if you could see it out of our eyes, if that's what you're saying, like, oh my God. I want to punish everybody by inviting them into my movie of seizures.
Are you gonna have a warning at the front?
No, no,
And
you're just like I strap you into a roller coaster and we're just going for it.
I got something here. It says, "Have any of you been traumatized in a hospital setting? They thought I was having a panic attack with seizure-like symptoms. Well, my chart says I have epilepsy and seizures. I was left alone for 35 minutes while a nurse looked at my chart and accused me of having ridiculous panic attacks and had 5 plus, so seizures during at that time. Don't remember much coming in and out of it, in and out of consciousness and worrying. I was about to die and then asking for help and no one answered. During that time, trying to sleep and recover since discharge has been traumatic and distressing. Has anybody been traumatized in a hospital situation? I think I have. The yes is there, but the time isn't there. Yes, it's happened, but I can't remember when. I can't remember the situation. And go.
I think when I comprehended what the bill was going to be, once I was off the insurance and I was responsible for my own medical bills, that's probably the first time that I would call one even concerning because I was just like counting the minutes thinking, how do they actually charge this? What was my last itemized bill? And I wasn't even aware enough to get on the app to look at the last itemized bill. And yeah, that's the most frustrating part. Being in the ER, wanting to leave, but knowing that you're not all the way there yet and nobody's going to want you to leave.
People who have tonic-clonics and end up at the hospital, have you ever ended up there alone, like without anybody, with you?
Plenty of times.
I think your camera's frozen.
Mine are Angels. Angels looks frozen to me.
Yeah.
Yeah, I was talking
You
about
know?
Angel.
Okay, I can hear you.
Yeah.
Yeah, you're
Oh,
back. All right, good.
okay. Can you hear me now?
Yep.
Okay. I walked, like I said, the last time I remember, I was just going to go get milk from around the corner and woke up in the hospital, you know? But there's been plenty of other times where I just was just walking around. I don't know what happened. I wake up in the hospital. I'm like, okay, I gotta get out of here.
Yeah, I woke up in panic and there alone and didn't see somebody for so long. I just left. Well, yeah, I guess that would be kind of traumatizing. I had to take the IV out myself. That was great.
Yeah, I've done that. I love to wander. So when my partner was gone, I had a series of clusters that I don't know if it went to both sides of my brain, but I was like fucked. So I went over to my neighbor's. Thankfully, she's great, but she drove me to the ER and then nobody came for a while. So I was just, all I remember is like looking out the window and being like, ah, it's such a nice day out. And then I just wandered out of the apartment and went right back to my neighbor's place. So, I mean, thankfully she's very understanding, but yeah, it's crazy how they'll just like leave you alone, even if you tell them you're having seizures. Like, I don't know. It's like they should come out with something and then you could just wander home.
I'd rather be able to do that than be restrained.
Yeah. I had some bad hospital experiences. Yeah, just coming out of the seizure and they just want information and like it takes me very long to get my bearings. I don't really know what's going on and that survival instinct is they want insurance information and uh, I think I was just in my teens or I think I was like around 18 or 19 and I took out the IV and I ran out and I was still very disoriented and the hospital was about a mile from my like I've lived here like my whole life. So I know this town, you know, like the back of my hand. So it took me like 2 hours to get home. I was just so lost and disoriented. You know, I didn't know where I was. But I just had to get out of that hospital, and I was just, you know, it's just, I didn't know where the hell I was. That was my worst hospital experience.
I wonder why if you have medical bracelet, like they're aware you say I'm having seizures, they just they should just assume that's true. Like there's not some protocol to make sure you don't wander away unsafely.
Welcome to understaffed hospitals.
I don't even know how the hell I got out. Just
Hey, at least you weren't still wearing the gown. You know you would have gotten picked up then.
yeah.
Did you just throw it off and just, take off?
Pants on, shirt. Oh, gone.
And then
Oh gosh, okay. I one time went and I had post-ictal psychosis. So I was so dehydrated. They put on this like acrylic hospital gown, and I was so dehydrated that it just puffed out like a balloon. It was so crazy. So I'm just sitting there and I look like the Michelin Man, and I think that electricity is like causing it. I don't even know what I thought. I would have to ask my partner, but oh my God, I'm like full of electricity, just making myself the Michelin Man. So I think some of my horror stories are just from my weird fucking thoughts before I got a medication at the hospital.
yeah, that's dope. Dope story. The Michelin Man.
What caused the psychosis? Is that is
Uh,
that the post-ictal thing that just happens after like the bad ones?
yeah, that's a good question. I don't know. The EMU didn't really explain. They just said that I had it, but my seizures were getting very bad, and I was working in light manufacturing, and I have occipital and parietal issues. Hey, no licking, no licking. Um, sorry, my dog is like he's just into it right now. Yeah, so apparently if you have that, you're likely to get postictal psychosis. I don't know why, because that's what your brain decided. It was like, let's go on a very fun, weird journey into like thinking
And
you're
now
full
you're
of
the Michelin
electricity.
Man.
And now, yeah, and then you're the Michelin Man. So that's just what happened. But yeah, it was just, I think that they were just repeating and repeating. I don't know if that's like status epilepticus. It's hard to tell when you're in.
Yeah, I think we figured out the only difference between status and clusters is that there is a break in between in clusters. That you do regain some kind there's a break. There's some time where you're not having a seizure, but it's not long before the next one. And in status, it is nonstop and
Yeah,
definitely a little more
that's
harsh.
probably what it was because I had to go to the hospital and get like emergency Ativan and then it stopped.
Yeah.
Yeah, I don't recommend it though. I don't recommend trying
Mm-mm.
to do that.
No, never inducing psychosis intentionally.
Yeah,
So, Brandon,
status
welcome back.
given to me rescue.
Right, right.
There we go. Hey everyone. Sorry. I could not. I was busy earlier, but glad I was able to pop in before the end. Obviously.
Always.
What's been the
Here for tomorrow.
icebreaker and subjects? I did like I tried to hop on as quick as possible, so I didn't really read what you had posted in the chat. But so icebreaker and topics for today.
Icebreaker. What motivates you to stay alive?
Hmm.
That's deep for an icebreaker.
It's a
Yeah,
good one,
sorry.
huh?
Now damn.
Well, there was
Okay.
another money question too about, but tonight it was, would you take the money or what was the alternative?
The cure for epilepsy.
Yeah, or the cure. That's what it was.
Oh yeah, no, I responded to that one on Tuesday, where I had said cure all the way. Um, I think for me it's teaching something that's going to keep more people and kids alive, I think. Uh like that's what's keeping me going, and it's something that I didn't know would be a passion, 10 years ago, but now it is. And that's, yeah, I think like keeping people informed about something that's going to keep them alive. Yeah.
Okay, I got something here that everyone can help because it's something about epilepsy. So
There we go.
it says help, please. Hi all. Sitting wondering if anyone can help and has gone through the same thing after epilepsy surgery, feel their personality change, and they don't feel right with it. Don't feel right with it happening. Tough enough making the decision of going for surgery. The healing part feels the longest ever, nearly 2 years since surgery. I'm still feeling I'm not completely healed. Can anyone understand me? I haven't had a surgery. Oh, that would be Kate, Rick, and Kevin.
Come on, you guys got to take it first this time.
I was going to say no specific order. Go ahead.
No, Kate always takes the reins.
Okay, I'll take this one. My specific surgery takes about a year and a half to 2 years to work. I had the VNS surgery. That's the vagus nerve stimulator, and um, it's actually used for epilepsy, and some people use it for deep depression. It's true too. Uh, I don't think it changed me mentally at all, but it worked very well. as far as the seizures go. But what was that, Pookie, about changing a person mentally or physically? Yeah, it definitely changed me. Uh, my seizures. You just have to wait as far as that goes. A year and a half to 2 years. That's how long it takes for that to work. So yeah, a little patience for the BNS.
But it took you a year and a half to to adjust to it, and
Yes. Yeah, yeah. I mean, you keep
so
going back, and they. Um, I should know this specifically. They
Just say they
Okay.
tweak it.
Aphasia.
yeah, they tweak it every time you go back, and yeah, and just a little patience, and with the VNS and satisfactory results. But it takes a little time. I'll tell you that.
I mean, so do new meds, right?
Well, yeah, meds, also meds, but I'm starting to go down on the meds, finally. So that's good too. In addition to the VNS, the meds are starting to go down.
And that's a big deal.
That's a
What
Yeah,
huge deal.
Yes.
what
yeah.
what were you on dosage wise before versus what are you on now? Because I'm really interested in knowing, just how much less medication you have to take now.
The hell was it? I was on 2000 Depakote, and I'm on 1500 now. That's the only thing they lowered. Yeah, yeah, that's it. But I'm looking to get off Topamax because that's a huge. They call that Dopamax. That's the nickname for that. I want to get off that. Yeah, that's what people call it.
Yeah.
So I want to switch off that.
Sounds like you're well on your way.
Yeah.
Good job. So mine was 5 years ago. They had me on three medications at the time. I think it was the Carbatrol, the Keppra, and maybe that was one of the Fycompa days. That Briviac? I don't know, one of them. But they wanted me on three at the same time. Max dose of Keppra, max on the other AED, and it was just too much. Felt over medicated after the surgery. Now I'm on. I just stopped the clobazam 2 days ago, and I'm on 500 Keppra twice a day. I wouldn't say controlled seizures, but a lot less tonic-clonics and maybe 4 or 5 focals a month, and so far hasn't interfered too bad. But I like having the service dog and just adapting to what still happens. It works. We'll live with it. I'd rather not be on the meds.
Rick?
So could you repeat the question, or at least part of it? Want to make sure I got it.
Kevin or Kate, can you answer that? Because I don't remember the question and I've
I think
wandered
it was
away
just a
from that
before
today.
and after scenario. How
Okay.
do you feel now after your surgery, and compare before and after.
Okay. All right. Well, before surgery, no epilepsy, no seizures. But I had chronic migraines because I had CSF, which is cerebral spinal fluid leak. I had ear infections that ate away at bone. So I decided to go have deviated septum surgery to help with drainage because that's what they thought was the problem. And that introduced bacteria into my brain, which then caused seizures, a brain abscess, and then surgery. So the surgery, both surgeries, a deviated septum surgery, and then removing the brain abscess formed scar tissue on my brain, which then gave me epilepsy. So the after effects weren't so great. However, saved my life, and that's a good part. So I would say under different circumstances, other people have surgery to fix their epilepsy. I had epilepsy. I had surgery to cause it.
Well, just thank God you're still here.
Thank you.
Yeah. Yeah, we're very happy you're here because we all need music recommendations and you're wonderful.
Thank you. You guys are all wonderful too, and you know it.
Thank you.
Was there?
I have a, oh, sorry, go ahead.
I was just going to ask Rick if there was any sort of is the word I'm looking for recourse or like response, I guess, from the hospital for essentially causing your seizures. You know, like what happened after the fact, I guess.
It was one of those things where they covered themselves by, oh, that would have happened anyway.
Got
Because
it.
I was getting ear infections. I did have a little bit of
Okay.
herniated brain tissue, so
Yeah.
they chalk it up to, well, that would have happened one way or another eventually.
Yep. Lawyers got to cover that end.
Mm-hmm.
Yep. That makes
Yep.
sense.
Yeah.
Sorry. And what were you saying, Em?
I was gonna bring up a question I found on the epilepsy subreddit, but I wanted to make sure you guys didn't have anything else to add on the last one.
Go ahead.
Well, I
All right.
gotta dip out and say goodnight to everyone. It's bedtime here. So great talking to you all.
Right.
Good night, Mark.
Right.
Good
Night,
night.
Mark.
See you Tuesday.
Good night, Mark. See you
Night,
again.
night, Mark, and night to
Good
your
night.
cat who's behind you as well.
Yes. Oh, yes. This is Kitty. Yes. And her sister is down there, Poofy.
Oh,
So,
well, good night to
anyway,
the whole fam.
yes. Night.
Good night.
Good night.
Okay, well, I just heard a really intentionally loud yawn, so I think that's my cue. And I'll see you guys on Tuesday.
Bye, Kate.
All
So
right.
Night, night.
Kate.
Yep.
Shoot.
Okay. My husband said my seizures are the biggest fake news. My husband said my seizures are the biggest fake news. To his credit, I'm a bit of a hypochondriac, and this channelopathy diagnosis completely blinded me and us. My seizures aren't what I thought I would have thought of as seizures before this. How do I even respond? I've explained these episodes to him before and told him that when I described them to my neuro, the neuro immediately said it was a seizure, at which point I remembered I had a family history of unexplained seizures that I had forgotten. I'm trying to educate him in case my seizures progress. I'm on topiramate, which worked for my mom for decades. Has anybody else dealt with getting diagnosed in a relationship and their partner being in denial? I'm also in denial, but I'm looking at the facts, if that makes sense.
I have opinions, but I have nothing to like nothing in terms of like experience, I guess, you know. I have opinions on this, but
Opinions are what we're looking for.
Yeah, give them,
Somebody's
do
gonna
it.
see it and say
well,
that's
they
their question.
I mean, okay, we all are on Reddit and we have all seen the like am I overreacting
Mm-hmm.
posts that pop up, and if a post popped up with someone asking if it was like okay, or like that they like freaked out at their husband because their husband didn't believe that their epilepsy was real, there would be a lot of comments from people being like, divorce your husband because that dude sucks. But obviously, that's not what we're trying to say. But that's what would end up being said. You know what I mean?
So wait, are you saying you agree with those comments?
No, I'm not saying I agree with them. I'm just saying, like, this is what a lot of people would say, but I do think that their husband needs to sort of educate themselves because that's not okay behavior. You know, you need to respect your partner's, uh, uh, even if they claim to be a hypochondriac, which even them saying I'm a hypochondriac is kind of a good sign already to show that they are recognizing that sometimes they can be a little off. But in this case, I think that they are correct and that their husband needs to respect that. So,
I agree with that. We have a lot of people in here who have great partners, I think, or are just
I,
hanging out.
yeah, my partner's great.
Mine's in the
Me
other room
too.
and he's amazing. So, yeah.
Just looking for opinions. So when these people ask or look at this, they can say that's their question and they got an answer or opinion. It says, I had a seizure at a concert and woke up paralyzed. I stumbled and then woke up in an ambulance. It took until we got to the ER and I was a little more awake for me to realize I couldn't move my legs. I had a similar experience about a year ago, but I was alone, and all I remember was waking up paralyzed in my room, on my room, in my dorm room floor. I have a huge blank spot in my memory before that, and at the time we didn't know what caused it because I'm coming to suspect I had a seizure then too. It lasted 36 hours. Wow. Last time, and I don't know if I can handle being paralyzed for that long again. I know on the grand scheme of everything, that's not that long, but as someone who can walk, it feels like a long time. Update: I just called my neurologist's office because I've started to lose ability to hold up my own head, and the strength has still not fully returned to my left side. They are worried about the fact that I woke up from my fall, unable to move my legs, that I am weak on my left, that I am losing my ability to hold up my head, and the numbness developing in my neck.
What's the question here? I'm sorry.
They're just asking
Seizure
for
and
advice.
Yeah, I'm confused as well about what the
yeah,
actual question
yeah.
is.
It's under support, so they just want support.
Okay.
If it, if it's a seizure and it's more than 5 minutes, it's a long time. So
Mhm.
don't throw yourself under the bus that it's not a long time because that's a long time.
They said 36
Um,
minutes.
they said
Says
36
36 minutes.
hours.
Yeah, it says
Oh,
36 hours.
oh, of straight season?
No, of paralyzed.
Oh, paralyzed. Sorry. There was a lot to that. So I got a little confused about the details. My bad. Uh, I don't know. I've never been paralyzed from a seizure, so
Yeah, me either. I've heard about sleep paralysis, and I think I went through that, but um, paralysis after a seizure. For the most part, I can get up and walk, and usually when the ambulance get here, and I can, when I am awake, I walk to the ambulance. I mean, I walk to the thing instead of getting in a stretcher because it's
I
kind of
think
embarrassing in all these apartment windows.
I think most of us like our postical period, we're kind of like, I know for me, I'll like either stumble around or just sort of be curled into a ball. It's one or the other, but it's not like paralyzed, you know.
Yeah, I know what you mean.
Pookie, can I ask a question about that?
Go ahead.
I was just eating dinner with my wife, and all of a sudden, I found myself just staring at a spot on the table, and she was talking to me, and I knew she was talking to me, but I couldn't lift my head off that spot. And I've had, I get most of my seizures at night. I've had 2 absent seizures during the day, but that's the first time anything like that happened to me. And now I'm getting, the usual headache afterwards. Is that a focal aware, or is that something weird? Because I wasn't paralyzed, but I was mentally paralyzed.
Sounds like a focal aware. It
It
was like a
sounds, yeah.
situation. It was like a
Yeah.
situation I had when somebody was talking to me and
Yeah.
I was out of it, and like I tell that story a few times. The person was talking, and when I came out of it, all I heard was nachos. How's that sound? And
Yeah, those have happened to me too, Jeff. Like exact same situation where it's like I'm there, but I can't like move my head sort of thing. I'm just like the focus point is
yeah,
is what feels like is keeping you in control. Is just like I need this spot. Just this spot is what's keeping me like coherent.
Yeah. My wife was saying to me, look at me. And I'm saying, I can't.
I can't. I can't.
I can't.
Yep.
I'm not in control of my brain. It's here and it's not moving. I would like to move, but I can't.
Yep.
I'm so relieved. Like, I'm sorry that's happening to you. Like, really, it fucking blows. But I'm also relieved to hear you say that exact thing because, man, I have a medication gap right now. So, yeah, I'm with you there. And it's so like strange to hear someone else say the exact thing that you've experienced, like where it's like I feel like somebody's almost pulling me on an invisible string towards one point and then they just stop. And my partner was literally like M, and I could hear him. I was like aware, but I just couldn't, like, I just had to be right where I was.
Well, since I don't know a lot, I was trying to figure out if that was unaware because I haven't had them as far as I know.
I
I think
think
that was
oh,
unaware because uh my unawares, I wake up in situations like when I was pouring a drink for myself and I was pouring the drink, and when I came out of it, there was just like the cup was overflowing with juice and stuff. That was my focal unaware. My focal aware, it was where I was listening to my stepdad. For some reason, I was focused on this tree outside, and I don't know why. And I'm just staring at this tree. I can't take my attention off of it. I can hear him talking, but I can't make out what he's saying. It's like being in a football stadium. You hear everybody, but you can't
Right.
make out what anybody's saying. And that's what it was like. And I wasn't even worried about it. I could just tell he was talking. And I was worried about this tree. It was just so green. I really don't know why I was staring at it, but I was stuck on it. And yeah, like I said, when I came out of it, he was like, "Nachos, how's that sound?" And I told him I heard nothing you just said, and I told him I was staring at that tree, and I was like, I just got on Reddit and I just learned that I just had a seizure. That's what that is. And he's like, "Oh yeah, you did look kind of out of it." And then those were the first few days of knowing other things are going on than I knew about years ago.
It's freaky.
Yeah.
now I want to see this tree.
We were on the 7th floor, so there were so many trees. I don't even remember which one I was looking at because I looked out there after that, and I'm like, It was green, and there's a lot of green trees.
How were the nachos? Did you end up getting nachos?
We did end up getting nachos. The nachos were good.
There's Brandon with the important questions.
Yeah,
Right.
exactly.
I
It's
was
like,
about
come on.
to.
All right, we've all seen a tree, but let's talk about the important thing.
Nachos were good. It was like it wasn't actually nachos. He had the steak fries and cheese and some meat and stuff, and it was like steak meat. It was like the sliced pieces and not little ground beef pieces.
Okay,
It was
now I'm really
good.
curious. I need to know. That's a separate
You're
conversation. We
making
can
me
get back
want
on topic.
nachos.
It was like chili cheese. No, it wasn't like chili cheese fries. It was just like cheesy fries with meat, and it was delicious. Um,
Nachos with chili cheese beans. Oh,
yeah,
and
this one
some
just had
guacamole.
cheese. It had cheese and meat and fries. It was just like a bowl of good stuff.
Yeah. Well, I had told you earlier, like you asked me what I was making for dinner, and I was like, making some nachos or no tacos. But yeah, they were good.
Yeah, I got.
Jeff, how do you feel right now?
Uh, aside from talking to all of you, I feel confused. Um, my body hurts, but that's nothing new. I don't know if that's, you know, from the seizure or the weather here, or just my back in general, even though I had the epidural today. Uh, confused. Mostly. Uh,
I'm glad that you came back here because it is confusing and it's just so weird. And sometimes it's just nice to like sit with other people. So I'm glad you came back here.
well,
I'm feeling
Yeah.
pretty weird too. So,
yeah,
yeah.
I was going to, and then my wife said to me, "Why don't you go talk to your friends and see what they say, and just talk to them for a while, so you'll get back to yourself."
Your
I
wife
wonder if
is
the
great.
epidural.
She's
I
she's
love
a
that.
wonderful person.
I love that she phrased it that way too. Like, go talk to your friends because it really is like.
Well, listen, Brandon. I never met you, but we're friends.
Well, that's what I mean. None of
Yeah,
us have ever met in person, but we're
right.
all friends. Exactly.
Exactly. It's this is my family. It really is.
Yeah.
Thank you.
Yes. Yes.
Yes, it is. I feel like I know you guys so much, and all I know is you guys have epilepsy.
I
Mm-hmm.
wrote the other day that this is the best thing that I've done since I've been diagnosed.
Oh.
Me too. Other than having kids, yeah, this is the best thing I've done.
Yep.
The most interesting thing I've done. Like I've done a lot of stuff, and since I've had epilepsy, this was the one thing that kept me consistent. I haven't had anything much. I haven't been good with consistency growing up. Um, I was never good at that. I would jump from hobby to hobby to hobby. Um, yeah, I started painting. Then I started DJing, and then I was like, I'm gonna start a podcast. And yeah, and
And we're
then
all glad you did.
the podcast turned from one idea to a different idea. So
Right.
that's what I mean by just undecisiveness. But just like after meeting you guys, I was like, I gotta keep doing this. This feels good. Then everybody else was like, this feels good. And then every time I did it, I felt good the
How
next
often
day. So I
do
was like, I got something here. This makes me feel good the next day. And I truly don't understand it. But seriously, like the next day, like tomorrow, I'll be feeling good. I might get up and listen to music, walking around the house and stuff. And it's just like peaceful until someone says something. And I'll be like, damn, I could have made it till Tuesday. Yeah.
and it's not often that you get people with epilepsy together. outside of EMU. You know, this is
There's
like, hey, we can sit and chat and out.
there's so few of us, like, in general, that the odds of, you know, having somebody in close enough proximity uh to, like, talk to them is already low, but to have a group this big to talk to, it's impossible unless you live in, like, a major city, like New York City, Boston, San Francisco, whatever. It's impossible. You're not going to find this many people who are willing to talk and, devote their time to something like this.
I
Yeah.
don't know that if you were in that big city, that those people would have the type of empathy that we have for each other. Because in a big city, they're all interested in themselves.
Come to
Yes.
Oakland. People, honestly, people are amazing here. Yeah, but I think you're right. Like people are very doing a thing in a big city, but come to Oakland. Oh my God, the people are wonderful.
I
I'm
love it.
I'm in Providence, and the Rhode Island driver, like, stereotype is actually very factual, where they are all horrible. Um, and me and my boss sort of came up with just a thing to say about people doing what they do on the road, and it's the Rhode Island mindset is fuck you, I'm doing something. And that's really what it is. Like, I don't care. I need to do this, so I'm gonna do it. Like, okay.
I got a
It's
good one
not
here. Oh, go
strictly
ahead,
Rhode
Jeff.
Island.
What was it? Wait, sorry, there was a jumble there.
It was not strictly Rhode Island.
I know it's not strictly, but like in New England, Rhode Island drivers get a bad rep, and it's for a reason.
Yeah. What was I gonna say? Oh, I had one here. It was a good one.
Hmm.
It says, "Can you have a seizure and not know?" I was on my porch smoking a joint, and when I came in the house after the joint was done, I felt like I had a seizure, but I remember the whole time smoking the joint. I don't remember a seizure, but I feel like I had a seizure. I didn't bite my tongue, but I do have a headache, and it's only one type of headache that comes like this, and it's the headache when I have a seizure. But I remember the whole time me sitting there smoking. So now I'm confused. Was I having a seizure and smoking, or was I smoking and had a seizure and I did not notice? Um,
I always think it's a seizure. Anybody asks, I'm like, that's a seizure. Everything is a seizure.
yeah, I think the question was, can you have a seizure without noticing? Yeah, I don't notice any of mine. I can say that. Once I notice.
100%. You can have a bunch of seizures without noticing, especially the tonic clinics. Um, yeah,
Yeah, like having focals and wandering off. Just like, how did I get here? I didn't know I had a seizure until I asked someone that I was playing video games with when the thing happened. So, um,
yeah. Absent seizures are all of that, you know. Don't notice happen.
I got something else. Now that you said absent seizures, you guys got to answer this one. It says it's a child's. It says zoning out or absent seizures. Just curious. I'm 15 years old. I had many times where I apparently zone out for a couple seconds, sometimes lasting a couple minutes, but I don't ever remember zoning out. Usually, when I'm nearby somebody, they'll ask, "What was that?" or "I was calling you," and I get very confused by this. I do sometimes say, "Thinking," but afterwards, I usually am very confused what they mean by that because I wasn't thinking. I don't even remember zoning out. I have asked what they mean, and they all say, I have I think you were zoning out, which I have no memory of. Some people say I've done it while talking a few times. Do you think that I'm zoning out, or do you think I'm having an absence seizure? And what should I do?
Absence seizure and see a neurologist to get on medication.
Yep.
Yep. Yeah, you need to have well, okay, the EMU told me that if you have absence seizures when your meds stop, they're really obvious and they show up on both sides of the brain. I don't know if that's for everyone.
Yeah, that was right on time when Angel said absent seizures. This person says, wondering what type of seizures exactly I'm having. Seizures only happen during sleep or naps. The thing with mine, though, is that I can like feel when they're happening. I feel myself jerking and I kind of feel myself trying to fight it. I sadly just had one a couple of hours ago and I haven't really been told what kind of seizures these are. Does anyone else have the same thing happening? Any response would help. Thank you. I'm not exactly sure what nocturnal seizures exactly are, but the kind of sounds like it. We could get this from Em or Jeff.
Nocturnal or any seizures overnight. Well, while you're sleeping.
Yeah, and you don't part of it, okay, I read that PNES, they say that people wake up before them, but if you're having nocturnal seizures, like Jeff said, like you have no idea. Like you do need a nanny cam or somebody to tell you because you are completely not conscious for it.
Okay. Jeff, did you hear what I said?
Jeff might be in Wonderland right now.
Well, he just didn't. He was muted, and he didn't know what the heck he was doing.
Oh.
Okay, I'm sorry, I didn't hear the question.
Oh, somebody's saying, I'm wondering what type of seizures I'm having. My seizures only happen during sleep or naps. The thing is, mine though, I can like feel when they're happening. I might feel myself jerking and I can feel myself trying to fight it. I sadly just had one a couple of hours ago and I haven't been told what kind of seizure these are. Does anyone else have the same thing happen? Any response? And thank you. Can you feel your nocturnals?
Sometimes I think I can, but I really can't say that I can. I can. No, I can't feel them.
Do you feel them like the next day?
Yeah, definitely.
Yeah. Okay. Yeah. I figured that would at least be a thing, you know.
Yeah, definitely feel it the next day. But while it's happening, I'm asleep. When I had the thing just a few minutes ago, yes, I was aware. But generally I'm unaware.
Jeff, have you ever had any like I want to take back what I said earlier because sometimes when you're falling asleep and when you're waking up, you can be kind of aware, which I've definitely had like very vaguely like it doesn't feel like a seizure though, it just feels like I'm waking up. But I watched the footage and like what I think is me just holding my phone and then waking up was actually me holding my phone staring straight ahead at it for a minute and a half. And it was very frightening to see. So I wonder if like coming in and out of sleep you've ever experienced something like that. Or Sia's also in the chat here talking about them.
No, I don't. When I wake up, I want to get a joint as fast as I can. So I don't think I stare at anything. And that's I'm being serious. It's not,
No.
you know, it may be funny, but it's the truth. I don't think
Jeff,
of anything.
you're good.
I mean, but that's the first thing I do when I wake up. Uh, I put on, you know, shorts and a t-shirt or pants, and I run outside.
You're
Yes,
running
especially
at
when
that
you're
age?
in pain.
You're
Sorry.
still running, Jeff?
Wait, are you using it? Are you using it for like joint pain? Because the running outside might not.
Well, Brandon, I say run. It's a crawl.
I got you. I got you.
I'm using it. I'm using it for two things: for joint pain, and I found my life has gotten much better since I'm a little high.
I agree. I'm right there with him. So
Yeah, I wish I could. It doesn't work for me. It causes seizures, but I wish I could, man.
oh, so I guess that's actually something I've been questioning.
Right.
Where for some people, like marijuana helps, and for others it hurts. When it comes to seizures. Um, and I'm wondering if that's because like your seizures are more prone to your brain like being understimulated, and then there are other people who like need to calm our brains down because we get seizures when it's the overstimulation. So it's I don't know, it's weird. I was thinking about that today.
It is
That's
weird.
interesting.
It is. It's very weird.
I also wanted to respond to Jeff. I said this earlier. I'm in a cluster of a lot of seizures. It usually starts for us around 6 p.m. and it just keeps going until my medication kicks in. And I had a bunch earlier. Anyway, sometimes my face looks like I'm laughing, but it's just doing it. Yeah, it's a thing like you have an inappropriate looking response to things. Sometimes I say weird shit just if it's in my brain it just comes out, but yeah, I'm not laughing at you or like, yeah, that's
Yeah, you've been laughing at me all day.
I love the connections that people make with each other, like it just is
Yeah,
delightful.
it is. It's just great.
I like making
And
friends, especially when they have epilepsy.
Oh,
and you never have to apologize.
You'll never hear someone say that. I love my friends that have epilepsy.
Yeah.
I
I
love
love
them
my
more than my
friends who
regular
ruined my
friends.
party.
Yeah.
We're all movers and
Epilepsy
shakers.
party.
well, it's because we're all ruining the party, so we all get it. You know.
Yeah.
Yes, and
Everyone's gonna
Jeff,
be taking notes.
I
Rick,
really
put on the
appreciate
music.
you saying that, Jeff, because I'm at the right after it happens I get intense guilt and I can't stop it. I mean, especially with the medication gap, like, and it's very comforting to hear that because even though I just have to ride it out, it's very comforting to my nervous system. So I really appreciate that.
Seriously, that's I don't get offended. I didn't think you were laughing at me. And if you were, I wouldn't get offended anyway. You're entitled to an opinion. Everybody is. Not everybody agrees with me. And, so what?
Yeah,
It's
thank
nothing
you.
to feel guilty about.
It's also my seizures opinion is just something is randomly hilarious, so my face does it and my brain doesn't know what's so funny, you know? I mean, somebody
Yeah.
could be saying like something, it happened, one of the first times I got on, Annie was telling her story, her personal story, and like my face, I could see my face like laughing. I said something weird in the chat, and I was like a second later, like, what the fuck did I just do? That's terrible. But my brain decided to do it.
Yeah. I think we all have probably gone through something like that. We're not all in control all the time.
Oh, Angel brought up your epidural. Do you think that that might be affecting your?
I checked with my neurologist and my pain doctor checked uh, also with the medications I'm taking, and he said it wouldn't be a problem. And you know my attitude, if it is, fuck it. I'll deal with it.
I would still tell your neuro about this. I mean,
I'm sure
something
that
happened different today.
I'm sure that the like research on epidurals and epilepsy like combined, like there's probably no like research whatsoever to go through, you know. So when they say it wouldn't have caused it, can you really trust, you know, like that, or is it just them being confident, you know?
No, it's just that, what am I gonna do?
Yeah,
If I want my back to not hurt, I have to try that. It's one
yeah,
or the other.
yeah.
Yeah, Brandon suggested the B12, and look where I'm at now.
You can
You've been taking
have
the
your wife walk on your back. It might not hurt.
Pookie, you've been taking the B12,
Oh yeah,
and you feeling better?
I haven't had a focal in 6 weeks.
Dude, I am so pumped to hear that. Fuck yes.
Shout out to Nature's Maid.
Oh yeah, you were. Yeah, I had to hop off when you were advertising your Nature Made the other day.
Yeah, yeah, they've been working.
I use Nature's Truth.
You should switch.
But I get these like for cheap at the grocery store at the end of my street, so it's easy.
Oh, okay, yeah, the convenience is the thing. Here it says, does any does this sound like a seizure? I'm 25 and I'm on Vimpat for epilepsy. My dad also had seizures when he was alive. It's not why he died though. I have epilepsy and it's usually triggered by stress. Recently, I've been extremely stressed, but keep it up on my meds. My meds do not completely stop the seizures, they make them less and prevent really big ones. So I lay down for a nap and I wake up very stressful. I wake up to a very stressful message. Immediately, I start shaking, but I am fully aware I cannot stop shaking. My jaw is chattering, my chest is shaking, and I can't breathe. I tense up and can't move for a good 30 seconds, but I force myself due to. Hold on. I force myself up. I try to talk to my partner, and I can't that well due to my jaw chattering. I can barely walk. After 5 minutes, it eases up and I'm fine. I can breathe, no tense body. I can walk. Is this a seizure? This isn't anything like my usual ones. Nocturnal petit mal and at worst nocturnal grand mals. And despite having epilepsy for 18 years, I've had the privilege of it being diagnosed and uncontrolled fairly quickly. So I don't know a lot about my seizures. That I guess kind of sounds like a seizure.
I've had similar situations. I see a lot of people are saying panic attack. Um, but I've had similar situations and it was I think the way that they're describing it seems a little different than what I've experienced, but for me it was very much so like my whole body just sort of clenched up and I couldn't really communicate for like a couple minutes. I could talk, but it wasn't like I could have a conversation. You know, it was like me being able to tell someone that I can't talk, and that was the extent. You know, like um and there was shaking, but it was more like the clenching that caused the shaking. It wasn't like my whole body was like shaking on its own like that. It, you know. But that's what's happened to me. It started to sound like something that's happened to me, but everyone started saying panic attack.
I wonder if it ended for this person, because the EMU was the first place I could have a panic attack, a real panic attack, because it just ended after a little bit. Whereas like a seizure, like I'm having a cluster, it doesn't end. Like it just keeps going. The panic attack, you like can actually use like tools like grounding stuff to make it stop, and you can sit down. Yeah, I don't know if it just, yeah, I don't. Oh, and my panic attack did not show up on the EEG, so could just be that.
How do you know? Do you remember?
My panic attack?
I'm just kidding.
Oh, the EEG. Oh man. Yeah, humor right now.
Okay, I got one said, I feel covered by my fiance's response. I have epilepsy and recently found out I have a tumor and will need surgery. Later on, my dad decided after my appointment to stop by and see his mom. I have no problem with that. The car ride was the car ride from the appointment and where we live is around 2 hours, and the entire ride. But he didn't hug me, be sympathetic, and just overall acted like he didn't care. I honestly was upset, but I have bigger issues right now. Later, when I got home, I ended up having a seizure. It was pretty rough. It was a pretty rough one, and laying there, it felt like pretty weird after. As I was on the floor of my bathroom, laying there for a bit, I was able to pick up my phone and I was able to pick up my phone and call me. I told him I want happen. These are not, seems like they say, I wanted to tell him what happened. I told him what happened and the severity, and he said, I'll call you later. Now I'm pretty annoyed, and I never got a call. So I text him saying, I had a bad seizure, and he responds with, bruh, ATP, I don't feel well, and decide to go back to bed while having 911 on speed dial just in case. In the morning, after I say good morning, I ask why he say bruh to a serious thing, and he said, what was I supposed to say? This feels unbelievable, and I don't even know what to say or think. I feel like I'm a burden because of the seizures. Um, that's a rough one. I hate the situations with your partner and just doing that, like treating people like shit because they have epilepsy. Um,
That's a sign of extreme narcissism in the other person, you know? That's a little wild.
yeah. So what should I say? There's a million things you could say besides bruh. I'd rather you say nothing besides say that. Just tell me you got the message and left me on red than just send me bruh.
Yeah, that's just like, okay, well, you've made it clear you don't care about me at all.
Like
I would just try to establish some sort of, like it says there, CIA said communication. Yeah, if I mean you can't break down some walls first, then yeah, you really got a real problem there. I mean, has this person tried? It's said there in the post.
it,
I mean,
it did not say. Just said what I read. There's no other context from it, and a lot of it was spelled wrong, and words were where they not supposed to be. So I paraphrased a lot of it. Um, a decent amount of it, not a lot of it. But
I mean, I always want to try to save a relationship first, and it's very important.
yeah, I don't think she's. I don't think he's trying to save the relationship. He doesn't sound like it. Someone said in the comments, that better be your ex fiance. That is not okay. And you being treated like that is scary. You could have been seriously hurt. Another comment is anyone who genuinely cares about you wouldn't be this nonchalant about your epilepsy. Also, you want someone with you who will run into action if needed. Try to sit down and talk about how you're feeling and how you felt. see how his responses are, and ask him if he's taking your health seriously. Marriage makes him more reasonable, his care even more important. I'm sure you could try and find some articles about how a partner should care for you if you have an illness, etc. Make it clear that how he treats you health wise is a big factor in your relationship. You can't control your seizures, but he can control his reaction to them. If he doesn't make changes, then I would take a break or call things off while you can. I wouldn't suggest anybody leaving their partner. So, going to you guys.
I would
I
take
would
all of
say,
those comments and put them on the question from earlier about the for the woman whose partner doesn't believe their epilepsy. I want all of those comments on that post as well, but I agree with every single one of those comments. Yes.
yeah, I just want to say, come on over to the Epilepsy universe. We'll care about you. We will care.
All right, thank you, Angel. Um, got one for him. Had to get it. Dug it out of the deep crevices. Did weed give me a seizure? So basically, I've been smoking for like 6 months daily. And last night I had five puffs on a joint that was mainly tobacco. I hold puffs in for some reason, and I was about to get up and go give the joint to someone else. I stood up and got dizzy. This happens often. But then it kept getting worse until my vision went black and I couldn't move nor speak. I could hear and feel my friend grabbing me to stop me from falling, and I still felt conscious. I was apparently shaking, but was also only on one leg, so it could have been loss of balance, I think, or just from being stoned. And the whole event from standing up to my vision returning maybe lasted 20 seconds. My friends think I should quit weed as they think that it's what caused it, but I'm sure if it was or not, I feel fine 20 hours after and felt fine soon as a half an hour after, but the doctors told me it was more of a faint, but my symptoms matched that of a focal unaware seizure. Of a focal aware seizure. What may have caused my seizure if it was one? Or did I just faint? Doctor said you fainted. Then again, you can't listen to those people. So, um, mixing tobacco with your weed isn't a good idea at all. I've heard of people having seizures from that. Um, yeah. Anyone that smokes advice?
I do tend to mix a little bit of tobacco into my weed, but I never smoke straight tobacco because it is a stimulant for the brain. It's like having coffee. It's the same thing. So it, I'm not advocating for it. It's just you know for me the tobacco and the weed sort of even out, I guess. But where one's like a downer, one's an upper, sort of thing. But that's just me. I can't advocate for it though. I can just say my experience.
Yeah, my experience, I just cough too much. It makes me choke. Um, it's like smoking a
Oh yeah, that
cigarette at
doesn't.
the same time.
Yeah, it doesn't happen to me anymore. Yeah.
Yeah. Any other potheads in here want to tell the story? No. Oh, I must move on.
What kind of story?
Um, any story about being stoned, anything funny would be nice. But also, yeah,
Like
the person said, "What may have caused it, or did I faint?" I think the doctor said faint, and if you felt like you have a seizure, then don't listen to the doctor. But if you just don't understand, it might have been a focal aware or unaware. But yeah, I stopped smoking nicotine, and I don't know if it's the B12 or the nicotine gone, but I'm doing pretty good with the focus.
Wait, so this person said that they were completely aware and that they just sort of fell and couldn't like get back up for a couple minutes.
20 seconds.
Oh, only 20 seconds. That sounds like it might have been a dehydration or something issue. You know what I mean? Because you know when you like stand up quick, and you suddenly like lose all your balance. A, a lot of times I feel like that can be due to dehydration. Because I've had that happen to me at work. And that like was well before I got diagnosed, well before I got, you know, any type of seizure. It was just, like, guys, just give me a minute. I fell down. And then I realized I just hadn't had any water in like a full day. Drink your water, folks. Drink your water.
Speaking of water,
Drink your water. I'm just saying, I'm not like that. That's what has happened to me, but again, not sure what this person's individual experience was. So,
again,
Not 100% sure. It could be two things too. One, it could be I've never experienced it, but it's the tonic. Oh, maybe like a focal tonic seizure where you just fall. But I don't know if they were just standing straight up, you know.
oh,
And then the other thing, and
sorry.
then the other thing is medicines. I know a lot of my medicines um say imbalance you know stuff too. So it could be side effects from medicines.
okay. The party has
Angel.
arrived.
Hey.
The pioneer is here.
Hey.
Hi, Tom.
Party has arrived.
Sorry, before I forget, because we all know that might happen. Angel, could you elaborate more on the focal tonic? Because I feel like I've had those before and I've never heard of those.
It's like you don't go to the clonic phase, you just fall. Or
And
it's
and is it like like from what you like have experienced or heard, um is it like hard to get up for like 5 minutes or so?
yeah, you can't control it. Obviously it's you're seizing. Um and like it definitely is. It's like it's hard to explain, but it's different from the tonic clonic ones where you go through both the convulsing and the falling part. It's just like um you just pretty much, like, if you're sitting down, like how Jeff said he was earlier, he would have just went straight down, like his head straight down,
Oh,
you know.
okay. And sorry, I was thinking of a situation that happened to me a while back, where I had to do a bunch of work on my laptop like all day, and I was staring at the screen, and then I got up to get some water and I walked into the kitchen and I just like my whole body lost motor function, and I
Yeah.
was just kind of stumbling around the kitchen. But I was aware of what was happening. I just couldn't control my
Yeah.
motor functions. And it lasted for about like 3 to 4 minutes.
Yeah, that could have been one of those like atonic seizures.
Ah, okay. See,
Um,
this is a good thing, that we're here, because if you have a question about something, you can ask.
It sounds very
yeah.
familiar because I know I had very bad myoclonic seizures, but I'm sure they weren't all myoclonic because uh, they weren't, uh, uh, you know, specifically jolts or jerks. There were times when I would just, you know, feel my body just falling over, which is separate from the muscle spasms.
Yeah.
So I could see myself falling, or I could see myself, like a separate, my mind was separate from my body, but I can't really pin this down. Or lots of times where I just can't pin down this definition. It does sound vague.
I also have a question kind of similar to you guys. And it also, Kevin, it sounds really very scary to be aware during that. That sounds very frightening. Um, yeah. Is it scary for you when it happens?
Uh, Sometimes it's more like a fight or flight thing. Like it's like it, you're more worried about. I don't know. That's weird. I'll say maybe. You're
Yeah,
so
your
like
brain is like,
you only have a split second to react, and like you're just so full of adrenaline, and you got to think about surviving. So you're not scared, or um, you know, you're not anything really. You're just like, I got to grab onto something, or I gotta put my arms out.
are you able to stop it, like put your arm out?
Uh, Maybe at the last second. Sometimes now. That's when I bash my head on the table a lot of times. But yeah, sometimes I go down. Sometimes you know.
There is a certain point where your body, uh, like, will instinctually take over and put your arms out when needed, but obviously not every time.
I'm curious
Unfortunately,
because
I
I've had unaware ones where I think Sia is talking about in the chat too. I don't remember any of it. I can't put my arm out. And I just like break some ribs, but I have no idea what that is. The neuro said it was a focal impaired awareness, but I don't have any awareness. I just go down and then immediately get back up.
Yeah.
I've never been somewhere and heard so many men say something was scary. But I get it though, so yeah, I get it. This shit can be scary.
thought I put it in the chat. I must be lagging or something. Let me see.
Wait, this is scary for you guys? You guys are scared by this? What? Huh?
Right.
I'm totally messing with you, Dylan.
Yeah, it was scary in
We
the
are all
beginning.
terrified by this. That was completely sarcastic and
Oh
rhetorical.
yeah.
Yeah, I know. It was worse in the beginning.
This afternoon.
This is old news at
Wow.
this point.
Right.
Jeez.
Yeah, exactly. Where it's like,
Oh
oh yeah,
man.
I wake up every day terrified.
Mhm.
So, um, I got something that says how long do your seizures feel to you? I don't know how long mine lasted, but I've had 1 minute plus seizures that don't feel like seconds to me, but are really much longer. Do you guys have this too? Just to clarify, I know when mine are happening because I can feel the aura and I can feel myself jerking. Um, how do your seizures feel? I have a grandma. I just wake up and it's over with. So that's where I'm at with this.
I'm wondering if this person, maybe because I'm in one, is having a cluster or if they're really having a very long seizure. That would be a good question for their neuro.
Right. Someone said having seizures from different body parts. Okay, so this is just a small question for people. What body parts do you guys get seizures or the entire body? I know there's different kinds, but recently I've been getting seizures on my left arm, shoulder, and now my right leg. Also, I usually have seizures on my left leg, but now it's changed. Just wanted to know if some people have the same experience like me. No. Anybody have
Oh,
shaking limbs?
I get them
Uh,
in my brain where seizures happen, but that's just me.
Yeah. Anybody?
Yeah,
I've
a
heard
lot of
people say
brain
they have
switching.
shaking limbs, but not me.
I mean,
Yeah.
there is the connection of, neurological to like neuro to physio, like connection, obviously. But if they're not having like seizures in their head, you can't just get them in your body. That doesn't make any sense to me. I may be wrong, but it doesn't make any sense to me.
I'm pretty sure. I'm not. I think the myoclonic jerks might be. I don't know. Am I wrong on this?
I get those when I'm feeling like after a seizure and when I'm recovering from a seizure sort of thing.
Yeah. I think what the person is uh asking is it localized to a specific limb or like a toe
Uh,
or something? I don't know. I don't know. But yeah, if that's what the person's asking, then I do get them down limbs and you know, yeah, down my arm, my leg. Yeah.
they should
Yeah.
definitely see a neurologist because if they feel it in their head and it's affecting their body, it's worth going to see a neurologist.
Oh yeah, definitely.
Uh, that's above my pay grade. My seizures are in my head, personally.
Wake up and the head hurts. So yeah, me too.
I don't feel anything in my extremities.
Yeah, me either.
Well,
So
I
far.
guess sometimes I do, but only like if I haven't taken my meds. Anybody ever like also kind of get the shakes if you're
Uh,
late on your meds?
Yeah,
I can
laid
I
on the bend.
Yeah, I think
A
I can
little
I
bit.
felt I felt my arms shaking
Yeah.
as a precursor to a seizure.
And had you taken your
As it's
meds?
as my seizure's building,
Oh,
I can feel it, like climbing up my arm.
feeling it physically. Yeah.
Yeah. But I mean, as far as it just subsiding in a limb or your stomach or your back or your fingernail. I don't know. That's beyond me. That's more than I can
Yeah.
grasp.
Yeah, we need to get
There's something called I want to share this link with you guys where it's like it's videos from a French like it's like a fuck. It's videos of seizures, but there's abdominal epilepsy and it's crazy like or just your stomach like goes crazy. It's a type of seizure and it's like missed because of muscle artifact.
Ooh, can you send that to the mod chat?
Yes, absolutely. I have a couple links. I want to send you guys really good resources, but I'll send that one.
Yeah, just
I'd
I know
love to see it.
I know the chat goes away once we leave, so
Yeah.
Yeah, other people have mentioned like people trying to get drugs or like faking seizures, so I was just a little hesitant to post it in the subreddit. But I wanted to share it with you guys.
Oh yeah, absolutely.
Most definitely, yes.
I tried to post a picture of a screenshot of the Atonic, but I don't see it coming up. But you can Google it, and I'm pretty sure the Epilepsy Foundation might have some more information about it.
Oh, yes, and the Epilepsy Foundation website's really good. And I'm sorry, the one I was talking about, you can also search by like localization, and type. It's really cool. I'm about to.
Excuse me 1 second. I can't access the chat. I just have to leave and I want to say goodnight and I'll see you all Tuesday, I hope. Take
Good
care.
night,
Oh,
Jeff.
All right,
yeah.
night,
Right.
Jeff.
Good night.
Right.
Good to see you
We
tonight.
hate it when you go.
Tuesday.
Right.
Glad I was able to see you before you left, Jeff.
Hope you feel
Glad I was
better.
able to see you.
Later, Jeff. Yeah, definitely
Take
feel
care.
better.
Thanks.
Night, night.
Right.
Are you okay?
I'll be okay. The Keppra will kick in. It usually kicks this in the ass. And then I have to get my meds refilled to make these stop. But thank you for asking. This has been a bit of a rough 2 or 3 days. And trying to host a meeting. I really appreciate you guys working with me. I feel like I inadvertently kicked out some people by saying some shit, but I don't remember.
Wait, how come I wasn't there for the talk about that, but how come you haven't been able to access your meds? I'm sorry, I'm getting sleepy and
So my therapist actually prescribed them because she thinks I need them and I do. So I have to see her to get them and I haven't been able to see her and I went off of them for a while because I don't want to get addicted to benzos to be honest.
that is fair.
Very good call.
I'm just curious to know if like if you went to the pharmacy, if they would give you like an emergency supply, because I know my doctors will do that with my or the pharmacist I go to will do that for my Keppra. Um, so it might be an option.
Yeah, thank you for that. I might do that because I don't want to have to, if this keeps happening like tomorrow, I see her next week, but I don't want to have to go to the ER because no one does.
No one does. It way too much money spent. But if you at least have a pill bottle of the prescription,
Right.
you can at least
The
show
number on
them and go like,
it.
hey, I'm seeing my therapist next week. I just need like 2 to get me through or whatever it's going to be. You know what I mean?
Yes. Oh my gosh. Yeah, thank you for suggesting that because I don't think it's good for my brain to be doing this. And I feel like I've gotten a bit of brain damage for not managing these.
Oh.
And we all have brain damage.
I feel like I got some brain damage too from not managing mine. Like I said, in the past 5 years, 5 to 10 is how long I've been working on getting it together. First, I was just kind of careless. I was just like, I got epilepsy. All right.
Yeah, me too.
I was gonna cut out right when Jeff left as like a good like timing, but I wanted to talk to Em about the medication thing. But with that, I am gonna leave. So I hope all of you have a wonderful rest of your night, and I will see you Tuesday.
All right,
Okay.
Brandon, good seeing you
Later,
again.
Brandon.
Later, guys.
Bye, Brandon.
Later, folks. I'm sorry, I shouldn't
Guitar
say
back.
guys. Later, folks.
And I have a question, Pokey, you and I talked earlier. Did we have anybody that we haven't talked to before show up?
Yep. I think 3. I think I might have said 2 earlier, but I think 3.
Did you get names?
Oh, 3. Christine, Kristen, and Amit.
Yeah.
Okay. Tell me about
Um,
I'm teasing, I'm
I
teasing.
was gonna say, would you be mad if I said I don't remember?
No, this one of them was like when you and I got together this morning, Pokey.
Mhm.
I mean, I read a post that he or she had made, and it was like, wow, this person needs to get on our Zoomcast. And so I came on here and I copied an invite link, went on to uh, her homepage or whatever you call that, and I gave her a direct message. And I told her that, hey, I'm so and so, and we have this podcast on Zoom, and this is something I really think that you would benefit from. This is a direct link. The times are from now till then, and please, if you get a chance, all you have to do is click this link, and uh, you'll just be there. You don't have to participate. Just be there, and when you feel comfortable, you're more than welcome.
That's
I
how you do
love
it.
that you say that because I've been trying to word that in a way, and most of the people, I don't think I've ever seen somebody join and then like not eventually kind of chime in and share a lot.
Yeah, I always see people join, and then eventually they get comfortable and they start talking, or they hear something they can relate to, and they start talking. Yeah.
Not bookmark.
Well,
God, it's like I'm epileptic or something. Damn.
I
I'm
got
so
something
glad
here.
that we can all get together and just be fucking weird.
And
Like
be
that's
ourselves.
just normal for us.
That and my wife said, Tom, would you just go over and sit down? I know what you're trying to say.
Oh, the
Quit
sit
trying.
down.
Tom, you're trying
Sit
too
down.
hard.
Every time my partner's like, sit down, I'm like, no, I'm not having a seizure. And every time. So finally, I'm just like, okay, let's listen to him. You're having a seizure. He's always right.
Gosh. I was telling Pokey today that I was giving my the prescription to my ex Copray, and he also gave me some that emergency meds. It begins with a C. Hold on a minute.
Clobazam.
What do you guys think it is? What was that?
Clonazepam.
Yes, yes. I
Think
went
that's
through
on it?
5 of those already, and they work. At work, I get the end of the day. I mean, I got the most stress-free job. All day long, I'm doing nothing but giving out samples all day. The end of the day, the last 20 minutes of the day is where it's so stressful you can't breathe. Everybody's trying to get everything done for the next morning when the next crew comes in. Well, I pop one of these and boom, I make it through it. But like I said, I've gone through 5 of these. And today I used I've got 2 lorazepam left, and I used one of those. And I'm like, I gotta stop this, man.
Careful with those. You gotta be careful with the benzos. They can be
I don't want to,
Yeah,
yeah.
stop
And
it. They're
yeah, the
benzos.
problem. See, the
They're so
problem
good
is
at
I'm a drug
stopping
addict.
seizures.
I'm a drug addict, but I've been clean for 20 years. And
Yes, go
I don't
you.
even want to be a ben on them.
yeah, we take these away, right?
It's so mean that they work so good, but you can't have them.
I
It's like
know.
someone has to slap them out of your hands. Like I'm at the point because when I have clusters, sometimes I can tell, ooh, I'm coming down from this, I think. I gave half of them to my partner because like Sia was saying, I'm like, I'm not having a seizure, and then he can just, he knows. He has to give them to me.
Well, you see, that's just it. It's more or less, I'm afraid I was going to have one. Didn't even have an aura yet, but it's like I've been doing this long enough to where I know that one would be coming. Does anybody can connect with that? I don't have
Uh-huh.
an aura yet, but I know the aura is coming. So I figure I better just go ahead and take this now, and then I don't have to worry about waiting
You
on
know it.
it.
It's like
But
yeah.
it's
Well,
you can
it's too convenient, and
yeah,
because
and
I
then
don't
it's a
get high.
problem when you don't know it for sure, and like when you don't know almost, and you take it anyway, then you're
Uh,
in trouble.
uh, but that's almost like, well, uh, well, I yeah, no, I just have to find another way. And now the fact that I'm going to be changing my wife's like right now I'm talking about changing my medication. But my wife was telling me, Tom, if you don't want to change, don't change. And I talked to the people that I work with, asked them about my aggressiveness. I caught it last night. I was going off on one of my coworkers, and I stopped and said, "Excuse me, I'm sorry, I'm sorry, I'm sorry." And they said, "Tom, don't worry about it. It's all good. It's all good." So this morning when I went in, I called my boss aside and I apologized to her. And she says, "Tom, we know it's all good. We know about your medication and everything." So then I told her that I was going to, I plan on changing my meds, and that might cause a bit of problems for a while. And she said, I tell you what, I've got the best people to work for. Because they're like, Tom, you do what you got to do. It's all good. We'll work with you. So,
That's awesome. I'm really happy to hear that. I feel like when one of us wins or has a good situation, we all do.
I was
we
gonna
all
say
do.
that. I was gonna say one of our
I like
success
that.
is everyone's success. But
I love hearing
folks,
this sex stories.
go ahead. You got some yourself? I like to hear a success story.
Always, yes.
I got something here. It says what to expect from neurology appointment. I think I suffered a seizure in my sleep. I'm not sure. I just happened to have an appointment with neurology today. What can I expect to happen? Can they actually fix anything? I have 2 medications that both lower threshold for seizures, Wellbutrin and Latuda. and I'm scared that this might be regular thing going forward. I'm not sure if I can drive. I'm really scared. Does anyone have any experience with this medication? Will they put me on a med that would help? If it's the side effect of the other meds making me have them. I kind of have a headache now. My temples hurt, maybe from the eyes rolling back, and I just feel kind of out of it, really scared. What should the person expect? They said, what should I expect from the neurology appointment? That was the main question.
I'm so sorry. Can you repeat that question?
The question was what to expect from neurology after they just explained everything that they explained.
Well,
Is it their first appointment?
Did not say. It said next appointment.
Is this person an epileptic? I guess not, because this is the first appointment. But I did look up the one drug, Latuda. It's anti-schizophrenic, or it's used to treat schizophrenia.
I know those
Anti
can be hit or miss. Sorry to interrupt you. Go ahead.
What? It's an antipsychotic. All right, go on.
Oh, so sometimes antipsychotics, my therapist wouldn't put me on one. She said I needed to go to the neurologist because they can increase seizures. But if you have post-ictal psychosis, like I get sometimes you can go on one for a brief amount of time, but you don't stay on it. And I don't think we have enough information from this person, but if that's helpful, I would talk to a therapist also, just to keep an eye on you. Yeah.
That sounds like a bad idea to put someone on a antipsychotic because of post-ictal psychosis.
It can work
So
or not. That's why I think they should also get a therapist, just to keep an eye on them. Because yeah, if you have post-ictal psychosis, you might or might not be able to do it. It's really individual, I think.
it
I
seems
feel
like
like
the cure could be worse than you know, the
symptoms.
disease or whatever.
Are you looking up Latuda? Like, I feel like you have some information. Maybe I'm not in my computer.
Yeah, I got it right here. Uh, yeah,
I feel like
causes
I feel
uh, serious neuroepileptic malignant syndrome. I'm assuming that's yeah. That's probably what the person's going for. Suicidal thoughts. They all have that.
Yeah, what about medication interactions too? Keep an eye on that. Sometimes doctors, I mean, you see a neuro every 3 months. Like, I guess that's why I'm saying a therapist too, because mine, for example, knows more about like sleep disorders. And I guess she did a neuro like understudy, and she knows everything about medication interactions. So yeah, I would just get somebody else to in there to keep an eye on things.
One thing, Em, a lot of them aren't in California. They're not seeing neurologists every 3 months like us.
That's true. Like we're very lucky. Like mine is following up just in a phone call, and then I have an appointment in 3 months. So we are very lucky. Everyone should just move here. And I'm on Medicaid too, so I don't pay for shit.
Same here.
California's good.
I'm a Medi-Cal, so I won't pay for shit either.
Yeah, I'm on Medicaid and life is good.
Right, life is good. I like when Tom says that. Life is good.
Yeah.
I know you
Okay,
can say
boys
that.
and girls, I have a question real fast about Excapre. Now, anybody on Medicaid, it says it's $425 for this prescription. Now, I understand Excapre is a fairly new drug. Am I wrong there?
yeah, it's about 6 years old.
And are there generic Excapre?
Not that I know of. It's very hard to get. It's a Schedule 5
Okay.
narcotic,
Okay,
basically.
there's another problem with narcotics, controlled substances. When I get a prescription, it's $20. But I've never got a prescription of controlled substance. So I don't know if I would have to pay full price for it. If anybody's aware of anything like that.
There's no generic, you're saying, because it's new?
That's my understanding. And if it's number one, if it Medicare likes generic. They don't like spending a lot of money.
I'm
Yeah, and
on
generics can be
Medicare and I get it
weird.
for free.
What's that?
I'm on Medicare and I get it for free.
Well, I like that. I think it's
Oh,
Medicare.
I
Well,
also
no, I'm on Medicaid. Medicaid is what I'm on.
Pookie, I have a like off-topic thing, but I don't know what I said earlier. I don't want this on the podcast, but there's the new girl. She's very young, and I think I said something because she fucked off afterwards. I sent her a message, but I don't know if anybody is talking to her, but I just want to encourage her. Like, this is a safe space, and whatever I said, if that's what it was, I mean, maybe she just had to go, but was it a seizure? I don't fucking remember saying it, and I want her to feel welcome here because, she seemed to really be comfortable.
She was having a really bad day today, and I don't know when she was going to finish up her move, so I don't know if she got off because of that.
Yeah,
But yeah,
Lupa had a seizure and everything. She just moved. Yeah, she was having a bad day.
yeah, she had part two
I
of her
don't
move
want to
today.
again, I don't remember what I said, and like Rick said, I seem nervous. I'm like just floating around right now, but I do want to check in with her if I can, just as also she was having a rough day, and sometimes somebody can say something and it just like puts you over the edge when you're in that state.
Yeah, been there. It's like these are good days every time I spend my Tuesdays and Fridays, and the day after it is a good day, then somebody says one thing and it changes the whole weekend.
Yeah, and she said she had borderline, and sometimes somebody especially says one thing and it just like fucks with their brain. Yeah, I just want her to feel welcome. Just a thought.
See what I got here. So what I got now says I knew normal. I had a doctor visit with my new neurologist today. As we went over my medical history since being diagnosed with TLE, I froze once I realized that over the past 7 months, I've had 18 seizures, 2 grand mal seizures, and the rest being simple focal seizures in seizure clusters. It's just crazy. Is this really going to be my life now? That sounds like my beginning. So no, it's
I
not.
read that one myself.
Huh?
I mean, we as epileptics who have been epileptic for a little while recognize that, hey, we're epileptics, we have seizures, we fall down, we get up. We brush it off, go to sleep for a little while, get something to eat, drink some water, and start all over again.
Right.
I like we fall
Yeah.
down and we get up. That's great. We fall down, we get up.
Yeah, that was good, Tom. I mean, yeah, we do our best to try to control it, but
Yeah, but I mean, you can only do so much. Your mind works by itself. Your mind it has
Yeah.
has its own plan.
And there's
Yeah.
some medicines that, like me, I just became, actually, I think me and Ann, we became tolerant to Vimpat. So we have to get on a new medicine because if not, we're just going to keep having seizures.
And don't forget that things do change. I mean, it's not going to be this bad. You know, it can't be this bad forever. I mean, your health fluctuates. You
Yeah.
know, so uh, I can't make promises, but keep in mind things change.
I
Oh,
myself, I understand that. I respect that. I said I fall down, I get up. But hey, I've got a very optimistic
Yeah.
view. Um, sure. I mean, we don't know what's around the corner. They might come up with a cure.
Well,
But
Tom, you're are you you said Adventist or a Mormon?
He's a witch.
Jehovah's Witness.
Jehovah's Witness. So you also have a very like clean, like no coffee, no caffeine. Is that right?
That's Mormons. That's Mormons. Oh, man, I drink so much coffee. No, I don't drink. I don't smoke. I don't do dope anymore. I used to, but yeah, since I became a witness, I've been clean. I live quite a clean life. I don't even smoke dope anymore. That's why I said a little while ago that my emergency meds, you know, I have to be careful because I'm an addict. Uh, I've been clean, and that is because I'm a witness, probably. But besides the fact I was done, um, but I don't know. What was that the end of your question? I'm sorry.
Yeah, I just wondered, you say you don't do anything, but I guess you're expressing more that that's because you know you're an addict. Um, I think people who are addicts know it. But I also think benzos are very addictive and you can just get addicted to those even if you don't have, like Poogie was saying,
Yeah.
other than cigarettes, I just quit doing stuff. It's easy, but I don't know about benzos. I've heard it's dangerous to just stop them. Oh, okay, Jason, we'll see you in a bit.
Yeah, benzos are addictive, and if you're on it for a good amount of time, just stopping them could put you into a seizure. Like
Now, what
I
are
know
benzos?
missing, I'm on it nightly, clonazepam, and I know I'm missing a pill already. I can, like, when I feel it some nights, if I'm late, I can feel it.
Okay,
I,
I don't even feel. I don't feel the razepam. I don't feel the clozapam. I don't feel it. All I know is
It happened.
it happens.
yeah, I was not aware of this information when I started taking Club Onfi. I'm just going to call it Onfi. I don't like saying Clobazam anymore. Um, when I started taking Onfi a couple years ago, I was not aware of the addictive uh,
Right.
uh, attributes. Yeah, I didn't know about all that, but and now they're telling me if I go off it, I could die or whatever. Holy crap! So I keep asking my neurologist, what am I going to do? And she's just
Right. Right.
just do nothing. Don't touch this shit. And
And the pharmacy keeps running. Yeah, I was talking about this earlier. The pharmacy keeps like running down to the last day. I'm like, I need this, and then sorry I yelled at you, but you know, I
I asked ChatGPT to give me a way to dose down because I crush mine up so I can take a very, very little amount. I don't know if that's a good idea, but I don't like taking the full amount. And ChatGPT actually gave me like a way to dose down if anybody needs it. I mean, it's just easy, like simple, like titrating down. I know some people don't trust ChatGPT, but I would marry her in a second.
Yeah, I already told my doctor, like, is there a way I can get off of clonazepam? But like I said earlier, they got me going on Excopri and getting off of the Vimpat lacosamide at the same time. So trying to work two things out is already enough for my brain, to handle. So that's the next step. But at the same time, I'm a little, and I will admit this, I am a little scared of being off of, not because I'm addicted to it, the diazepam, but I'm scared of, because it was the only thing that worked when I had my cluster. So I'm scared of the clusters, you know.
Okay. So when you said crush the pill, it made me think about when Brandon said that he crushed the pill and he put it in water. I asked it a while back, has anyone ever did that? Would it like work the same if you just crushed it and drank it? And he said, actually, I'm not sure if that worked for him because he said he wasn't feeling good today. So, uh,
Is everybody just not? Some people seem to be feeling fine, but like today, man, is anybody else having an increase?
it's hot, but I'm not necessarily getting focals or tonics. Shout out to Nature's Made. Uh, other than that, nah, I'm good. I'm having a good day. Usually these days are good for me.
I
Don't put
worked
this
out.
on, but I
I
had to monitor Annie earlier because she was having auras and stuff.
She said she'd come back as well, and it's almost 9 hours in. I got
She
something
took
here though.
lorazepam, and I guess she's been out. She told me when her daughter got home and everything. So I hope she's sleeping because she needs it.
Angel, everyone needs an angel.
Right.
Angel's a swell kind of guy, huh?
Yeah.
Big old smiles. Are you with us though, Angel?
I
Think
am having trouble on my phone. I
Oh,
am not a Jehovah's Witness. I
I'm sorry.
consider I I am, I do believe in God and Jesus, and I am Christian. I do consider that I am refinding my faith again. I was raised Roman Catholic though,
So was I. Yeah.
but I never believed in the saying, like, my church taught it through fear, and I never liked that because it's like a parent won't teach you to love them through fear, and God won't do that. Oh, I'll be right back. I gotta do something.
Really quick, I was also a Philly Roman Catholic school kid.
Oh, nice. You guys probably knew each other. Probably
Yeah,
crossed
we were.
paths.
Well, I'm from
No, wait.
Philadelphia, so
All you guys are from Philly.
Yeah, we have a lot of Pennsylvania representation here. I'm an immigrant to California.
Yeah.
I'm from Lower Bucks, Pennsylvania, which is right outside of Northeast Philly.
I'm from Lancaster, so I'm a hop, skip, and a jump away from you guys.
You
But there
are,
was
you're up
no
the street.
Catholicism. What?
Then you're just up the street.
Exactly. I'm on
Lancaster,
the,
yeah.
what's the highway there? I don't remember. Does anybody remember?
No, that's been a while. 101. Oh no, I was gonna say 134. That was Street Road. That goes up to Doylestown. No, I
All
don't
I
know.
remember is the Jersey Turnpike. Was on that a lot.
That's the 176, right?
So
30 years since I've been to Lancaster, so
Oh,
how many
good
years?
gosh. It's been
Yeah, if you
40
want some
years since I've been
cocaine, you want
back
to run
there.
cocaine, it's a good place to do that.
Lost an elbow in Lancaster.
I've never been to Michigan before. I mean, like the farthest I've been to is like Tennessee and Kentucky.
Furthest I've been from where I'm at is New Jersey, and that's from one coast to the next.
That's it,
Both
3,000
water.
miles away. Oh,
Yeah.
is that just by air?
Yep, by air.
Okay, so you've been to California and New Jersey.
I've been to Atlanta. I've been
Okay,
to
Georgia.
I've been to New Jersey. I went to Detroit.
Michigan.
But these were all layovers. I didn't see the town.
Okay.
Yeah, so I've been to Detroit, Atlanta, and I've been to the airport in Philly one time. But otherwise, you know, Delta Sky Miles for flying to New Jersey. It's a lot of sky
I
miles.
lived in Philly, I lived in Jersey, I lived in Atlanta and Savannah, I lived in Phoenix, I lived in Arizona, I lived in
Oh man.
San
man.
Jose, I lived in Portland, Gresham, and Vancouver,
Yeah,
Washington.
nomad.
Just a little around the block.
Move around the world. I have not moved anywhere out of California. I've been in the California Bay Area for 35 years and 10 months.
Tom is truly a pioneer.
Right. Yeah. I got something here. It says, do you remember anything before your seizure? I have been having a pretty strong aura today, and I'm really scared of not only having seizure itself, but specifically the before period. As it's happening, I've had 2 TCs, but I wonder if anyone remembers the moment leading up to the seizure. I imagine I'll look it. I imagine I'll know it's about to happen, and it'll be really scary. I had my second tonic-clonic last week, and I don't remember a thing before or during it. The only ones I remember is the ones where they told me it's a partial, complex partial, and those are the ones where I'm awake having a tonic and kind of just can see and feel everything that's going on, just not in control of my body at that time. So, yeah, I've been through that, but that's the only one I can remember.
I remember before a seizure. After a seizure, I could be foggy for a couple days.
Yeah,
And
sometimes
I'm
I
sure you
can.
remember it all lot, but before a seizure, I'm pretty coherent.
Yeah, it takes me a minute, but it'll come back to me. I'll be like, okay, yeah, I was sitting down there. It'll come to me. But yeah, I see what you mean. Before the seizure, not much, but after a while thinking about it, it'll come to me. Um, it says, did I have a petit mal in my sleep? Hey, I have a familial bilateral temporal lobe epilepsy with rare secondary generalization. I am diagnosed as refractory, and just recently my seizures have come back and worsened since being on 3,000 milligrams of Keppra daily and 400 milligrams of Vimpat daily for 6 months. I woke up about an hour and a half after I fell asleep and saw that my bathroom light was on. It was off before I fell asleep, and then my electric toothbrush in my bathroom was on and in the sink. But I asked both my mom and sister if they'd come down and around at that time, but they had already been asleep. I know some people do weird stuff during their seizures, so I'm wondering if I had a temporal lobe seizure while half asleep, and then when I woke up is when I became fully conscious after having one. I also usually throw up after mine, so I'm wondering if I vomited and then brushed my teeth while half conscious. Has anyone else had something similar to them happen to this? Something similar happened to them. I don't have the temporal lobe seizures. I mean, seizures. Anybody?
I'm curious about temporal lobe because it seems like that's a lot of people's diagnosis.
That's
And
mine. Well,
yeah,
that's what I was told. That's where my brain surgery was. Right temporal lobe, right here.
I think we had a question earlier for a resection. Is that what you had? We wanted to ask you.
What's that? Me?
Yeah, there were a couple questions about surgery. I think resection was said. It was right before I had a lot of clusters,
I've
so
heard of that.
I don't know.
Yeah,
That's
brain
not what you had?
resection. I think I asked Rick too, and
No,
Rick says
my incision's this big. I mean, that's a dimple in my head. So it's about the size of my thumb. So if I understand a resection, that's like taking a big chunk of your brain, right?
Yeah.
So mine, I believe they put a mesh on my brain, and then I was tethered to a wall for a few days, about I think Tracy said 6 or 7 days, where they took me all my medication till I had some seizures. Then when they figured out where the seizures were coming from, they removed a chunk of my brain, which is about a thumbnail size. Um, that's it. So it wasn't any big whoop-de-doo chunk of meat.
That's something. It says, confused why my neurologist thinks these are non-epileptic seizures. My neurologist thinks these are PNS before, during, doing any test, but they are ordered. I started getting seizures around like a month ago. First, it was a few a day. First, it was a few a day, and then it peaked to 50 a day, and it's back to around 10 a day. I went to the doctor, and the hospital and the neurologist said that they thought they were focal and started on me lamotrigine whilst I wait for my official neurology exam. I usually kind of zone out. I can sometimes tell someone is speaking, but I don't know what they're saying or what is going on. But sometimes I lose complete awareness and I don't know what happened. People describe that I stare blankly with my eyes open for like 10 to 30 seconds and my right arm twitches slightly. I come out of it confused with a really bad headaches and tiredness, especially when they cluster. I don't respond to people talking to me or in pain. I have injured myself during them. My pupils get big and they do not respond to light. And I get a really sharp pain above my left eye and right before it and feel weird. But when I had my official appointment, he said they are PNES because epileptic don't have awareness, but I thought focal can. I've been chilling recently too. Like I haven't been stressed, and the only trigger I can identify for the seizures is heat and standing up. Stress is never a factor for my seizures. I'm waiting for an EEG and an MRI, but the neurologist thinks PNES and has taken me off the lamotrigine and the last doctor put me on. Does anyone's focal seizures look like this? I'm
I'm
not. I'm
sorry.
not.
I had to do something. Could someone put in the chat the symptoms?
Oh, wow, that's a lot in the chat. What's going on?
Yeah, that's a lot. I'd have to
Or
go
also,
in.
do we know if this is a woman? Because I feel like that's an extra hurdle to get over, and I don't know what they said their symptoms were.
Yeah, I lost a lot of that. A lot of that went over my head.
I would have to assume it's a woman because why else would the doctor say that? The PPNES. Apologies if I got that wrong.
What the doctor said it was psychogenic. Is that what that is?
No.
Good for epileptic.
Pookie, did the doctor say it was
The PNS
uh,
is, I think, like psychogenic.
oh, it is? I think I said the wrong letters.
Oh.
No one
I may have got
remembers and no one knows.
yeah, I don't remember either. I think I may have totally gotten that wrong. So
It's late for you guys.
I got
Yeah.
oh no, that's really long. I'm not going through that.
yeah, start writing stuff down.
Pookie, you can send me the link and I'll throw it into ChatGPT for a summary.
I've left that one already, but I got something new, and you guys can answer this because I've heard quite a few of you guys say deja vu. So this says deja vu, the difference between normal and epileptic. Hey, lovely people, how the heck does one distinguish between deja vu and from epilepsy? And normal deja vu. I get deja vu frequently, but it isn't accomplished. I mean, it isn't accompanied by symptoms. Does this sound familiar to you?
I'm not sure what's going on, man.
Can you repeat that last part real quick?
I get deja vu frequently, but this isn't accompanied by other symptoms. Does this sound familiar to you?
Yes. I don't know how old they are, but as a kid, it actually like used to disturb me because I would get so focused on the past and I thought it was depression, but it doesn't last. It didn't start with the bad feeling. It was just like almost uncontrollable obsession. But as I got older, it was like this crazy, almost choking feeling. So if you're getting it over and over again, that's what prompted me to not go to the doctor for 15 years. I would go see a neurologist and stop sleeping and get an EEG. Stop sleeping before the EEG and yeah, try to have your triggers there so you can check this out because you want to get that under control. Don't ignore it. And if you're a woman, take someone with you to your appointments. If you're having it this much, I would definitely get it checked out. That's not normal.
So the next one says right eye closed and fluttering after seizure. Has this ever happened to any of you? Sounds like something's happened to me. My left eye was fine, but my right was fluttering and would often be glued shut and felt like it was numb for around 15 to 30 minutes after the TLE seizure. I've had the one where I feel like both eyes are fluttering, but not just one. And I never understood what it was about. And isn't happening too often to where I can explain it or get too much of a feeling for it. It's like I just remember it, but I don't know what it feels like because they're so far apart.
I can't
I
remember anything like that.
I have that. That's like my most fun thing my eyes like to do. Somebody actually named what it was, where one of your eyes goes, it's my right eye too, goes in a different direction. And they said they went to an optometrist and got glasses, and I think it helped their seizures. I don't know why. Um, but the funky right eye, get a nanny cam and just show your neurologist. I think that will help. That's what I did.
Can I ask something about deja vu? Deja vu. I mean, I've heard this for years. People that get deja vu before a seizure or after a seizure or something.
Um,
I've never had deja vu.
Me either. Some people say the same thing as like an aura or something. I've heard a bunch of different stories. I don't even understand what it's about at this point. But someone
It's
told me you also get impending doom, and I've never
Yeah, I
heard.
don't know what that is either.
I mean, yeah, I'm not
um
saying I never heard of it, but I never got a big story of anybody explaining what it is exactly.
I feel like Kevin also might be able to explain this, but what happens is like I'll remember all of the sudden like a almost true memory, but almost like it's happening in a dream, the memory, and then you kind of, if you get the epigastric rising where you feel this like you're going on a roller coaster, but then right after that it's like almost, it's a disturbing memory, it makes you really uneasy, and then sometimes that's followed by fear. That's what mine would feel like, and then the euphoric ones kind of follow that pattern too, like you feel intensely good all this.
Wow.
I used to get a lot of sensations with seizures that I don't get anymore. I used to just get a lot of bodily sensations that I just don't get. I used to get, like someone was talking about spine tingling the other day. I don't get that. That never happens anymore. Like I feel like a lot of nerves are shut down now, and never get deja vu anymore. Used to get that all the time, just like in general. But I'm sorry, what were you saying, Em, about the uh leading up to the seizure? Uh,
Um, I thought maybe sometimes when you describe your seizures, they sound similar to mine. So, you get deja vu right before yours as a sign.
mhm. I would get more like a like a physical panic, more like since everything's like you know things aren't working in the body. I'm sweating and my cognitive function isn't working. I can't, and every time I kind of try to concentrate, I start to have twitches and twitching a little more and a little more, and then I have a grand mal. But it's been a long time since I had a seizure, so you know, I don't really remember it all. I'll ask someone who saw me have a seizure, and I'll report back. I'll write a good report.
Okay,
Thank
we'll file
you.
that
That
away.
would be nice. Well, I wanted to add too, there's something that can be happening where I would recognize strangers over and over and over again. So I think it's an overactivation of a bodily symptom, or a bodily, like not the limbic system, but one of those.
Hmm.
Okay, got one here. It says inability to drive. I'm currently in the process of looking for a new job. Due to the company I work for is downsizing, not being able to drive was no issue there, as I always worked with somebody else that could drive. And my boss was aware that I couldn't drive, nor was I able to even learn. It seems almost every job that exists require a full UK driver's license. Put a such I feel put a such a disadvantage over something I have no control over. Something will come up, but at the moment, I'm having a pretty rough time. Can you help me?
No, but I
Can't really help you.
agree.
It's not like I can
Yeah,
tell you how to drive.
I wish I had the ability to help because if I could do that, I would be worth a whole hell of a lot of money. You know? 'Cause
Maybe
I
back to
can't tell
joint
you how
life.
many posts I read every day about somebody wanting to drive, need to drive, is going to drive, being an epileptic, just crashed their car and is wondering how they can get around. Um, the police knowing that they're epileptic, so they'll take their license. I am so sick and tired of hearing about people driving knowing they're epileptics.
Right.
I'm sorry. That's a pet peeve of mine.
Oh, that's a good one. I'm gonna say that now. It's a pet peeve of mine.
I'm sorry. I just don't get it. I mean, I as a Christian, I appreciate life too much. I appreciate the fact that my God has given each and every one of us life, and it is something to be treasured. And how in the world could somebody be that self-centered, that egotistical, that they could go ahead and get behind a wheel of a car and possibly kill a child, an adult, um, anybody,
An
and
animal.
anything. Yeah, I just don't get it. I don't think that something like that should even be allowed to be posted.
Mhm.
I mean, because it is that asinine, if you ask me.
I appreciate that. That's a good thought. And on that, I have to go. It's well after midnight here, and
Oh,
I'll see you all Tuesday, hopefully.
all right.
Hi, Kevin. I hope to
Oh,
see you
Tuesday. Am I
Tuesday.
working Tuesday? Tuesday. What's today's date?
The 26th. Oh,
Oh,
27th.
oh, I'm not
28th.
working. Good, I'm not working. Wow, is it really that late already?
Oh yeah. All
Wow.
right, everyone, take it easy.
All right, be good.
All right,
Good
Kevin.
seeing you again, Kevin. Yeah. Yeah, so all my hairy schedules should be gone for a while. I'm back on my regular schedule. Tuesdays and Fridays should work for me. Gosh. I miss you guys so much.
We
We
miss you
missed you,
too,
Tom.
Tom.
I mean, my association evolves around the few people I work with and the brothers and sisters in my congregation and you guys. And I feel so good with you guys because we can just talk about ourselves, what's going on with our epilepsy. Now, these are things that what we talk about right here isn't something I could talk about with my Christian brothers and sisters or these people I know at work. And this is our lives. This is a part of us that no one else knows. So this means
We
a lot to me.
we know it and we feel it.
So here it says creativity and epilepsy. I'd like to hear from others, especially those who experienced their first seizures in adulthood. Do you think epilepsy awoken a creativity bone in your body?
Um,
The first comment says, I wish. Mostly just fucked up my life. So yeah, go ahead.
I
Top that.
You
I
know
think it does.
what? I can say that sometimes after I have a seizure, I can sit down and draft for hours. That's that's one of my outlets. I
Yes,
was
my
a
instant
drafter
immune
for a number
system.
of years and I loved it.
Yeah,
Drafter designer. And I can just sit down and draft nothing.
yeah. I
But
feel like if I'm not sleeping after a seizure, for some reason I'm doing something. My mind is wandering. I'm thinking about a million things I could be doing, and the thoughts are just flowing. But if I go to sleep, then I usually wake up the next day. But if I'm up, I'm always like have the urge like let's start doing something. But I know I can't too
yes,
much. It's like I know I want to do this. I feel like doing this, but I can't. But I'm still sitting there thinking about a million things going on.
I have to admit I truly feel the need to be doing something, even if it's a Sudoku puzzle. I have to have my mind has to be working at all times because otherwise I'll just go stagnant. I'll go up. I'll just stare off into nowhere. But if I've got something to do, or if I can make myself uh, find something to do, I'm doing it because just being stagnant. Actually, you know what? That's why they like me at work. A lot of people just stand there and hand out samples where I'm calling people over. Hey, come on over. What, you want to try this? No, I don't like it. Do you ever try it? No. I said, well, how are you going to know if you don't try it? Come on over. It's a sample. Just try it. They'll come over and they'll try it. Hey, that's not bad. Hmm. Well, it's on sale. Take some. And it's Costco. You don't like it? Bring it back. You know. That's
As a
why,
salesman,
that's what my boss likes about me. He says, well, I'll get people to try stuff, even if they think they don't like it. But I say, hey, you don't know unless you try it. Now this way, you'll be able to say, yeah, I do like it, or no, I don't. Or say, you're gonna kick yourself. You're gonna kick yourself the rest of the day knowing that you had a chance to try it.
I was with well no, I wasn't with my aunt told me that when my kids were at her house, they were like, can you take us to Costco so we can get some samples?
Yeah, yeah, I hear it all the time. My
That's
kids
what,
wanted the kids were bored. It was raining outside, so the kids wanted to go to Costco so they could get samples.
yeah. They got used to grocery shopping with her. They're like, can we go to that one store where they give us the samples? But
I
I
want
got
some free
something else here.
samples.
Huh?
But I do think the epilepsy creates um I do feel like it does create because we get so I I don't know how to say it. A lot of us become so inner person. I don't know, but that we just have to spend that energy doing something, and we end up creating stuff. And I did ask that question before, like Pookie did all the brainstorm stuff. Like I wanted to see the rest of the group, the rest of the universe to see what type of arts they do. And a lot of people are writers. Some, do music and stuff. Some do art, some do digital art. And it calms them down.
Rick, do you do the
Everybody
brainstorm?
has their own art.
Rick, do you do the brainstorm?
I do not. I read it, but I don't do it.
Yeah, who does it?
What do you mean by do it? I mean, I
Toaster.
read it, but what does that mean? To
No,
do
no,
it?
no, no. Who creates it? Who's the
I made the characters. She made the story.
Oh, you did? Em?
No, me. Toaster made the story.
Oh, and who writes it?
Her. I
She
just made
writes
this.
it?
Yeah.
Yeah.
Very
And it's
talented. Very,
amazing.
very talented young lady.
Yeah.
Very
Every day.
I just hope she
uplifting.
doesn't pay you off.
She
What was
enjoys
that?
getting that creativity out.
She
And I
does.
love it.
Was
I
she
love
on
that she
today?
loves it. Say that again?
Was she on today?
Briefly.
Yeah, briefly. She was in bed already.
Yeah.
How's mom doing?
Um, she was here.
She seemed
Was she?
good.
How's she feeling?
Yeah, she seemed good. Happy. She was talking regular.
She was down in the dumps, wasn't she? Wasn't she ill? She had some seizures and wasn't doing well.
I think it was like maybe a week ago or something. I don't know. I'm totally unsure. I can't be 100% sure, especially this late. No, I'm playing. But yeah, I think she had like a seizure or something this week, but she's been all right.
Good. I'm
She's
happy to
been
hear
telling
that.
us she's bouncing back and she was coming. No, it's not time yet. Okay, I have one now, and it says what to do nighttime seizures when sleeping alone. Oh man, this is very long. And then Anne says in the comments, get a nanny cam, but that's too long to read.
You know what? They have to be a PDF file, wouldn't it? I'm thinking if you could like cut and paste it out into Word and then have it read it out loud.
Oh yeah, I could actually.
But you're on your phone, you can't do it.
I forgot what the app is that I have that does that. But I got something else. It says switching to night shift and seizure scare concerns. TLDR. I switched to night shift and almost had a seizure today after over a decade seizure free and well controlled on medicine. Anyone else been in similar situations? Just had a seizure scare after over a decade free. I'm a 26-year-old male. Have just recently switched to the night shift. My hours are wildly inconsistent, ranging between 10 to 6 or 2 to 10. And I can't get into any kind of sleep routine. Obviously, I have seizure history, hence posting here, but it's been well controlled on a hefty dose of trileptal slash oxycarbazine, carbazepine for
Yeah.
over a decade now. When I would have seizures, it would always be my whole body would switch between cycles. With this new schedule, I've been getting sleep when and where I can, usually 1 to 2 blocks of good sleep and a nap here and there. Today, though, I had what I felt like was a really close call after an hour-ish nap right before my 12 a.m. shift. I felt like I was about to start seizing imminently. I jumped out of the bed and ended up not, but it was extremely close. Closer to it than I've been in a long time. I hadn't taken my nightly dose of medication yet. Question being, has anyone here ever been in a similar situation with night shift switch? How did that affect you? And how did you make it work? So I did that. I worked night shift from 2 to 7 or 2 to 8. Yeah, it was all right. And then I started having seizures. So yeah, that happened. And then my family was like, okay, no more seizures. I mean, no more working for you. because it was in a warehouse for, I forgot what company, maybe Amazon. No, FedEx. So yeah, did that, and then my family was like, "No, you're not gonna work anymore. Yeah, you're having seizures, getting stitches inside your mouth and stuff." So that was over with. They were tired to see me beat up.
Honestly, I think working the night shift was best for me, but when you're changing your routine, your mind needs to catch up. And yeah, it's gonna throw it all off. So it's it's a it, it's a weak spot for your mind. So it's gonna happen. Um Seizures are, I'm trying to figure out how to say it, like basically you're more susceptible to seizures. It's the same thing when you're changing pills. Routine is changing, so you're going to become more susceptible to the seizure.
Yeah, so actually, Jason, you there? Jason worked a night shift at a club. How's that?
Yes, Jason is there.
I'm there.
Um, did you have any seizure concerns when you were working a night shift?
Yeah, I had concerns when I was working like at a nightclub. Like there's one time I worked at Baja's and like there was like flashing lights and there's like flashing lights and I tried to go to the bathroom like and like try to sit down like in a fetal position and it couldn't work, so I just passed out completely and they rushed me like to the hospital.
So has the like nighttime overnight shift bother you? Like specifically from the working at night?
I mean like I mean like it doesn't bother me. Like it doesn't bother me. It bothers me like when there's like too much lights everywhere.
Oh, okay. But it's a nightclub for you. Sounds like a fun job though.
Oh yeah.
Brain stuck on one word after seizure. So I had my first bad seizure tonight after being cleared for over a month. I thought I was done with this, but does anyone's brain get stuck on repeating one word after a seizure? Mine is soup. It just keeps repeating in my head. Oh, Nanny Cam, you're in the comments. Tell me about that.
What did I say?
You said, is this related to seizures? My whole life, I'd get phrases or two words or songs stuck in my head on repeat. Used to drive me bonkers. I stopped with AEDs. I assume AEDs were helping undiscovered Tourette's or something. LOL. You remember that?
No, but I'm glad you read it. That sounds like me. Yeah, I don't know if it's related to seizures, because it stopped with lamotrigine, and that's a mood stabilizer, so it's hard to tell. I think that it seems to be a post-ictal pattern of emotions that happen quickly and then end. Yeah, and songs too. I don't know if anybody has gotten this, but it used to drive me nuts. Like I would just get a song stuck in my head when I wake up, and that's why I think it's seizure related because I have nocturnals. Tom, can I, or everybody, since no one can relate to that, do you know, or you had your temporal lobe removed?
Yeah,
Yeah, I guess I assumed that that was a temporal thing, but I don't remember why.
got me. I'm sorry.
This is one I'm interested in. It says mesial temporal sclerosis and quality of life. I've heard of that mesial temporal sclerosis
I've never heard of
before.
it before.
I don't know what it is, but I think I've heard of it.
That's what, you know what? Have you guys ever used Google Copilot?
Yes, it's on my computer.
That is the most awesome. I mean, you can carry on a conversation with that guy or woman. Mine's an Australian woman. But
Yeah,
seriously, I mean, you talk to it.
I haven't really used it. I use the Chat GPT instead, but yeah, time to time I do that. But yeah, let me read this. It says, "Hi all. I was diagnosed with MTS late last year. I've apparently been epileptic for some time, but undiagnosed. I understand that MTS is degenerative, 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 and that is my lifespan will likely be affected. I'm 30 years old and I'm coming to terms that half of my life has already come to pass. I am on a surgical wait list to ablate my right temporal lobe that will hopefully stop my seizures. I understand that the cognitive function I've lost is gone forever, but I guess my question is if I have this surgery, will I still continue to lose function? Or will I spend the last decade of my life not knowing who I am, was, or able to recognize my family? Anybody had any surgeries that? Okay, go ahead, Rick.
So technically, I have scoliosis of my temporal lobe because of the scar tissue left over from when they removed the abscess. Um, Still can't answer the question because that's something that we don't know. That's something that, a qualified neurosurgeon would be able to help answer that. It depends because if there's a lot of scar tissue in there, cleaning that up might help. But it's really one of those things where, you got to work with your doctor team, your care team on that, I think.
Does anyone wake up terrified and confused? For the past few nights, I've been waking up in the middle of the night terrified. I wake up with an aura but no seizure, and I'm confused about my surroundings for a bit. Does this happen to anyone else? It's happened before. Um, doesn't happen all the time. And it's usually like a dream that I'm trying to get out of. And when I wake up, I'm still scared, wondering if I'm still in the dream or not. Been there, but anybody else got anything for that?
No.
Mm-mm. No.
It says this is a rant.
Yes, I have something for this person. Get a nanny cam, go to your neuro, show them, and if there is something, request a sleep study. Um, I don't know how they know they're having nocturnal seizures, but it could be like night terrors. I know I've
Yeah.
waken up in like a panic and not even knowing where I was when I've been in my house. But I was also a bit crazy in my 20s and I spent a lot of time in other people's houses waking up.
Night sweats and everything. Very vivid dreams.
Okay. They've all been on a few different medications. This one says changing medications. Have any of you changed your medications with any success? I've been on Keppra and Vinpat, and I was wondering if I could change medications or try different combinations. What happens when you drop one medication for another? I see my neuro next month and plan on asking the same questions. Uh, I was a child, so I switched not by choice. And then my neurologist was another situation that wasn't by choice. He was like, "You're still having seizures and you're taking this? Well, take this now." So I didn't switch by choice and I didn't tirade down or anything. He just like, take this. And I took Lamictal, took it home, and I've been on it ever since. And it's gotten better in due time, but it's gotten better over time. This is what everyone can answer.
Yeah, as a
I was
minor, we don't have a choice of what we have to take. That's the parents' choice. We just take it. As an adult, we can research it first and then say yes or no. Um, but if the doctor ever tells you just stop, slap him. Unless you're having like some allergic reaction, slap him because you shouldn't just stop a medicine. You should be lowered
Weaned off of it.
slowly. Yeah, weaned off of slowly. So to prevent some side effects, if they're taking you off, you're gonna get some bad side effects.
Yeah, when I did my switching, I don't know why I didn't think about asking him to like titrate down. I just went straight into it. I like had those pills still, and it was like, well, start taking these. It's not working. Um, yeah, so extremely exhausted. Curious, do others get extremely exhausted or tired after a seizure? I had one recently, and it wasn't caught by anyone around me, but the skin on my RNS. My mom and my sister both said something before I went back home that I slept 6 hours and it made me think I had a seizure. Turns out I did. The tiredness isn't new by any means. It just made me want to ask others after hearing 6 hours and then sleeping for a long time today, which I'm sure I'm not alone at all in feeling that way. I get nervous when I take a nap and end up sleeping for 4 hours. That's not a nap. That's falling asleep. I can't help but think I had a moment when this happens. Starting Tanasamide tonight. Already take Xcopri and Lamictal. Nervous about that too. Those 6 hours were probably 3 hours after waking up from them. Is this all right? Then I'm extremely tired. Is it all right?
Probably not.
I mean, it's something you
6
can't do.
hours. 6 hours after your sleep is 6 hours after feeling like you had a seizure. Most likely sounds like you went through a grand mal.
Right? Your whole body feels like it's been hit by a bus. Yeah.
Yeah.
Yeah. Well, that's a definite grandma.
Yeah. And they said, oh, do everyone else get extremely exhausted? Was another question.
Yeah.
Yeah, that's just about
That's
how it
part B.
goes.
That's part B.
And then we try to fight it like M's doing, just fighting it. You're strong. You're fighting it over there. I see you.
It's the
Be a
cat
man.
rats busting up this cluster.
Write it out.
Be the man. Be the man.
Thank you
I'm
guys.
watching
You
it.
guys are
Yeah.
the best. Oh, I have one that I can actually read now, and it's kind of fun.
Oh, go right ahead.
Please.
Okay.
It,
Where
it
is the weirdest
better
place
be
you've
safe
had?
for work.
Wait, go ahead. I think I
I
seen this
know
one.
Angel was about to say something good.
Go ahead, Angel.
All to M, it better be safe for work.
What was that?
It better be safe for work.
It is. It is. I'll keep that to the chat. Okay. Where's the weirdest place you've had a seizure? We all know those moments suck, but having one in a weird random place makes the story better. I was 19, didn't get enough sleep, and I had one in the parking lot of a 24-hour donut shop with my friends. They stopped being open for 24 hours the next month. So yeah, weirdest place.
That was yeah. My weirdest place was at work in a bathroom stall. I went there so because I felt a seizure coming on, and I was trying to find a safe spot to have a focal, hopefully. But
Mine would be
didn't turn out that way.
mine would be I woke up in a hole because I was digging the hole and I woke up in it, and the ambulance was trying to help me out of it. I was all flimsy, like and yeah, they were just trying to lift me and wondering why my legs weren't moving and stuff. And they were like, Danielle, are you awake? Hey, hey. And yeah.
My weird one is still at my best friend's. I was taking a shower. I was taking a shower at his house. Yeah, he could bust down his door and I'm completely naked. Yeah, yeah.
How did he know you had a seizure?
It was a tonic-clonic seizure. He heard his wife heard us fall, and he came running up and busted the door open.
That's a good friend.
Right.
You know, I had a lot of years where I don't even know. I mean, I went without medication. Um, so I'm sure there's a lot of stuff that happened.
That's what I was thinking. Is I've had a lot of situations that I just don't remember. I remember those situations, but not remember how they panned out or afterwards or whatever.
Right.
Oh, another weird place. This might have been the most embarrassing, and it wasn't even in front of adults. It was in front of little kids. I was working at a after school program, no, a summer program, and yeah, we usually walk the kids from one place to one park. There's several parks in the town I'm from, so we have a drop off location, and we walk to the different parks different days of the week. And I happened to have a seizure. We were giving them lunch, and they said I just kind of dropped the pizza, and then I was just standing there. They were like, "I have the box." I dropped it, and then I was standing there, and they were looking at me, and then I had a seizure, and then yeah, that was the worst. Like having in front of little kids, like they didn't. Like I heard they weren't traumatized or whatever. They were just kind of confused because they were like under 10, but my coworkers were the ones that were scared.
And you see, there you go, Pokey. I'm 60 years old, and I don't remember all that time. When I was a kid, and even my teenage years, when I had seizures, I don't even remember them. But I was running around with friends, and in my teens, I was getting stoned, and we were drinking, going to keg parties. I don't remember any of that stuff. But
You
you
never
know,
had
I
a
was
seizure at
having
the
seizures.
parties?
What's that?
No seizures at the parties?
That's what I'm saying. I don't know.
Oh,
That's times in my life I don't remember.
yeah.
But I mean, I was having grand mals at that time.
Yeah, I think my long term is pretty good. My short term is just it's over. It's non-existent.
I just have just bits and pieces here and there
Yeah.
of my history.
I I went through a bad divorce, and I had just moved into this place with all women, and it was really great because they were all supportive. But one night, I at this point was ignoring the fact that I needed to go to a neurologist, and I had been drinking, and I forgot my key. I did have my key, but I thought I forgot it. So I had a seizure, and my roommate came out. I decided in my head, I was like, well, I'll just sleep in front of the door because that made sense. So I was literally just sprawled out in front of the door of our apartment. And one of my roommates came out and she looks at me and she was like, you know, you can knock on the door. And I hadn't even thought of that.
Hey, that's a good one. You can knock on the door. Sounds like possible phase.
I fell asleep under a tree right along um Bristol Road and a couple doors up from my brother's house. And a cop drove by, I guess he was a friend of my brother's, and saw me, and he walked me to my brother's house. And the next morning I woke up at the dining room table and everybody was just looking at me like, what were you thinking? You know, so I don't know if I had a seizure and I passed out right there on the side of the road or what. I mean, there's another situation where all of a sudden I wake up and here I am. Where was I? How did I get here?
I remember a situation like him. Now, when you said you woke up sleep by a tree, I remember having a seizure at work, and then I went to the hospital, and they said, "Are anybody going to come get you?" And I was like, "I don't know who I could call." I could have just called my dad, but I wasn't thinking about it. I was in the popsicle phase. So they were like, "You can stay till the morning. Um, call someone to get you in the morning." I ignored that. I think I went back to sleep, and in the morning they let me go. And I told them someone was outside and someone wasn't. And I think I just walked home. It was like 3 miles. And then I just sat in a chair, like this little stool that was away from the house a little bit. And I never knew why. Like Im said, you could just knock on the door. I did not knock on the door. I sat there until the sun came up because it was 6 a.m. And I'm not sure why to this day. I was just like, I waited till 9 to. I think my dad came outside. That's the reason I went in. I think I might have still sat there just in that possible phase. Left the hospital without someone coming to get me or even knowing. Yeah, I had a lot of bad ones alone or like at work.
You
And you
need
see,
a
I forgot, I
postictal
complete,
babysitter, it sounds like.
Yeah, or nanny cam.
Just take it with you.
Right. I need to turn on my location so someone can see when I leave home. Um,
I like to
Every,
say we need seatbelts on the couch, so you literally can't just wander off for 3 miles.
yeah,
every
I got
time,
one when you said need a babysitter, you said, right? A possible babysitter. This one says seizure watch for a 6-year-old. My son has epilepsy, has tonic-clonic seizures, focal absence, and drop attacks. Do you think a watch would be helpful for alerts for these? I'm worried he'll have one in his sleep and won't catch it. If so, which watch? Oh, I thought they meant like have the child on watch. And a seizure watch for a kid, it's up to the parent's discretion. I think Sia would
but
have said
seizure
take the
wise,
Apple
isn't
Watch.
that like that goes off when you fall, right?
Yeah, I think so.
I mean, I
When
don't think
when
there's
your
any
heart
other
rate.
way. I know they've got something over in the UK that they've got some sort of um device that picks up on seizures. It's not yet approved for the FDA, but it is available in the UK. But as what you're saying is a watch? Did I hear that right, Pokey? A
Yeah,
watch?
it's an Apple Watch. It has like
Yeah,
a
yeah.
metal
And I
thing on
think,
the bottom so it can keep your blood rate and all that stuff.
you're talking about
Yeah,
just okay, all right. Oh, all right. Tracy's got one of those. Yeah. All right.
smartwatches.
Oh,
I
I
got
have
some.
one. Oh, do you want to?
Yeah, I got one and I don't use it. The
What
app
was that?
was so. I said I have one and I don't use it, but the app was so confusing that I just gave up on it. This one says, "Is fasting a good idea?" I take Lamictal XR, Keppra, and Omphie. A family member is practically making me fast, and I once read that it increases your risk of seizures. I don't want to fast because of that reason. Is that true? I always hear people say eat with your pills. Not that I do that every time, but I don't suggest fasting.
Why are they being forced to fast? If this is a young person, that's very worrying.
Yeah, I don't know.
They're being forced to fast before they take their meds.
No, they're just being forced. It says a family member practically making me fast. And I once read that it increases your seizure risk.
Yeah.
It says I don't want to fast for that reason. Is that true? Um,
So is there an age here?
nope. 4 lines. It just says what medication and the family said to take it. I mean
I
to fast.
I wish that that subreddit encouraged people to say how old they are. And like just some general demographic information because it's so hard to address this. It just comes across as some sort of abuse, but it's hard to give advice to somebody if they're 16 versus if they're 24 living at home.
Where's that subreddit coming from?
Epilepsy.
Epilepsy? I know I read a lot of stuff in epilepsy that can I ask everybody a quick question?
Go right ahead.
Okay. I read things, some of these subreddits or over in Yahoo, these epilepsy forums and such. It almost sounds people are coming up, they're reading about people with epilepsy and um, um,
Like over identifying, maybe.
yes, exactly. Exactly. It's like they're making this stuff up. And it's like, I mean, there's no way to say one way or another if they are. But I mean, some of it is just too, it's like, why in the world would you even be asking a question like that? You know, and it frightens me that people find this comical. Or if they're so insecure that they have to come up with something like this so they can have somebody to converse with. I don't know. I don't know if that makes sense to anybody, but it's just been something on my mind that when I read this stuff, I have to stop and think whether or not it's real.
Yeah, I agree with that. I feel like some background information would be helpful here. And I'll
Uh-huh.
say, like, as somebody who was told in their 20s, and also me and my sister had absences and we knew something was wrong. I did lurk on the epilepsy subreddit because somebody had told me what I was experiencing with seizures. And then I did some research and I thought I need to see a neurologist. And my first EEG was abnormal. So it didn't turn out to be wrong, but I hear what you're saying. Like sometimes it's just like somebody's having a panic attack almost, and they're like saying all these things like, is this a seizure? Is that a seizure? And it's like, maybe do some research first and then get a
Yeah.
consult to a neurologist.
You know what? I do answer a lot of um these comments or these posts, And a lot of times I'm asking myself, Tom, was that really necessary? It's like, excuse me, but this is not a place to be asking uh questions. You need to be talking to a doctor about something like this. We are no more doctors than the other person you can talk to on another uh Facebook page or whatever. You know, you need to go see a doctor. We can give you experiences that we've gone through, but please do not ask for medical advice.
Yes, yes, yes. I think also there must be some like kids hear about things and they experience things once a lot of times or twice. And then, that things are hard in the world, right
Yeah,
now. So people are stressed out. But for example, I think people with addiction know in their minds that they're addicted.
right.
They feel it. And for me, it was like I knew something was wrong. I just knew it. Like it wasn't a flurry of feelings I was having to go research it. It was like a long pattern. And that's hard when it's kids posting because how long has it been going on? What are their
Right.
parents doing about it? But if you're older, I do think you see a pattern, you should definitely see a doctor and be quite insistent.
Okay, I got one for you guys, and this is specifically for everyone sitting here because all of you guys have glasses. It says glasses and seizures. I had an eye test today. I never had glasses before, and they were showing me all these that cost hundreds. I know they usually cost that amount, but I can't bring myself to pay 300 pounds on something I might break next week. After seizures, I only drink out of plastic for a while because of how many things I have broken and hurt myself on. This may be a stupid question, but is glass near me my is glass near my eyes dangerous if I have a seizure? In the last year, I've broken a dryer, a freezer, a floorboard, the nice wine glasses. It goes on. Epilepsy is expensive. I'm not sure we don't all have perfect vision, so someone must have experienced these things.
Okay, flat out. Is this really a question that you need to be asking? I
Yes,
mean, now
yes, yes, yes.
this
Yes.
is the type of
Okay,
stuff
I'm gonna
I'm talking about.
chime in here. Wait, 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 wait. Okay, as
Okay.
somebody who has eyelid myoclonia and occipital seizures, I read somewhere else. I'm sorry, Rick, you have your hand up. I'll try to make it short. I've kept
No
remaining.
worries, no worries. You got it.
Thank you. You glasses can help seizures, and I'll talk about it after.
No, you go first. I got what I'm gonna say. You go first.
Okay, thank you, Rick. I don't know about glasses hurting you maybe. But Annie was saying that peripheral motion can trigger seizures for some people. And I've been talking to somebody also with occipital issues, and they say prism glasses can help the seizures. This isn't totally addressing their question, but I do think that they should see um, an optometrist. It sounds like they did, but I think glasses can help because if your eyes are aligned, you're not it's not as triggering. Yeah.
It's not making your brain work overtime, trying to focus.
What do you guys
Yes.
think with glasses?
All right,
So,
Rick, hold on.
all right. So first of all, there are other options to get glasses that are online, like there's Warby Parker, there's Zenni and whatnot, which is like a fraction of the price. So I understand their concern spending all this money. Number two, they have something called safety glasses. I wear these for work.
Uh-huh.
If I'm smart enough, I would have got it out. Oh, I actually have them right here. Look at this. Okay. So these are safety glasses where I could hit them with a hammer and they will not shatter.
Right.
They might break, but you really gotta really hit them hard. I work in a transmission factory, and I have to walk around with safety glasses. Some gear comes off and hits it, it's not going to shatter. So safety glasses. Number three, if you're busy trying to focus and try to read and try to, really force yourself to see, I could see that causing stress and possibly lowering your seizure threshold. So the person who posted it, work with your eye doctor, get yourself some safety glasses, and if it's too expensive, find a company that you can get it online at a cheaper price.
Tom, about these
Yeah.
glasses. You feel safe with glass near your eyes?
Oh yeah. And not only that, but these glasses, I mean, anymore these aren't glass.
Mm.
The glasses that we have are not glass anymore. They're plastic. They don't make I loved my glasses that did weigh about 2 pounds, but and you could feel it on your nose, but anymore these glasses, I mean, I could throw these on the floor, and because they, you know what, they even come with scratch resistant. But what I'm saying is, for you, I don't see a problem with having seizures and the glass breaking and getting in your eye. No, I don't see that happening.
Angel, you told me you broke your glasses a few times. How'd that go?
Yeah, invest in super glue and stuff to fix the
Heat gun.
frames. I'm lagging a bit, but
it's all right.
Are you going to sleep on us, Angel?
No,
Never.
I'm not.
Angel is the last one here every time. Me, Angel, and someone, or just me and Angel. Every time.
I've been having a bad connection today. I don't know if you hear me.
We can hear you all the time, but there's been a few times your face was frozen, but we could still hear you.
Yeah.
Yeah. I done broken my glasses a few times, and I just say invest in some super glue because
Super glue isn't going to make you able to see out of your glasses. But anyway, I'm speaking.
It'll keep the arms back together again.
Yeah. My frames are made out of Teflon. I can actually tie them in a knot.
So something else here. Seizures in the bathroom. Hi all. I saw a similar post from a few months back, but I was hoping to get more responses. I have had at least 10 grandma seizures in the bathroom. A few in the shower, a few outside it, a few looking at the mirror. Does anyone have experience more or less with any of these? Any ideas which could be causing it more than others? I'm wondering if it could be something with the lights too, or maybe time of day. Really strange stuff.
It might be a trigger, but I'm not sure.
Yeah, like looking in the mirror, I don't know, but maybe that might. I don't know in particular. I've heard about a lot of people just having them in the bathroom. I don't know if they were scared, or going through anything at the moment. But a lot of people were just sitting on the toilet or in the shower, most of them. This one, it says like, I'm not sure if it says, oh, outside the shower a few times and few looking into the mirror. Yeah, the few looking into the mirror, I don't understand. But we got Uncle Tom here. Come on, Tom. What do you think?
I missed it. I was answering something from Rick before he left.
Oh, okay.
Message from Rick. I'm sorry.
It's okay. I got you. It says, I saw a similar post from this a few months back, but I was hoping to get more responses. I have had at least 10 plus grand mal seizures in the bathroom, a few in the shower, a few outside it, a few looking at the mirror. Does anybody else have experience more or less with any of these? Any ideas what could be causing it more than others? I'm wondering if this could be something with the lights too, or maybe that time of day. Um, and when it comes to having experience with this, I could say not in the shower, but that's to my memory. That's not something that's you could really count on at this time. But
I think I've had a seizure in the shower one time because I can remember getting up off the floor, tangled up in a shower curtain. Um, that's the only time I can remember a seizure in the bathroom. But I don't know if I have, like I said, I'm here and there.
yeah, I've been told that I had to be picked up from in between the toilet and the wall once. I was told that by a couple different people. I'm not sure if it was different situations, but yeah. M?
I wasn't counting the time at work when I went into a bathroom stall to have a seizure.
So it's happened more than once.
So
Imagine
explain
having a
that, Tom.
seizure in a portal body.
Explain that, Tom. You went in a bathroom stall, not
Yeah,
the.
at work. Yeah. I felt one coming on. And I was either go in the office in a tight place or just go sit in the stall in the bathroom, have a focal, be gone for a little bit, and then punch out and go home. That was my thought process. But it didn't work out that way. I had the seizure, went out of the bathroom, and just started walking down the hallway. Tracy just happened to be at the end of the hallway going through the checkout and saw me. She said she saw me and knew I just had a seizure because she could see me pretty much bouncing off of the wall. So she sat me down and that's when people from the office come running out. Tom, are you okay? You all right, Tom? And of course I wasn't here for a couple minutes, but uh yeah.
Yeah, when you say bouncing off the walls, that reminds me of a time where I was walking and I just kept running into the wall. And then
That's
I
it, yeah.
felt like every direction I was leaning. When I lean
Uh-huh.
forward, I'm running faster because I'm trying to
Yeah,
stop
you're
my
moving
fall.
faster.
Or if I'm leaning to the right, I'm walking and hitting the wall back and forth. It's just I remember those times with no balance. But luckily those times were like in hallways where I was alone at those times. But go ahead, Em.
She's laughing at us.
Yeah. Sorry, I am. I sent you a link because I think you guys need to be in you need to get bubbles because you're bouncing off of shit. Oh, we lost Angel. I think that's upsetting and now I don't know
Angel's
what's
here.
happening. He's not here.
We need a
here.
book.
Oh, okay. Oh, I get seizures in front of mirrors. I thought I was the only one. It must be some weird eye thing. And so what I do is I turn on a light in a different room. Don't turn off the light. That will trigger a seizure. Um, yeah, we had these giant mirrors in our bedroom, and I finally was like, let's turn the mirrors around, and I've had less seizures. So it's probably the light and the movement. It's a fun one. It's good though because you feel better when you don't look in the mirror too much.
I like looking at myself because I look good.
Stop bragging. Stop bragging about your beauty.
Oh,
If I look
stop.
like M, I would like looking at myself too.
I'll tell you, I was going to say that too. If I looked as good as Ann, then I don't know if I would walk away from the mirror.
Do you know how much makeup I wear for these? Because this is the only place I go. You guys, you need full face of makeup, and you'll just stare at yourself and be like, "Yeah, take this out," but you'll look at yourself and be like, "I'm so fuckable."
Honey, if I can look at you the way you are, makeup or no makeup, it still looks good. And you're making my day, girl.
Thank you, Tom. That's awesome. I hope I'm not cussing too much. I know that I
Oh, you're all
don't know
right.
if that's allowed.
Hey, you
All
know
right.
what? If you heard the language that I hear every day, trust me, it's all good. You can't hurt my ears. Nobody can. It doesn't bother me.
I don't know why you guys have epilepsy like I could shock you with a cuss word. You just
No,
told
you
me you were
can't
bouncing
stop.
off the
Honey,
walls.
you don't know. You don't know who Tom is. You don't know my history, honey. Sure,
Tom's got a story.
I'm a religious
Oh,
person.
we
Yes,
want to know your
but
story.
there's nothing I haven't heard or haven't done. Uh, just because I'm a religious person right now doesn't mean I always have been. And so the things that I hear and do. Here you go. I went home to see one time because my mom said that she was going to have a party for when my wife and myself went back to meet her. My brothers were all around the table and the F bomb was just flying. I stood up and I said, "What in the world is wrong with you people? This is our mother sitting here at the table and you guys are dropping F bombs left and right." And my mom says, "Tom, calm down. I hear this more from these guys. More I heard it more at work." I said, "I'm sorry, but you raised me different from that." But anyway, to make a long story short, there ain't nothing I haven't heard, pretty much haven't done. So my virgin ears can't be hurt.
You're PG-13 next to Nicole.
There you go. PG-13.
Does anyone else get this feeling? Been noticing a feeling lately. I believe it may be tied to auras, and it might be a warning that I'm going to go into a seizure because I'm pushing myself. The best way I can describe it is it feels like one of those plasma balls going off in the middle of your head. It starts light and slowly gets cranked higher and higher on the dial till it becomes debilitating. It cranks the dial faster and harder. I push myself, or if there are additional compounding issues, like the heat or stress combined with the physical exertion. I also get these weird feelings in my limbs where it's almost like a pointed sharp blade, like a spear head being shoved down through the center of my limbs to the top, to the top, to the bottom. Does anyone else experience these similar? I don't exactly know what my auras are like to say that that's going on. I don't have the auras.
I
I
don't
just
have
have the
aura.
seizure.
Tom, do you have auras? I don't know
We,
if he can hear me.
You have auras?
we lost the pioneer.
He says yes.
Okay.
Yeah.
Did you hear what I was reading?
No. I've got to go, boys and girls.
All right. Angel and M. M needs some
Bye,
rest.
Tom. Love you.
Bye-bye.
M, you need to get some rest.
Yeah. I
Yes,
think
you
we
do.
all do.
Go ahead. You're off the clock.
And I've been having unstable connection, so
Yeah.
And I got my kids, so That's all 3 things. I see you guys Tuesday.
You're gonna hug them.
I'm not gonna hug him. I'm gonna turn this PlayStation on right here, and he's in the living room, and we're gonna play video games until 5 a.m. And tonight I have a seizure and probably sleep all tomorrow. So that's what's going on over here. Good
Been a
times.
great night, though.
Yeah, I'm not even sure what we're gonna play, but I'm gonna see whatever he's playing and just join him.
That's good.
He's gonna play Fortnite.
It's possible. When I turn on my PlayStation, it's gonna tell me what he's playing because he's one of my friends. I'm just gonna press join and then pop into whatever game he's playing. It's gonna tell him your dad's here, basically.
Nice.
Well, it's not gonna say your dad's here, but it's gonna have my screen name, and he's probably gonna be like, "Dad, what are you doing?" And then talking over the mic. And then yeah, he talks to me to where I have to mute my mic because it's echoing, or he'll come in here talking to me with the headset on, so I gotta mute mine because it's echoing. Oh, it's so crazy. But we have so much good times. Love him. I'm gonna go play with him right now. He just turned 11.
That's the good part about being a dad.
I love it. It's great, especially when the kids love you back, and then they don't think you're a shitbag. It's great, because yeah, I know some people who got daddy issues. I don't. I got past them. I got closer to them. Yeah. So you guys have a good night. Go get you some rest.
Yeah, you too.
Yes.
An
Try a
angel.
little bit. If I get tired, I'll go to sleep. But otherwise, I'm gonna be playing video games. Actually, I think I got a joint here. That might help. But you guys, yeah.
Pass it to the left.
I think I've had this joint sitting here for like 3 days. Yeah.
Hope it's not
You guys
stale.
are-
Oh man.
You know the rules. Puff, puff, give.
Nope. Smokes and I'm tired. I might want to go to sleep. Actually, I still might join whatever he's doing just to surprise him.
Oh, I know I'm tired. I took my meds a few hours ago.
Okay, guys. It was nice to hear Pookie talk for a little bit because you're usually chilling after the question. I think that's the most I've ever heard you talk at one time.
When I read the
Good.
long ones, I don't really remember. Like I said, I need you guys to remember. And once you guys start talking, then I remember what I just read. But if no one's going to talk about it, I can't just start because I just read a passage or novel.
I like it that we're evolving the podcast from just reading the questions to we're all talking about random things that are related to epilepsy,
Yeah.
but we're all talking about it, so we don't constantly gotta read from the epilepsy.
Where we get stuck at is when we have 4 to 5 people that can relate to something. So now they're having a conversation. And it's so interesting just to be like this.
Yep.
Yeah.
And then we get those questions that nobody relates to.
Yeah.
Oh man. Yeah.
Please take your medication as prescribed or whatever works for you. We're not doctors.